Good morning. I declare open this meeting of the Senate Community Affairs Legislation Committee. The Senate has referred to the committee the particulars of proposed expenditure for 2022-23 and related documents for the health portfolio and the social services portfolio. The committee may also examine the annual reports of the departments and agencies appearing before it. The committee would appreciate if senators could provide any written questions on notice to the Secretariat by Friday the 22nd of April 2022. The committee has fixed Friday the 20th of May 2022 as the date for the return of answers to questions taken on notice. Under Standing Order 26, the committee must take all evidence in public session. This includes answers to questions on notice. Officers and senators are familiar with the rules of the Senate governing estimates hearings. If you need assistance, the Secretariat has a copy of the rules. I draw the attention of witnesses to an order of the Senate of 13th of May 2009 specifying the process by which a claim of public interest immunity should be raised. Witnesses are specifically reminded that a statement that information or a document is confidential or consists of advice to government is not a statement that meets the requirements of the 2009 order. Instead, witnesses are required to provide some specific indication of the harm to the public interest that could result from the disclosure of the information or document. An officer called upon for the first time to answer a question should state their full name and position for the Hansard record, and witnesses should speak clearly into the microphone. Please make sure all mobile phones are switched off or turned to silent. I remind senators and witnesses that microphones remain live unless I instruct otherwise, for example, at suspension or adjournment. I would ask photographers and camera operators to follow the established media guidelines and the instructions of the Committee Secretariat. As set out in the guidelines, senators and witnesses' laptops, mobile phones, other devices and personal papers are not to be filmed or photographed. The Committee's proceedings today will examine the health portfolio and social services portfolio, beginning with the Department of Health, Corporate Matters. The committee has scheduled estimates hearings to further examine the health portfolio on the 6th of April 2002 and the social services portfolio on the 7th of April 2022. I think I said 2002 before. Today's hearing will follow the order as set out in the circulated program. The committee's scheduled break times are listed in the program or as required. Senators, departments and agencies have been provided with advice on the arrangements in place to ensure the estimates hearings are conducted in a safe environment. The committee appreciates the cooperation of all attendees in adhering to these arrangements. So I just need to also make a statement that on Wednesday, the 30th of March, Minister Colbeck tested positive to COVID-19. He is experiencing mild symptoms and isolating in accordance with the ACT guidelines. His staff have all returned negative test results. And as a result, I now welcome Senator the Honourable Linda Reynolds, representing the Minister for Health and Aged Care and the Minister for Senior Australians and Aged Care Services. So thank you for stepping in at short notice. I also welcome the Secretary of the Department of Health, Dr. Brendan Murphy, and officers from the department. Minister or Secretary, would either of you like to make an opening statement?
Senator.
Thank you, but no, Chair.
I don't, Senator Brendan Murphy, Secretary, but I believe General Fruin has, he's online. He's isolating in accordance with COVID isolation protocols, but he is online and is keen to make an opening statement.
Okay, thank you, Senator. Thank you, Senator.
General Fruin.
Thank you, General Fruin. I'll get it right in a minute. Thank you.
Hi, Beth. Yeah, I'm not COVID positive. We have a household member who is. Lieutenant General John Fruin, Coordinator General of the National COVID Vaccine Task Force. Good morning and thank you for the opportunity to make a brief opening statement. I would like to start by acknowledging the traditional owners of the land on which we meet and pay my respect to elders past and present. The National COVID Vaccine Program continues to offer vaccination to all Australians and support our efforts to respond to COVID-19. I am pleased to report that we have met significant new milestones in recent months. Australia is now over 95% fully vaccinated and we have passed 56 million doses administered. Since I last appeared before Senate estimates, Australia has risen from 8th highest fully vaccinated rate in the OECD to the 5th highest. Australia's vaccination program is ahead of countries like New Zealand, the United Kingdom, France, Italy, to name just a few. As outlined in my campaign plan, my aim when I was appointed as Coordinator General of the National COVID Vaccine Task Force was to ensure all Australians had access to a vaccination in 2021. The campaign plan also outlines that our aim was to reach national vaccination targets, including 80% fully vaccinated status. I'm pleased to report that Operation COVID Shield has met and exceeded these targets. 95.2% of people are now fully vaccinated. This is 19,618,907 people in Australia aged 16 years and older. The campaign plan also states that our mission is to deliver confidence in the vaccination program and regional support through the supply of vaccines. Over 25 million vaccine doses have been shared with our Southeast Asia and Pacific neighbours, and I continue to work with DFAT on the delivery of more doses over the coming months. Operation COVID Shield has also met the campaign targets of our sub-plans, particularly in relation to vulnerable and hard-to-reach cohorts. 90.9% of aged care residents and over 98% of aged care workers are fully vaccinated. 86.9% of disability residents, 85.4% of NDIS participants, and 94.5% of disability support workers are fully vaccinated. 80.1% of Indigenous Australians are fully vaccinated. 80.1% of 12 to 15-year-olds are fully vaccinated. We have met and exceeded these targets through our three streams of effort. We have coordinated vaccination efforts with states and territories, primary care sites and stakeholder groups. We have delivered vaccinations to over 10,000 sites and with targeted interventions to increase vaccination rates in hard-to-reach communities. We have motivated Australians to come forward and get their vaccination through general and specific communication campaigns. Boosters remain a key priority, and I'm pleased that over 12.9 million Australians have come forward for their booster vaccinations. 68%, over two-thirds of eligible people have now had a booster. In vulnerable cohorts, we have seen very positive uptake. 86.1% of eligible people over 60 have had their booster. 94% of eligible residential aged care facility residents have had their booster. The vaccination effort for 5 to 11-year-olds is successfully providing protection from COVID-19 to children across the country. Australia has one of the highest vaccination rates in the world, with almost 1.2 million children, or 52.3%, having received a first dose, and over 600,000 fully vaccinated, which represents 27.5%. We are ranked 5th in the OECD countries with children, outlining how successful this program has been to date. But I acknowledge there is more work to do in partnership with states and territories to further increase this vaccination rate. We've also been working with our partners to prepare for the delivery of a winter dose for adults over 65, Indigenous Australians over 50, and residents of aged care and disability settings. As a result of the infrastructure established under the vaccination program, with supply and vaccination sites readily available, we are well prepared to ensure all eligible people can access a winter dose easily and quickly. 4.7 million Australians will be eligible for this dose over the coming months. Finally, I acknowledge that many Australians have been through difficult times over recent weeks with the extreme weather events in Queensland and New South Wales. I want to thank my colleagues in Queensland and New South Wales Health for working with the Vaccine Task Force to ensure deliveries are managed, sites are supported with stock, and people can continue to get their vaccinations. Thank you again for the opportunity to make this statement, and I look forward to your questions.
Thank you very much for that. So we'll now proceed with corporate matters of the health portfolio. We've got a 30-minute time frame allocated for this, so who would like to start?
I have some good news. I don't think we've got any corporate questions. We were going to go straight into aged care.
Did you have any questions?
I haven't any corporates either. No, aged care.
We made them all come.
Can we just keep the corporate people for 5 minutes so that someone can send me a message if we've missed something? But I think we were going to go straight into aged care.
Okay.
There you go. Okay.
There you go. Well, in that case, we're ahead of time, and we're going to move straight into aged care. Outcome 3.
Scary, Wendy.
We're going to be out of here by lunchtime the way we're going. Okay, so we'll just let the rearrangement of officials for a moment. And so, Senator Watt, are you starting with questioning?
Sure. Thanks, Chair. Thanks, everyone, for joining us today. And thanks, Minister, for stepping in. We obviously all wish Senator Colbeck a speedy recovery.
Thank you. I'm sure he's watching. We appreciate that.
I'm sure he will. I'm sure he'll appreciate not being here today. Minister, did you see Anthony Albanese's budget reply last night?
I absolutely did, and can I say I was completely aghast at his approach for a centrepiece for Labor's policy. Everything he announced are things that we are already doing, and in fact I don't think he mentioned home care, which was incredibly disappointing, I'm sure, for the hundreds of thousands of Australians who are in home care. So if that was his test to demonstrate that he's suitable to become the Prime Minister of this nation, I think the nation was sorely disappointed, because every measure offered by Mr Albanese last night, this government is doing.
So I think your word was aghast. You were aghast at the aged care plan that Mr Albanese put forward, were you?
Well, in terms of the lack of substance beyond copying everything that we're doing. And in fact, I was aghast because where was home care? Perhaps Senator Watt, you can actually, did I miss the fact that he's got a home care policy? I don't think I did.
So what part of the plan were you particularly aghast at? Were you aghast at the requirement that there be a registered nurse on site 24/7 in residential care every day of the week?
Well, in relation to that, again, we're already doing it. Every single day in our response to the Royal Commission, we are implementing the recommendations, including 24/7 nurses for aged care facilities. But like everything else, it requires a plan. My understanding is that between 12 and 14,000 additional nurses are required to meet that. And the fact that you have brought it in by, I think, a year, again, just demonstrates how unfit for government I believe you are, because there is no detail about how you are going to do that. Maybe you can enlighten us today, because Mr Albanese certainly didn't do that last night.
Do you think, when was the last time you were in an aged care facility, Minister?
I haven't been able to go into one for a while because of my COVID status.
Mm-hmm. Do you think that residents, their families and aged care workers would be surprised to hear a minister of this government saying they are aghast at the idea that a registered nurse should be on site 24/7 in residential care?
Senator Watt, good try. I said I was aghast the fact that the lack of ambition in terms of, for his big centrepiece for this budget, he is Me Tooing, didn't mention home care, and I was aghast at the fact that he had completely forgotten residents in home care. And you put out a plan for the 24/7 nursing with no detail about how you were going to find the extra nurses. So at those omissions, absolutely I'm aghast, because again it demonstrates that you have no understanding of what it takes to deliver healthcare in this country, and particularly aged care.
We'll come to home care shortly, but I am aghast at the fact that a minister of this government, after the aged care crisis we've seen over the last year, would say that they are aghast at a plan being put forward to require a registered nurse on site 24/7 to give carers more time with aged care residents.
Senator Watt
to
is
pay
egregiously
aged care
misrepresenting.
It's your words.
I was aghast at the fact, where is your home care policy? You've put forward a plan. We are already investing $3.9 billion extra to go to 24/7 nursing. We are already implementing that plan, Senator Watt. You have, in your own words of Mr Albanese, you were doing that further and quicker, with no detail about how you're going to fund that or how you're actually going to, in a thin market already for nurses. We have a $3.9 billion plan to do it properly, to train, to recruit and identify nurses who are willing and able in our residential aged cares across the country. So we have a plan. We are already implementing it, Senator Watt. So please do not misrepresent what I said. I am aghast that you have no plan. Well, Senator Watt, what was Mr Albanese's plan for home care? I don't think he mentioned the words last night.
We'll come to that. I'm just putting back to you your own words. You said that everything in the plan that Labor put forward last night is something the government is already doing.
Okay.
So, hang on.
No, I'd be very happy to go through each and every item for you, Senator Watt.
Can I ask a question, please? You said that your government is already doing everything that Labor put forward. So you're telling people that there is already a registered nurse on site 24/7 in every residential aged care facility, is there? Because if you think that, then you clearly haven't been to a residential aged care facility for a very long time.
So, Senator Watts, this is going to be a very long morning if you keep willfully misrepresenting
I'm happy for people to
everything
look
I
back
said.
at what you said.
So, Chair, the question was, what has the government done in all of these areas from the Royal Commission? So let me, I'd be very happy to go through and let Senator Watt know. So for the 24/7 nurses for aged care facilities, the Morrison government does absolutely support that goal. And
why haven't you done it?
but we are supporting the time frame recommended by the Royal Commission, which I understand is in 2024.
Can I ask you
Now,
to point to me where in the budget
Chair, it'd be
papers,
good if I could answer the question.
where in the
Respect
budget
both ways.
papers
I've
are
asked
you
it.
funding?
Senator Watt.
Allow me
Senator Watt.
to finish.
I asked the minister to let you finish your question, and I expect the same in return.
Thank you, Chair. So we are adopting, and we have already said, and we are adopting the Royal Commission recommendation in terms of their time frame, which is the time frame we believe it is possible to recruit, train and identify the numbers of nurses required, the RNs, to do that. We're investing $3.9 billion in funding to support the increase in nursing and the direct care requirements. So we are already doing that. The only difference is you said you're going to do it, as I understand, a year earlier without providing any detail about how you are going to get an extra 12 to 14,000 registered nurses to do that. We have adopted what the Royal Commission has recommended, which we think is already ambitious, but it is achievable. And we've put $3.9 billion to achieve that.
Are you aghast at this idea that a government should fund carers so that residents receive 215 minutes of direct care a day? Does that make you aghast as well?
We totally believe in raising the standard of care to 215 minutes a day, and we are already implementing measures to achieve that, Senator Watt. So we absolutely support that. So we have publicly accepted the Royal Commission's recommendation for an increase in the aged care minutes, and we're responding through measures to the residential aged care services and sustainability funding drive to do that.
Can you show me where...
So from the 1st of July, allow me to finish, you've asked the question. So from the 1st of July 2024, the minimum staff standard should increase to require approved providers to engage registered nurses, enrolled nurses and personal care workers for the average resident for at least 215 minutes per resident per day. And this is backed, again, by that extra $3.9 billion in additional funding.
Can you show me
We are also supporting our nurses with a wage bonus to attract more nurses into aged care.
Can you show me where in the budget papers your government is funding an increase
For that, I will
to
turn
215 minutes of direct care a day? Because you're telling us that everything that was announced last night is something your government's already doing. So please show me the page.
I might actually go to Mr Lai to go through the detail in the budget papers.
Michael Lai, Deputy Secretary, Ageing and Aged Care Group. Senator, the government's response to the final report of the Royal Commission looked at the 142 recommendations and accepted 126, or in either accepted or accepted in principle. There were 12 that were subject to further consideration, or no, and one accepted to subject to further consideration, and 4 noted as supporting an alternative approach because commissioners had slightly different views on some things. And there were only 6 recommendations that were not accepted. The 215 care minutes and the 24/7 nursing recommendations were supported in principle or subject to further consideration by the government, and that was because it's very, very difficult to ascertain where the sector currently is in terms of care minutes, and so in adopting the 200 care minutes, which is the first requirement of the Royal Commission, which was funded in last year's budget, not this year, last year's budget, and funding will flow from October this calendar year, that the government would monitor the uptake in terms of the care minutes and also the nursing hours, because the first requirement was around 16 hours of 24 hours a day. and then make a judgment about what the gap was, because it's very difficult to ascertain what the gap is between 200 and 215 and 16 hours and 24 hours. So that's the way in which the government is dealing with the recommendations from the Royal Commission.
The,
Chair, just on that,
can I just point of
can I
order?
just remind-
Point of order.
Sorry,
Point of order.
Senator Watt asked a question now.
Point of order. Chair, can I just point out that if we continue to get long answers, that's going to make it really difficult if we're in 15-minute blocks with a short amount of time. So if we can just ask.
Okay, so those, you make a valid point, Senator Watt. So we will ask that everybody try and keep their answers succinct as well as the questions succinct as well.
So again, Minister, you're claiming that Labor's aged care plan is simply doing everything the government's already doing, but the government's budget papers last year provided funding to increase the amount of frontline care or care minutes by the 1st of October 2023, and that would be 200 minutes per day. So you actually aren't committing to 215 minutes per day, are you?
No, we absolutely are, from the 1st of July 2024.
So people have just got to wait nearly till the next election before they see anything from your government.
Senator Watts, this is the difference. This is one of the many differences between your side of politics and ours, is we have watched very carefully and we have followed very carefully the Royal Commission recommendations. And we're talking about the 24/7 care, the nurses. Well, Mr Albanese, 2 months ago, said that you can't just procure nurses out of thin air, and it takes time. And last night, he went completely opposite that. He said he's going to somehow find 12 to 14,000 nurses a year earlier than the Royal Commission recommended, with not a single costing or detail on how he was actually going to do that. And that is what I'm aghast at, because it is a con on the Australian people, pure and simple, when he 2 months ago said that it was not possible to procure nurses.
Did you? I mean, we could go into whether the government's cuts to training had anything to do with that, but we'll leave that to another time. Did you happen to hear the interview with former Liberal Premier Mike Baird on Radio National this morning?
I did not know.
Let me tell you a few things that Mr Baird, former Liberal Premier and now head of Hammond Care, an aged care provider, said. He was asked, what does he think of Labor's plan for aged care? His quote, "I do think it's a good plan, Patricia. This is a pretty significant day for the sector across many levels. What we're seeing, in summary, is more care workers, we'll see more nurses, and finally recognition that our care workers have deep value." So what does it say that a former Liberal Premier who now runs an aged care provider says that Labor's plan is a good plan, but you are still aghast at it?
Senator Watt, as I said at the beginning, everything that Mr Albanese said he would do, this government is already doing. So Mr Baird is actually congratulating also this government, because we're not just talking about it, we are actually doing it. But we are also doing home care, and Mr Albanese did not mention the words home care last night that I heard.
I think that anyone who has...
Finish your answer.
I think that anyone who has family in aged care, anyone who works in aged care, would be pretty astonished to hear a minister from this government saying that the government is already putting registered nurses on sites 24/7, increasing carer time to 215 minutes a day, supporting a pay rise for aged care workers, insisting on better food for residents, and requiring more transparency. Again, when was the last time you checked whether any of these things are actually happening in aged care? I appreciate you're not the minister and you're stepping in today.
Let me put it this way, Senator Watt, is this government, under this minister, has done an outstanding job on reviewing and implementing and funding the Royal Commission recommendations. I think we all acknowledge that the Royal Commission that we instigated has found many things that do need to be addressed. We all acknowledge that. But the difference for the Australian people is we are not only funding it, but we are implementing it in a responsible way in accordance with the Royal Commission guidelines. Because sadly, Senator Watt, you know, we can't just procure 12 to 14,000 registered nurses overnight in a thin market. We know we have to develop it, and we are doing that in accordance with the Royal Commission timeline. So we all acknowledge that there is a lot of work to be done in the sector. And that is why we've invested over $18 billion and we have a clear pathway. Now, if Senator Watt would like, I will happily go through each and every one of those things he has mentioned to actually confirm what the government is already doing.
I suspect
Well, on
he's
that-
going to say no, and this will be your final question out of your
Could I just
first
ask
first
two,
block.
please?
All right, two, and
Mr.
then-
Lai, can I just
have a look.
confirm, I think what you said before was that that the idea of 215 minutes a day for personal care and 24/7 nurses was subject to consideration?
I think Senator corrected. I couldn't remember whether it was accepted or for further work, and I'm pretty sure that was accepted. I can double check for you.
Okay, if you can come back to us on that.
Chair, can I just, I understand, so while I didn't hear Mr Baird, I also understand that there was a significant part of what Mr Baird said that Senator Watts forgot to mention.
I was going to come to
he
that.
did actually acknowledge that this government have already made a significant investment in aged care. So I think that was an important little bit that Senator Watt forgot to share with the committee here today.
Well, I was giving you some of his quotes. Can I put another one to you? So you say that the government is already doing these things, but we've got Mr Baird, former Liberal Premier, who now runs an aged care provider, frankly knows more than you or me about aged care. He says, my hope, of course, is that the federal government also matches this. What is obvious, it's obvious to me that they, the government, should back it, Labor's plan. So if the government is doing everything that's in Labor's plan, why does former Liberal Premier and now head of an aged care provider, Mr Baird, say that you should match it?
Senator Watt, a couple of things.
Is he wrong?
Senator Watt, that there is so much wrong with what you've just said for the Australian people. Let's start sort of unpacking some of
Mr
that.
Baird is wrong.
So, first of all, you are not delivering, we are not delivering your plan. We are already delivering our own plan, a 5-year plan fully funded by over $18 billion.
And it's going so
let's
well,
just
isn't
put
it?
that on the record that we are already
It's going
implementing
so well.
this.
Aged care providers continue to cut
And
corners on food.
what Mr
It's going
Baird
so
probably
well.
doesn't know is that your plan last night said nothing about home care.
Oh, so Mr.
And that
Baird
is what I'm
is
aghast
ignorant,
at, and that is a disgrace for people in home care.
So supporting a pay rise won't help
So, Senator
home
Watt,
care
let's get the
workers?
facts right. Can I ask, given the questions from Senator Watt about our plan and what we're implementing, it actually makes me wonder, have you actually read the government response to the Royal
I
Commission?
have. Have you?
Absolutely. Absolutely.
So
And
why-
had,
if
you,
it-
had you actually read it,
Pull it up there
had
if
you
that's
actually
okay,
read
we're
it,
running
Senator Watt,
time.
you would have actually seen that we are already implementing this. And have
Is that why aged care
$18
providers
billion.
continue to cut corners
The
on
big
food?
difference is we are not promising to do things that simply cannot be achieved. That Mr Albanese also acknowledged you cannot procure thousands of nurses overnight from thin air in a thin market. And I'm sure had Mr Baird read that, he would also absolutely know that you cannot do that without impacting on other residential aged cares, particularly in regional
Poor
Australia.
silly Mr
Senator
Baird.
Watt.
Poor silly Mr Baird. He's only been a
Hand the
Liberal
call to
Premier and
Senator
aged care.
Rice now. Thank you.
Thank you, Chair. Thanks, Minister. Minister Hunt's budget night media release had the new total that government are now committing to aged care funding as $18.8 billion. That's the accurate over 4 years. So that's so over 4 years, 18.8 billion. So that comes to $4.7 billion a year extra.
I just might check with Mr Lai. I believe that's the case,
Yeah,
but I'll
approximately,
just check.
Senator, but that's approximately.
Approximately correct. The Aged Care Royal Commission identified a funding gap of $10 billion a year. They said at present the Australian government contributes around $20 billion each year to the cost of aged care. Under our proposals, that amount is likely to rise to a figure of at least $30 billion. So your commitment of $18.8 billion or $4.7 billion a year, do you acknowledge that still falls short by about $5 billion a year compared with what the Royal Commission were recommending?
No.
Well, Senator, one
No.
comment that I would make in the work we've done to go back through looking at the Royal Commission recs, I think they added a whole lot of things together, and when we came to look at the interaction of some of those items, that dealing with, for example, funding uplifts in residential aged care, that effectively I think that figure might have double counted some funding uplift that was needed. So, I mean, our judgment was that the $10 billion was a figure that hadn't taken that into account in our work.
So have you done an analysis then? I mean, have you challenged that figure from the Royal Commission that you actually don't need an extra $10 billion a year?
Nick Hartland, First Assistant Secretary, Home and Residential Division. I don't have that text of the Royal Commission in front of me, Senator, but they didn't produce a formal costing of their recommendations. I think the $10 billion figure was a figure that we disputed at the time in our evidence about the difference that aged care would have had if some parameters from the 80s had been kept in place. So it wasn't costing.
Sorry, I missed that.
Yeah, and I might not have been clear, excuse me, early in the morning. So the Royal Commission didn't publish a costing of their recommendation. So the $10 billion figure is a different figure. It was a figure that was derived by assuming that the policy settings from the 80s had been maintained in aged care.
And so,
Commission figure is a guesstimate. It's not a reliable measure on the...
It wasn't a costing.
no, but it was their estimate. So what I want to know is then, in terms of implementing the
No, it
Royal
wasn't an
Commission's
estimate of the
recommendations.
impact of their recommendations.
And so, Senator,
It said, I mean, it's pretty clear. What they said was that under our proposals, they said that the Australian government's currently contributing around $20 billion a year. Under our proposals, that amount is likely to rise to a figure of at least $30 billion. So if you were challenging that you need an extra $10 billion a year, have you got have you done the detailed assessment as to what the actual costs of implementing the Royal Commission's recommendations are likely to be if it's not going to be $10 billion a year?
We've done a costing of implementing the government's response to the Royal Commission, and that's the $18 billion figure.
Right, but that's very different from implementing all of the Royal Commission's recommendations. So basically you're saying that you're not going to... So other than what you agreed to, you're not going to implement the rest of the recommendations?
Well,
that's not the case. I think I gave you I won't repeat the stats of the recommendations that are accepted. So there's work happening on all of those. I think in the 22-23 financial year we will spend $30.1 billion, and in 2025-26 it'll be $34.7 billion. But I do come back to that. I think that Dr. Hartland's right about the Royal Commission costing process, but when we looked at all those recommendations and put them together, because some things some of their recommendations attack similar things, and so when you put those things together, we couldn't get to the same anything like those figures.
Well,
so.
Do you have the details of that? Can we see that detailed costing that you have of what the cost of implementing the recommendations is going to be?
Probably best to take that perhaps on notice and get to the detailed breakdown.
Oh, that's
We've
going to be very
costed- we've
helpful
costed the
when
government's
going to be an
response to
election in a week's time.
sorry, we've costed the government's response to the Royal Commission, and that's been published.
And basically, so in terms of the government's, but that's not the costing of the implementation of the recommendation of the Royal Commission, is it?
No, it's the costing of the
So
implementation.
it's essentially
of the
saying
government's
that the
response.
government is not committed to implement all of the recommendations of the Royal Commission.
Well,
Senator Rice, I think that is an incredible
I don't.
misleading.
I mean, you're telling me that the Royal Commission identified a funding shortfall of around $10 billion a year. You are saying that you've costed the government a response that's less than that $10 billion. There's a shortfall. There are things that you haven't committed to.
Senator Rice, I think, to put it simply, while this is not my portfolio, my take on what the officials' response was is that you are comparing apples with oranges in terms of figures, to put it simply. Is that you're not comparing like with like.
I think we've got, you know, both apples and oranges, which were recommendations in the Royal Commission that the government has not committed to fund. Hence you are not committing to fund that full
Mr Ly's
shortfall.
figures were there. Mr Ly's figures were already indicating.
Well, and I think our, you know, so that you have the 6 recommendations, I think, that the government didn't accept. Now, most of those are in the means testing space, so, you know, and there's some recommendations which were dual recommendations from commissioners. So the response that you've seen reflected in the 2 budgets is really the costing of the government's response.
Can I go back to the commitment to the 24/7 nursing care? So basically, I mean, that's one area where you have, by not bringing that in for another 2 years, you're basically cutting the costs, aren't you? We're not going to have to cover the cost of that for another 2 years.
The Royal Commission recommendation was that 24/7 be introduced in 2024.
And that's, Senator Rice, what we've just been discussing with Senator Watt, is that we absolutely agree, we accept, and we know we need more RNs, but the real issue is not about the year we fund it, is actually how we identify, train and grow that capability so that we can do that. And we have appropriately funded it in accordance with, as I said, a quite ambitious but achievable timeline that the Royal Commission has set. So we're funding what the Royal Commission has recommended.
Going to the other big chunk of the increase in funding for aged care workers in the Fair Work case at the moment, and the request for a 25% increase in the funding for aged care workers, which certainly we as Greens have put on the record that we support that. The government hasn't committed to support that, have you?
Well, Senator Rice, as you know...
And an increase I'll just continue, and just acknowledging that increase in funding for workers was one of the recommendations of the Royal Commission.
Well, Senator Rice, we support the Fair Work Commission's deliberative processes, and once they have made a determination, we will review that in the normal course of events. And don't forget, this was, you know, a commission set up by the Labor Party, and we will follow their processes. And they haven't made a determination, as I understand. So when they do, we will review it and come to a position.
Do you know when is that determination expected?
I might have to seek some...
Eliza Strapp, First Assistant Secretary, Market and Workforce Division. So the Fair Work Commission hasn't indicated when they're likely to make a decision. They've just announced submissions and then hearings up until July. So we don't have a time frame for when they expect to make their determination.
So can I just ask? But you didn't see any need to put any form of contingency in the budget to cover those increased costs once that determination is made. I mean, it's pretty clear what we know about the incredibly low wages of aged care workers who work tirelessly, are paid absolutely a pittance, that there will be a recommendation to increase
Senator
their
Rice,
wages.
but Senator Rice, there is a process in train, and not just for this particular profession, but for many, and we will wait for that process to have its course. Once they've made a determination, we will review that. And of course, if we are re-elected, there are many opportunities through the budgetary process, through my EFO submissions, to do these payments. And so this will follow the normal course. I mean, we are many things, but we're not mind readers in terms of what the Fair Work Commission will determine, and we'll do that at the appropriate time.
Given how central the wages of aged care workers are to having a good quality workforce, the government didn't see a need to even include any contingency to be covering increased wages.
Well, Senator Rice, we don't have a determination yet, so when we do, as we always do through the budgetary process, we will review it and act at the appropriate time.
And meantime, there's no commitment.
Mr Lai did, I think,
just that, Senator, I think we've given evidence before to this committee that the department doesn't assign money for contingencies. That's something that's done by a central agency. So where there are uncertain costs, unknown costs, because we don't know what the Fair Work Commission result will be, that other agencies look at those things and make provision where they deem it appropriate.
I'm surprised. I mean, I've only been, had the aged care portfolio for the Greens for less than a year, but in other areas of government there are contingency payments that are in the budget for all sorts of things where you don't know what the costs are going to be. There are many infrastructure projects where there is a contingency payment and, before the business case has been done, before you know what the full cost of the project's going to be. I don't understand why in aged care, when we're dealing with some vulnerable older Australians and some of the most poorly paid workforce in the country, why the government couldn't do the same.
Senator Rice, that's why we don't just have a budget in the budget process. We have other opportunities throughout the year to get supplementation. So we can't ask for supplementation until we've actually had a chance to assess. So there is, in the budget process for government, there is absolutely opportunities throughout the year to do that, and that is what we do as a matter of course. And this is no different, Senator Rice. So we all know and we all agree of the incredibly important work that aged care workers do. So that is why we will wait till the Fair Work Commission has made a determination, and then we will take the appropriate action within the budget process.
To me, the best way of actually saying that you value those workers would be to say that you are committed to cover the required increase in wages. I want to go to the other...
Can I just clarify one thing on that?
Yeah.
Sorry. Minister, can I just clarify your position on the Fair Work Commission case? I think what you said was that once the Fair Work Commission hands down its decision about a pay rise for aged care workers, the government will review it and come to a position. Is that essentially right? So you're not prepared to commit that the government will pay the pay rise that the Fair Work Commission hands down?
Senator Watt, I'm many things, but I'm not a mind reader, and we will absolutely adopt the normal processes that we have for many years with Fair Work determinations that impact on government payments.
So people will just have to wait and see as to whether your government...
Hanging.
Senator Watt, as I said...
These most poorly paid workers in the country are left hanging.
Senator Rice.
So I'm being spoken over by two senators now. So we very clear. There is a process in place that you put into place through the Fair Work Commission, which we support. We will wait for them to do their work. They'll make a determination. We will review it. And then we will take whatever position we do after that review, as we always do, through the normal budget process.
So aged care workers will need to wait and see as to whether your government would fund a pay rise.
Well, Senator Watt, this is the process you put in place, and it is the right process that the independent umpire makes does considerations, they make a determination, and then the government will review that.
But you could commit
Can I
to do
have
it
a couple of
before
extra
Labor.
minutes, given that Senator Watt seems to have taken over my call at the
has the
moment?
call
I
for
did
the
want to
last
go to,
question.
given how awfully paid aged care workers are at the moment, one token way that the government was trying to address this was the two bonus payments that were announced at the end of January that were totalling up to, the grand total of $800, way short of what's required in terms of an overall ongoing permanent wage increase. And then we've got information that, in fact, not all of aged care workers have actually received those bonus payments. Can you tell me, please, to date, how many providers and what proportion of providers have applied for the first round of bonus payments?
I will, on this, have to defer to Mr Hartland. But can I say, Senator Rice, $18.8 billion over 4 years is hardly a token.
No, in terms of I'm talking about
Dr.
wages for these most incredibly poorly paid workers who are doing the most important work and tirelessly working incredibly long hours, working incredibly hard, particularly during the pandemic. And yet what they've been offered is $800 rather than a proper increase in pay. So can you please, the ABC reported that there'd been 650 applicants out of an expected 1,600. Is that accurate figures?
Dr Hartland.
So as of today, we've received, let me go back a step. So the process is that it's a grants process. So we open a grants round with guidelines about what's covered. Providers apply. We assess the grants. if they meet the criteria for the grants, we make an offer to them. When they return it, they're paid. So just in terms of those steps, we've received 870 applications and we've offered around about 499 agreements.
499 out of 870, and it would be an expected 1,600 potential applicants in terms of aged care providers?
Yes, that's about what we're expecting, I believe.
So even of the ones that have put in their applications, it's still only just on half, and you have still only processed 500 out of that expected 1,600.
Well,
so these aged care workers who you're not committing to give them their increase in wages, you announced that there was going to be an aged care bonus, but then that was in January. We're now in April, and so we've got only 30% or something have actually had those potential bonus payments processed.
Well, I mean, the process, as I said, it's a grants process to providers. So we are working, as soon as we get applications from providers, we process them as soon as we can and offer them back. So the system can move as fast as providers record the information and produce a grant. So
that doesn't help the workers, doesn't it? If their providers are slow to make their application.
Well, we would encourage providers to do it as quickly as possible.
Doesn't help the workers.
Well, it's the way the previous bonuses have been paid, and the timing doesn't appear to have been a problem. But people will get paid as soon as their providers
do you
launch an
expect
application.
all of those 1,600 to eventually apply for the first round of bonus payments?
Yes, we do.
And when do you expect, in terms of that, you've said 499 out of the 870, when do you expect all providers who have applied for the rest of those first round ones to actually be processed?
I think, we'd be expecting to be sorted in a couple of months. That would be consistent with the previous grant process.
So we've got $800 and basically it's going to be 6 months for a lot of them before their provider gets it. And do you then track as to when they actually then pass on those bonuses to their workers?
I didn't say 6 months, Senator.
But
so
when the providers
we would expect by around about the end of April that we.
And do you track though? So that's giving the money to the providers. Do you track when they then finally pass on the money onto the workers?
So the grants require them to pay it within 2 pay cycles. But we've encouraged providers to pay it as quickly as possible, and we have an audit process to make sure that the funding actually flows to workers.
Senator Rice, I need to pass on to...
Senator, some providers can actually choose to pay the bonus in advance of getting the grant. They're not, if they've got the cash, so some of them have done that.
But a lot haven't, have they?
Senator Smith.
They're operating absolutely...
Senator Rice,
money in, money out.
Can I just add to that? I think the context of this is really important, and the way Senator Rice has portrayed it, I think, is somewhat misleading. The government's invested over $650 million in this bonus, and that is hardly a token amount for Australian taxpayers. And in relation to workforce, in the last 2 budgets alone, we put in an extra $1 billion to support various workforce measures. And again, we're investing over 4 years $130 billion into the aged care sector, including the $18.8 billion in response to the Royal Commission.
And yet how central
this government
is
absolutely taking this seriously, and we are implementing all of the measures that we've talked about across 5 pillars in accordance with what can actually be implemented, unlike what Mr Albanese talked about last night for nurses is completely unachievable. And in fact, it's quite...
Okay,
and yet,
because
of poor conditions, poor
Senator
wages,
Smith
we've got over a third of all aged care workers planning
Senator
to
Rice,
quit the sector in
Senator
the
Rice,
next
your time's expired. Senator Smith.
Great, thanks very much, Chair. I just want to take us back to the beginning, if we can. So the government has a 5-year plan valued at $18.8 billion. We're into the first year of that plan, Mr Lai. So can you step us through what initiatives have been taken in that first year of the 5-year plan?
Yes, Senator.
And I do want to come specifically to workforce issues. So if there's an official that can support you in that, they might like to come to the table as well.
There is.
Yep.
So you're right, Senator, a 5-year plan, and I think that obviously the Royal Commission identified, serious concerns with the aged care sector, and so that response is both a large one in terms of investment, which now stands at $18.8 billion, but also, a complex set of reforms, because we're doing everything from rewriting the Aged Care Act to, completely revamping the way in which we regulate the sector. And so the current budget advances another 10 recommendations from the Royal Commission, and I'd just highlight probably one of those, which is an investment in pharmacy assistance, which will bring pharmacy, either the employment of a pharmacist into residential aged care, or a visiting community pharmacy into residential aged care, and it's really critical investment because we need to have a much more sort of nimble and ongoing monitoring of medications in residential aged care.
In large part because people are coming into residential aged care with higher levels of frailty.
That's correct.
And higher
the acuity
needs,
of
medical
aged care residents has increased considerably. And obviously what we don't want to see is the practice of someone coming in with medications and that not being reviewed on a regular basis. But in terms of the rollout, obviously, significant progress in terms of the rollout of the 80,000 additional home care packages. I think we're at... I think we're at the 20 or 30,000 additional packages 30,000 to 29 March released of those 80,000.
What do you make of Mr Albanese's decision not to mention home care at all last night?
Senator, I wouldn't comment on...
That is the correct answer. I was being
testing me.
Yep.
And so, that's obviously important with the large increase in the ageing population and our desire to ensure that people have assistance in the home where they want to be as long as possible and the right kind of support, so that introduction of additional home care packages is making a large dent in previous waiting lists for home care. The uplift in the basic daily fee, investment in residential aged care has been important. That occurred from 1 July last year, and most importantly, it's tied to people reporting on the amount they're spending on nutrition. And for the first time, we're making those results public now. Clearly, in some cases, people have deployed that additional investment directly into improved nutrition for their residents, and in some cases, though, some providers are below that average, and so, those providers have been referred to the Quality and Safety Commission. So, are we happy with where the investment by the sector in nutrition is today? Not completely, no. But for the first time, we're shining a light on this.
It's probably more transparent than it has been in the past as well.
That's right. Yeah, I think in this area, whether you look at this area, the use of chemical restraints. For the first time, we are making public the information that we're collecting from aged care providers, and they will be held to account for their practice. And the idea, obviously, is to eliminate, as best as we possibly can, the use of chemical restraints in aged care, like they do in disability. And so this making information transparent.
Greater levels of awareness will always lead to greater reporting. I think that's the sequence of events, and that greater reporting provides much greater transparency, and therefore other parts of the aged care system can respond to that. I agree.
A couple of other things that I would point to, Senator, would be there's a significant investment in workforce, but I will allow Ms Strapp to talk to that, where we're working through the introduction of a new AN-ACC classification for residential aged care, which is due to begin in October, and the budget announced the starting price for that. That's a major change in the way services are funded under the current ACFI services, under the current ACFI formula. services can review their allocation, and we are removing that from providers and making sure that it's based on an independent assessment, and that assessment actually better reflects the care needs of residents. And so that is a significant change. And when that comes in October, it'll be accompanied by additional funding for providers to achieve, on average, 200 care minutes for residents. And so again, the changes are accompanied by additional investment. A significant amount of work going on in terms of the relationship between aged care and the other parts of the health department, particularly primary care. So making sure that particularly people in residential aged care have access to appropriate health services. And in the budget, there's a new trial of hospital-led multidisciplinary outreach services, which will bring gerontologists and other health professionals into residential aged care. And the aim of that is to obviously to lift the level of expert care that people receive, but also to reduce their rates of hospitalisation, which is an issue. So I might stop there.
So then,
Workforce?
workforce, yes.
Strap can talk to workforce.
Hi, Senator. So on...
You're familiar with Mr Albanese's comment in February that even he admitted that you can't you can't train an aged care nurse overnight?
I'm not, but I can certainly run through all the government's workforce measures. So this week the government released its aged care workforce action plan, which details it's around 1.4 billion of workforce measures that have been announced over the last few years. So that includes measures that are aimed at growing the workforce, such as we've just announced the successful providers for the home care workforce support program. That's $91 million, and that's commenced now, aimed at growing the personal care workforce in home care by 18,000 personal care workers over the next 2 years. As well as that, we've got the aged care nurses bonus. This is on top of the bonuses that Dr. Hartland spoke about earlier. And that's up to $6,000 for registered nurses, aimed at attracting them in, but also retaining registered nurses into aged care. And part of that, up to $6,000, includes for nurses who are in regional and remote areas, noting that we know a lot of providers are struggling in regional and remote areas to attract nurses. So that's aimed at that. One of the budget announcements is also around providing support for clinical placements for registered nurses, and also for allied health, noting that we get lots of feedback from providers about the difficulty having staff available to supervise student placements. So putting that wraparound support and encouraging providers to bring student nurses in. We know that the pipeline of nurses is from graduate nurses and people coming through university, and that's also new workers as well. With personal care workers, we want to attract new people in and also retain them. We've got as well as we've just announced an additional 15,000 training places. So that's the Certificate 3 in aged care, which that's growing it to 48,800 training places. So that's aimed at bringing new people in as well. That's already the 33,800's already commenced. This extends that out to the end of 2023 and provides more additional training places. And so the Department of Employment has signed agreements with state and territory governments to start rolling out those training places and encourage people to get their Certificate 3, have high qualified people in aged care, both for home care and residential aged care. We have the Aged Care Transition to Practice program, which is aimed at supporting registered nurses, giving them the support that they need, particularly graduate nurses, when they first start. We know that it can be hard. You're often the leader in a aged care facility when you're a registered nurse, so providing that additional support and encouraging them to stay, and also saying that they've got a career pathway. And then the last thing I'll mention is the Workforce Advisory Service, which started last year, and we've got around 120 providers that are using that at the moment, and that's aimed at giving support to providers to understand all the supports that they can provide their workers. Knowing that there are training support, helping them with recruitment, helping them with the career planning for their workforce, identifying gaps in their workforce, and assisting them to plug those gaps.
And there were, in the budget recently, Senator, there was also announcement of some funding to train nurse immunisers and infection prevention control nurses in residential aged care facilities, so that we can train up independent immunisers to provide immunisations in every aged care facility, and to repeat the very successful training program for infection prevention control nurses that was rolled out a year ago, and now to create a whole new tranche of IPC trained nurses in aged care.
The government has a commitment to introduce 24/7 nursing in accordance with the recommendations of the Royal Commission. Is that correct?
Our response to the government's response to the Royal Commission accepted that recommendation, and noting that the Royal Commission's recommendations was a staged approach.
Yes.
So building from the 1624 or mandated in 2023, and then the 24/7 in 2024.
What are the risks? No, you can't. No, I don't consent to that.
Where is that?
So I'm just curious to know, Ms Staples, what are the risks in bringing forward a 24/7 nursing initiative, in accelerating its implementation?
So we know, even though there's a growing number of nurses enrolling and graduating, we do know that there is a shortage of nurses, and that providers are finding it difficult to recruit registered nurses. We think we need around 14,000 extra nurses next year to meet the 16 hours 24 and the 200 care minutes. That's substantial. So the risk is that we can set a mandated amount for providers, and they might, and particularly providers in regional areas, may find it difficult to meet those mandated amounts. But also noting that it's an average per facility, but I would say that particularly for regional areas, there's a risk that they won't be able to meet that mandate.
I might come back to that in a few moments, actually. Have I got more time?
You've got one more.
One more. So when we look at the specific workforce initiatives, just in terms of a headline figure, a couple of times you mentioned 33,800 supported training places through negotiation with state governments. Can you just run through those headline figures again in terms of the number of aged care workers that are expected to benefit from the various...
Yes, yep.
You did mention them in your narrative, but I thought you might just give them to me sort of bullet form.
The Home Care Workforce Support Program is intended to support grow the workforce by 18,000 personal care workers. We're expecting with the nurses bonus, that's going to impact about 20,000 registered nurses. There's 48,800 training packages under the Job Trainer program. Good question about the training for nurse administrators is 4,000. We'll train 4,000 registered nurses. Prevention, protection and control will train up to 2,907 registered nurses. Bear with me. And then I think it's a couple of hundred with the Workforce Advisory Service providers that will be impacted by that or have access to that service if they wish.
Okay, I do have some other questions, but I'm happy to.
Can I just, before we go back to Senator Watt, just clarify something regarding the 24/7? You said that it was being implemented progressively in line with the recommendations. Has the department done any work to actually analyse how many of the smaller providers in regional and rural Australia would close if that was enforced any sooner? Because obviously some of the really small ones would really struggle to manage to staff that.
We haven't. We haven't done any analysis of that, any detailed analysis of where those are. I think we're coming from experience of working with some regional providers at the moment, and it's not just aged care, it's also health services. We're doing a lot of work with state and territory governments
NDIS.
where they're experiencing the same issue, recruiting registered nurses. So it's targeted at the moment, but we haven't done anything broader.
So it would be obvious to say that if we were trying to bring it forward even faster, which has been proposed by the opposition, that there could actually be closure in regional and bush areas, regional and rural areas, of some of the smaller aged care homes.
Certainly we haven't done an analysis,
haven't.
but I mean, I think what Ms Strapp's saying is that in looking at vulnerability, which is market-based, thin markets, we have an overall concern with workforce and viability of providers. Yeah.
So, Senator Askew, I think
So Labor's
it's quite
plan could-
possible that it could, for smaller providers in the bush, they could have to close.
Yeah, unrealistic.
It's almost
Okay,
So
Senator Watt, so I'm
Labor's
going
plan around 24/7 nursing could close aged care homes in regional Australia.
So I'll just...
Well, I don't think any of the officials have
no,
confirmed
they
that.
haven't.
That's
So
an
but
assertion.
what they have confirmed is that there hasn't been
I'm asking
any
the Minister. I'm
investigation.
actually asking the Minister.
Yeah.
So the risk is that
Dorothy Dixon.
Labor's 24/7 nursing proposal could close homes in regional Australia.
Absolutely, yes.
There's
so
definitely
now-
You only need
risk
to look at
that-
the evidence of Ms Staple to sort of find the justification and the various threads that give rise to that.
As if anyone would believe anything
I'm
from your
now
government.
going to give Senator Watt a call, actually.
On Wednesday night, it actually it allowed for
Give Senator
problems
Watt
of
the call.
workforce being able to be accounted
Senator
for.
Watt, you have the
All
call.
I'll say is it's almost as if we should have spent the last decade training more aged care workers, but it's actually Senator Grogan's. Yeah, it's amazing,
We're going to
amazing.
continue with some questions, please,
Senator Grogan's
Senator
got
Watt.
questions.
Oh, sorry, Senator Grogan.
The issue, I'll just pick up on the issue of regional aged care providers. We've seen them close across the regions in the last couple of years in an alarming fashion. And I think I'd really like to understand why you haven't done any analysis on that issue, given that it is so challenging for people in regional areas to have the aged care facility close and their loved ones moved up to hundreds of miles away, kilometres away, to a different facility, which means their families can't visit. So you've said you haven't done any analysis of the impact on regional aged care facilities.
That was on
Is there other
workforce.
work? No,
That's
if I
on
just finish my
workforce.
question.
Yeah.
Is there other work you've done to understand the challenges that are being faced in those regional areas, and do you have a plan to address it?
Ms Strapp has a whole team working on this issue, so...
I do, yes. Senator, and I think the answer that I gave previously was in relation to 24/7 nursing and workforce in particular. But yes, we are working really closely. We do analysis of the particular pressures in regional areas, and we work very closely with providers, particularly who are at risk of closing or who have said they're going to close. And we attempt to, we put lots of wraparound supports in place. We have lots of programs and funding that is available to support those providers that are at risk of closure where residents, the closure would impact on residents and force them to move, as you said, hundreds of kilometres away. So in many of those circumstances, we provide grant funding to that service. We've got a viability fund particularly for that, where they don't have enough money to operate, and we know that occupancy levels have impacted on their financial viability, and some of that's been to do with COVID. We also, we've got the Business Improvement Fund, which the second round is open at the moment, but that's particularly around regional areas or regional providers where they can access funding to improve things as part of their business, and that's aimed at also, keeping them open, but also where it might be a provider that's struggling and they want to leave the market, where we also give them support to provide to get another provider in, and that's been quite successful. We know we've worked with a number of providers over the last 12 months particularly to assist them to exit, but also allow them another provider to move in. And in those circumstances, we might provide capital funding to assist with that. We know there are a few providers that are exiting the market at the moment, or facilities that are closing due to the facility being an older facility and not fit for purpose. I spoke to one provider the other week who had made the difficult decision to close their facility, and we outlined all the support we could provide to keep the facility open. However, their argument for closing the facility was that it's an old facility, it's not fit for purpose. They can't have dementia. They can't have dementia residents in there. And there were facilities that were newer and much better and more fit for purpose within half an hour of that facility. So there are lots of factors involved in the decision to close.
And is there any additional funding in the budget for measures to support or to alleviate any closure of regional aged care facilities?
There wasn't in this budget, but in the previous
nothing in
budget,
this
there's the MyEFO and the previous budget. There was we've committed over $100 million to viability measures like the Business Improvement Fund and the Structural Adjustment Program.
And those funds are still available?
Yes, they're still available. Yeah. And we've got, as I said, there's a round open at the moment for the Business Improvement Round. Round 2 is open at the moment for providers to access.
Sorry, Senator, not in the STRAPS area, but in another area, there was an announcement in the budget around the treatment of MMM5 RACFs in relation to the ANAC funding formula, the new funding formula.
Senator Grogan, you'll be happy to know that the measures that have just been outlined by the officials are working, because more are now opening than closing. So that is a good thing, and it's a practical measure practical evidence that these measures are actually working.
That may be the case in some areas. It certainly isn't in South Australia. And certainly not the experience that I'm finding when I'm out in rural South Australia talking to people about the challenges that they're having with their aged care. So I appreciate you trying to make a political point there, but that's not the experience that a number of us are actually finding. So in the budget, can you've highlighted this issue around 200 minutes, 24/7, etc. You've highlighted that up to 2024 is where that's going to come in, but I can't find it in the budget papers. And I note in the overview of the budget, it says quite clearly only 200 minutes. Now, I appreciate that that's what you're heading for now, and you've said that you're going to bring in 24/7 in 2024, but it's not anywhere I can see in the papers, whereas in a lot of your other areas like the regional development, roads, blah, 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 it's all in there and it's all counted and it's all projected out as to what's happening in 2024, but not with this 200 minutes. So can you explain to me why, or maybe I'm just missing it in the papers?
No, it's subject to further policy work.
So not committed to...
Well, it's the government's clearly committed to it. They've accepted the recommendation.
So you guarantee that 2024 it's going to be there?
Well, the government's accepted the recommendation. So the work we're doing now is collecting from providers around where they're at in terms of minutes of care and also in terms of nursing. And so the idea is that once we've established what the gap is, once we understand what the gap is, then that can be the subject of a budget deliberation.
Okay. But that's still on the long finger, as it were, for 2024. I'm just aware that in other areas of the budget, I don't expect you to have studied the regional funds or the roads or the development pieces in the other parts of the budget. They're dealt with quite differently in the sense that there's a projection, it still needs a business case, it still needs various work, still needs all the things. But the money is still reserved out there in those out years, including 24, 25 and 26. So I'm just wondering, do you have a different accounting standard in this area, or...
Senator Grogan, we've already had this discussion with Senator Rice about the budgeting process. As Mr Lai has said, the government has committed to that, and we are now doing what effectively is due diligence with the sector to work out a detailed plan of where the gap is, what we need to do to get there. And then once we've got that data, it will go through, if we are re-elected, through the normal budget process, and it will be funded. But again...
I'm just making the point that it's been dealt with quite differently. In other areas, you would say, even though the final details aren't done, the money has been committed for various things. In this one, this looks like a commitment that is unfunded, so therefore potentially not...
Look, I think that circumstances in aged care are that in a lot of areas, we haven't had, that we're working without baseline data, and so, it's really important that we collect the care minutes. It's important that we understand what the service is doing. I know that there are providers who are already exceeding 215 care minutes, so they're already exceeding that. Equally, we know that there are some that won't be, but we haven't collected the data, and we need to establish those baselines. And it's true for nearly all parts of this sector. Like I mentioned earlier about chemical restraints, about nutrition, all of those areas we haven't collected sufficient data to be able to know what it is we need to do.
And also some of the other information we've had from Ms Strapp, for example, is included in that 215 is 44 minutes by a registered nurse, and we are already investing in being able to provide that capability. So we are already, for the bits that we can quantify, and we need to fund now, we are. And that is just good government, Senator Grogan, is when we get more information, we have more data, we go through the normal budgetary process and appropriate funds for that.
I just wonder at the speed and the commitment to this, and just want to ask a few further questions around that so you can clarify. So the development work, what's the size of the team, the time frame you've got on that, and the money allocated to do that piece of work if you don't have enough information to do it at this point? What plans do you have in place, or what teams do you have in place?
Well, we've got we've got a substantial team in Ms Strapp's area. One of the comments from the Royal Commission was that we needed to have a greater focus on market and workforce, and so Ms Strapp, as we've put a substantial team together there, and we're doing a lot of work around better understanding the aged care market and also adjacent markets. So that's one way in which we're coming at it, because it gives us information about workforce and demand and supply. And
so how much money have you allocated to do that piece of work? Obviously, it's an additional piece of work for the department.
Senator, we would have to come back to you on notice on that, but Dr Hartland's team are also looking at the funding issues. We're collecting through, we're working on collecting through quarterly data from the sector, certain indicators which help us, ascertain where they're at. So that, there's a number of teams involved in that, and we're happy to come back with an estimate of what the investment is to
So any early reports from that work? Any early briefing papers or reports on where that's going?
On what, Senator?
Yeah.
On the issue of how you get to achieve the 215 minutes, how you get to build the workforce to achieve the 24/7, those issues that we were
could come back on
talking about.
notice with some information for you.
Okay.
But Senator Grogan, I think you've also misunderstood, and perhaps it might help to clarify just a bit further, is the government has already allocated an extra $3.9 billion towards this and other initiatives. So there is already funding to actually go through this process. So we've also done funding for the nurses in terms of bonuses and additional training.
I don't think bonuses are funding for ongoing nursing.
So, trying to say that we're not funding this or not taking it seriously is incredibly misleading. And quite frankly, your leader last night said that he would do all of this getting more nurses a year earlier with, where's your planning?
So,
We've funded it, we're going through a
You
sensible
haven't funded
process.
it. You haven't funded it.
That's the point.
$3.9 billion, Senator Watt.
So,
Out of
show
10
us in the budget papers, where is the money for nurses to be 24/7? Where is the money for
I might hand over
215 minutes a day?
So, no, but I think the problem here is that we're having this conversation. I'm getting some really good information from the department, and Senator, with all due respect, you keep jumping in with political points and trying to bash up Anthony Albanese, and I'm not sure that's helpful. I'm not sure that's helpful. The idea of estimates surely is to ask the questions and get the answers.
Chair, facts might be somewhat inconvenient
Okay, order.
for Senator Grogan.
No, the facts from the department are very
Senator
helpful.
Grogan.
Numbers and facts are what budget estimates are about,
Exactly right.
and $3.9 billion is hardly inconsequential.
Okay. So Senator Grogan, we'll go back to Mr Lai to answer your question and then we'll continue.
I think this might be a very long day. Thank you, Mr. Lai.
Senator, last year the government committed to $3.9 billion to both care minutes and nursing time, and I think the point we're trying to make is that that investment, we are unsure because we have providers who will be exceeding those standards already. We don't know how many aren't. We're collecting information about that, so we don't know what the gap is. And so that $3.9 billion may be enough to get you to 215 care minutes and 24/7 nursing, but we don't know. We don't know the final answer to that, and that is why government has said we need to have an answer to that for 2024 when it's due to be implemented. So we need to collect that information. That's my explanation.
So, in terms of the crisis that we know we're facing in aged care, is there any sort of crisis intervention money to deal with what we're seeing right now, which is insufficient staffing in aged care facilities? Maybe if there's something in the budget, maybe you could point us to.
Yeah, Senator, yes. I mean, Ms Strapp can actually take you through we have a number of different methods of intervention with providers who we judge to be vulnerable and then all put up their hand. So there's a first level, which is an advisory service where we put people in touch with experts who help them look at their operation and identify efficiencies and better practice, but also look at hard issues like Ms Strapp raised. Your capital, your facility might be out of date, might have shared bathrooms or whatever, and you need to kind of upgrade, and you're struggling to find a way to fund that.
So I guess what I'm really looking for is there a piece of work to take us through to the plans you're developing for 2024? Is there an emergency piece in there
Yes.
to protect older people in those facilities or utilising home care between now and 2024, and where is the budget line for it?
There is, I think.
Yes, so as I outlined earlier, it's not. This was from a previous budget, the viability fund.
Yeah, so okay, we've been through that. I'm trying not to sort of rejig, but is there anything in this budget to assist in that endeavour?
The money is still available
From the last budget. There's
budget.
no extra money been placed in there.
Because we've still got
That's a
money.
different
We've
question.
still got money available. We've still got money available for that. So
Budget's run over 4 years.
Yes.
So initiatives in the last budget.
Can I just clarify? I think what you're saying is that, well, the Minister says the government is committed to 215 minutes per day in line with the recommendation of the Royal Commission. I think what I've heard you say is that there was money provided last year to help fund that, $3.9 billion.
Correct.
Over
Correct.
4 years.
Correct? But looking at last year's budget papers, they say $3.9 billion over 4 years to increase the amount of frontline care. This will be mandated at 200 minutes per day, not 215.
And Senator, we're just saying that the establishing where the sector is actually at is a separate exercise to that.
Sure, but there's actually no budgetary commitment for 215 minutes per day.
Senator Watt,
That's a question. I'm putting the question to Mr. Lai.
So,
He's across the
Minister,
back.
Senator
please
Watt.
Come on.
Senator Watt, I can actually answer a question, and also, so we are, just to be very clear, we are in year 1 of a 5-year funding program. So, as Senator Grogan was I think, not quite clear. We are in 1 year of a funded 5-year program. And I asked Mr Lai to go through a bit more of the detail.
Well, can
of the
I
question.
get a question to an answer to the question I actually asked Mr Lai, which was, it is correct, is it not, that the funding in the budget from last year is for 200 minutes per day and not more than that?
That's correct, Senator.
Thank you.
And the reason is, as I've given, is that because the government has accepted the second stage, or the 215 minutes and 24/7 nursing, they have, on paper, accepted that recommendation. The challenge that we have is that we don't know what that looks like. The sector could in fact already be meeting those requirements. I suspect we suspect the coverage is quite good in relation to most of it, but we don't know what the gap is, and the collecting of the information is about informing government so they can actually put a dollar value against that second stage.
And that is the reason why at this point there is no money in the budget, whether it be from last year or this year, to lift the personal care minutes to 215 per day, or to put in place 24/7 nursing. That money would need to come after that work is done.
If it were necessary.
Thank you.
So your
Tell you what,
time,
it might actually, until we've done
Has
that work, it
expired.
might not be necessary. Because I said we've already put 3.9 billion allocated over 5 years, and it might be enough, but if it's not, if re-elected, obviously after that process, the department has gone through that process, we can allocate more if it was required, but it might not yet be allocated, need to be allocated.
okay. Time, so we'll go to Senator Rice.
Thank you. Look, I want to return to the aged care bonus payments and the fact that we've got less than half of the providers who have applied for their bonuses, or just on half, and it's taking potentially 6 months to process those. At the time, we know that lack of low wages for aged care workers are an absolutely critical thing. And you said that once the provider has received the money, that they have to hand it over to the aged care workers within a fortnight. So can you tell me if that has occurred for all of the providers that have so far received the grants to pay those bonuses?
Senator, as the Secretary said before, we encourage providers to make the payment as soon as they can. And we have an audit process after the grants round is completed to make sure that the funding flows to workers. But we don't, because it's by nature of the fact that it's a grant to providers, we don't trace at the time that it's delivered how many
Sorry, you
payments are
don't.
made to workers.
You've got an audit process, but you're not tracing it.
You trace it after the fact.
We trace it
is what
after the fact.
Dr. Hart
I mean,
said.
it's a grant to providers, and then it's up to them to pay their workers as quickly as possible, and we require them to do it within
So
2 pay
can you tell me more
cycles.
about your audit process then? So how do you actually know that it has been passed on? You've requested them to pass it on within a fortnight. So have you got any results? Has that audit process been implemented so far for the providers that have received grants?
I might ask Mr Benson to
Thank
talk
you.
to you a bit about the detail of the audit process.
So, Senator, we can give you some information about the audit process, and then, in particular, what we found when we went, because this is the third or fourth time, I think.
This is the fourth.
The fourth bonus.
Senator James Benson, Assistant Secretary, Funding Operations Analysis Branch. We do conduct an audit of the bonus, and we've conducted audits of the 3 previous bonuses. This one won't commence until the grant round is actually finished.
And so when is that?
It will finish at the end of May, I believe.
Okay, and then what's the period of time then that the audit process occurs over after the end of May?
It could take between 3 and 6 months.
Okay, so if providers haven't passed on their on the bonus to workers, you're not going to know about it for 3 to 6 months.
Well, we will actually, we may receive complaints from workers who haven't received their bonus, and we will investigate that.
So how do workers find out if their employer has first of all applied, given that we know that only 870 out of an expected 1,600 have applied?
Well, they would, if they haven't received their bonus, they'll contact either their employer or the department.
So what's the process then? So basically, so you're saying for a worker who hasn't received their bonus now, they have to contact their employer and see whether the employer has actually applied for it. Is the department able to give workers a list of who has and hasn't applied for a grant?
I'm not sure.
Is that on the public record?
No, it's not.
No. So it's up to the worker. If they haven't received their bonus, they've got to take time out to first of all contact their employer, and who knows how long their employer might take to get back to them. And then if they haven't heard back from their employer and they can't get clarity as to whether their employer's actually applied for it, what then do you suggest they do?
They can contact the department.
And the department would be able to tell them whether their employer has applied or hasn't applied?
Yes, we can.
Would you be encouraging any worker who hasn't received their bonus to be directly contacting you to find out whether their employer's actually applied for it, given that almost half of the providers haven't yet applied for them?
The better strategy for them to contact their employer in the first instance. I think we're assuming a level of malevolence in the employers that perhaps isn't necessarily there. I mean, the previous experience is that these bonuses were paid on to the workers, and I think most of the providers want to do the right thing by their workers.
But if that was the case, why have we only got 870 of the 1,600 who have actually applied?
Well,
I just find that...
As Dr. Hartland explained, it's a grant process. And it's based on, there was a 4-week assessment period during February, during which employers would work out the amount of bonus that was eligible for each employee. Then the grant round opened on the 1st of March. And it would have taken a week to maybe 2 weeks for employers to get their data together and make their application. In the last 2 weeks, we've received the bulk of those 800 applications, so they are coming in now, and we would expect the bulk of the remainder to come in over the next month or so, as Dr. Hartland explained. So there's like a 2-week lag at the start of the process for employers to do their application. They are now coming in, and we're paying them as soon as we can.
With the audit processes for the previous rounds, what compliance have you found?
Very high.
What's very high?
Well, I can't give you an exact percentage, but we have probably, I think, half a dozen employers that we are currently working with to ensure that they've paid out the correct bonuses.
Okay. Pity those workers who are, poorly paid and they can't even get the bonuses that they're eligible for. Yeah, I know, but it's just it's no wonder that we're in a situation that,
Have you got a question, Senator Rice?
1 in 5 workers are planning to leave the workforce in the next year.
Senator, there's no evidence that the bonuses haven't been passed on. I mean, the type of audit errors are about possibly mistakes in calculation. So, the last 2 rounds were quick, successful. Workers got their bonuses within a reasonable time.
Okay.
They're being passed on to workers who are eligible.
We've still got the stark figure that, survey showing that 1 in 5 workers are planning to leave the sector in the next year.
Which survey?
This was an Australian Nursing and Midwifery Federation survey of nearly 1,000 workers in aged care, undertaken last month. That's right.
I think, Senator, the data don't support that that's actually happening. We're not seeing a huge exodus in the workforce. So some of those intentions are not necessarily matched by the real world data.
I want to then go to staff shortages, which we're clearly still experiencing, and it's no wonder given the poor pay, poor conditions, overwork, people feeling completely burnt out by COVID.
Shortages are
Order.
So I asked, there was a question on notice that I put in after last estimates, and
Order.
which provided some data on workforce. Do you have any information regarding about staff still being required to work across facilities?
Not updated data, Senator. I think I gave answers. Ms Gleeson, who's on the line, might have further detail about staff working across facilities, but I might ask her to jump in if she has that detail.
Emma Gleeson, Assistant Secretary, Aged Care Workforce Branch. No, we don't have recent data on the number of workers who are working across facilities. There was some data that we did collect back in the 2020 census and also through the single site arrangements, but I don't have that detail to hand, and I'd have to take that on notice to provide those numbers.
Do you agree that staff working across facilities is still a really critical issue in terms of, exacerbating spread of COVID? And it's something that needs to, overall not be happening?
Senator, I think it was a significant issue pre-vaccination, and obviously one that the reason we had the single site arrangements in place. Obviously, there's a balance here to be struck. It's not unusual for people to work in more than one sector in the health and caring, the broader sector, and we don't want to restrict people's ability to do that. But it was significant pre-vaccination. I think that has changed with vaccination rates providing protection, and a lot of things have changed in our interactions with residential aged care facilities, experiencing outbreak as a result, and that's one of the things that has changed.
So am I hearing you say that you're not concerned then now with staff working across facilities?
Well, we're concerned about, I mean, it depends what you mean by your question, Senator. I mean, I'm not concerned in business as usual sense that people might work across facilities. That's a practice that happens in the health and caring sector.
But we know as a practice that's happened, there has been a really significant contributing factor to the number of deaths in aged care. And we have got ongoing issues with deaths in aged care. So why isn't it still an issue?
Senator,
Despite vaccination, we know that there are ongoing deaths, there's ongoing serious illness in the community. We've just heard about what's going on in South Australia and Tasmania at the moment.
Senator, I think what Mr Lai is saying is when this was a serious issue, we were, as a nation, practising an elimination strategy for COVID. We were trying to prevent every bit of transmission. We have widespread community transmission of COVID across the community now, and the relative risks of a worker going from one facility to another is probably vastly less than it was in that previous era. Now the risk is probably just as high for a family member or a visitor bringing in. So I don't think the risk is nearly as great. In that situation, we had an unvaccinated, highly vulnerable aged care population with a high risk of death if they got COVID. We now have a vaccinated population, widespread community transmission. Our strategy has pivoted now to reducing the risk of severe disease. We are no longer attempting to eliminate and stop transmission, so it is a much less important issue now.
But we have still got what to me seems like incredibly unacceptable deaths in aged care from COVID. I mean, in the first 3 months this year, we've had a total of 923 people who have died, which is more than all of 2020 and 2021 put together. So taking the measures, I mean, is this an issue? I mean, Minister Colbeck at the last estimate said that he didn't accept that deaths in the community or deaths in aged care as an indicator of his competency as the Minister for aged care. I mean, are you actually saying that these deaths are acceptable?
All these deaths are a tragedy, Senator, but the reality is that we had such very widespread, large transmission of COVID in January and February. The death rate in aged care, the proportion of deaths in aged care that are due to COVID is, I think, very low. It's about 0.3%. Professor Kelly can give you a bit of an outline on that. As you know, every death is a tragedy, but there are 1,000 deaths every week in aged care. The proportion of those that are due to COVID is very low, and as we've explained before, a number of those deaths are not necessarily deaths from COVID, but death with COVID. So Professor Kelly can give you a bit of an outline of the epidemiology of deaths in aged care.
Thanks, Secretary. Professor Paul Kelly, Chief Medical Officer. So the Secretary has already mentioned several of the key points. I think firstly is the pivot from in our policy, and there was an AHPPC statement on the winter planning, which was published last night, and I can go through that and another point perhaps. But the change policy is really about protecting the vulnerable, not trying to stop transmission completely. And that's been the case for a while. The reason we're able to do that is because of the very successful rollout of the vaccination program and the availability of effective treatments. So, Senator, you're quite right. Early on, that was a very important issue we did, amongst many other somewhat blunt instruments to protect the most vulnerable and to decrease transmission, was that single site arrangement. That was very important in 2020 and 21. Is not as important now for the reasons I've stated.
So
One more question.
is there still a desire to reduce that workers working across sites, though, as a measure to reduce the rate of COVID, or are you just giving up on that altogether?
It's not so much a giving up, Senator. As I mentioned, we have many more effective ways of decreasing severe illness in aged care residents, which has been vastly successful. And that includes vaccination, it includes treatment, includes all of the other measures that have been put in place very successfully with, and credit to my colleagues.
I find it mind-boggling that it's vastly successful despite the fact that the number of deaths in the first 3 months of this year was more than in 2020 and 2021 combined.
And that reflects...
I've just got one question which I suspect they'll have to take on notice about data about the number of people who have passed away in aged care for reasons other than COVID-19 since the beginning of the pandemic, in response to there was an ABC article that basically said that the death rates were actually higher across all reasons compared to pre-pandemic, in addition to the deaths from COVID.
So I can give a more sort of general answer to that. The specifics I'll take on notice, but the general answer is, and this is something that's been recognised recently, and not only in Australia but elsewhere, is that we should be, rather than looking at COVID deaths, looking at excess deaths. That is, looking at what has happened historically and what we expect from death rates for all causes, and that is the way that we look at this sort of thing, and the ABS looks at this on a regular basis. The most recent reports from ABS came out taking into account the end of 2021, so 2020 and 2021, comparing that with the previous 5 years. And the overwhelming element there is that there has not been the sort of extreme excess deaths that other countries have seen around the world during that period here in Australia. We are one of very few countries that have in fact had a negative excess death. As we've talked about here before, many lives have been saved, and that includes in aged care compared with many other countries. And that's an important point.
I know we're running short of time, so can you take on notice of excess deaths in aged care since before the pandemic? Because ABC reporting said that there was an increase in excess deaths beyond COVID-19 in January and February this year.
Senator, I think the ABC, I think the monthly figures for deaths in aged care, they're not even. They stay within bands, and someone needs to do that expert analysis of what they are. So I think that the problem with that report was that it just looked at the month and said, there's 60 or a certain number more than last month, and said that meant that was due to COVID. And I don't know that that's a significant finding. I think that was a...
Okay, well, if you could take on notice the data
analysis
you've done, please.
Senator Hughes.
The ABS has provided us with some detailed data just in the last few days, which will allow us to look at that very closely, as has happened in many states and territories now, looking at all of the data points that we can get around death to give that sort of detailed analysis, which is really important, I agree, in terms of plotting the pandemic and what we're doing about it.
Thank you. Senator Hughes.
Thank you, Chair. If I can just get some information around allied health, and particularly the benefits for senior Australians, when we look at if you could explain to us the new ANAC model and how that's going to take into account allied health with things including physio, etc., and what sort of benefits we're going to see flow on to senior Australians from that. Sorry, Professor Kelly. Nice to see you.
That's all right. So, Nick Hartland, First Assistant Home and Residential Division. So the ANAC model's been introduced with an increase in funding for residential providers around care minutes. In relation to allied health, the model has some intrinsic incentives that would encourage providers to include allied health in people's care plans because unlike the current funding system, there's no compulsion of providers to get people reassessed and therefore potentially if they're re-abled have less funding. So the model does have some intrinsic mechanisms to encourage the use of allied health. We think that the funding in the model, when it will be turned on in October, is sufficient to allow, at the very minimum, the maintenance of the level of allied health that we see in the system at the moment.
I believe it's my questions at the moment.
Well, the quality standards require aged care providers to provide services fit for that are needed by residents. So the system as a whole will require the continued deployment of allied health.
And obviously there's benefits, those for senior Australians that get access to things like allied health as opposed to looking for just medical interventions. So I'm very conscious of time, so I will, just one other question. With regards to home care packages, could you give us a brief breakdown, even state by state, and what level home care package numbers have increased by, and what sort of improvements have we seen through the government's new at-home support program?
So the last budget announced an additional 80,000 packages. We're well on the way to implementing that. As Mr. Lai said, I think before, as of 31st of March, we've released about 30,000 of them. So that's consistent with the aims of the package. The program as a whole is growing very quickly. We've seen estimated wait times come right down. So we might have a figure for that as a result of this investment. So between June 21 and January 22, we've seen wait times drop by 30-40% across the different levels. We've seen the national priority system also reduce very significantly, so it's now at 62,000. As at end of February, it's about 62,600 people on the national priority system, which is a very significant reductions to what we've been seeing in the system in the past.
Okay. I'm conscious of time, Chair.
Okay. Senator Roberts.
Thank you, Chair, and thank you, Senator Hughes. Thank you all for attending today. I have three sets of questions. The first is pretty straightforward. It's only one question. How many aged care residents died of COVID-19 by state per month since March 2020? And how many died in aged care within 4 weeks of receiving a COVID-19 injection?
Senator, I don't think we could provide that information other than on notice.
Yes, I'm happy for that.
We can certainly provide that on notice. That sort of level of detail wouldn't be available to officials today.
So data by state per month on the deaths due to COVID and the deaths due to within 4 weeks of receiving COVID-19 vaccination.
The second part of the question about the relationship to vaccinations, I think that the work that Professor Kelly's leading, that may shed some light on that question, and might be harder to get than the other, but we can get the other one. I think we can get the other one quite simply.
Well, I would have thought
the second one might take a bit longer.
Senator Roberts, can I ask a question maybe through you?
Go for it.
Your COVID death rate, what the death rate is, for example, someone who's had cancer or been in palliative care but also had COVID, did they die of COVID or did they die of the cancer that they'd had or something? So when you get those figures, can we actually have a look? Because I know a lot of COVID deaths were put down, they died of COVID as opposed to with COVID, but other factors were involved.
So I think, Senator, as we said at the last estimates, the Victorian Health Department did some detailed analysis on their aged care deaths, and they found that 44% of people who died with COVID had died primarily from another cause, such as cancer or severe dementia. And we always report them as COVID deaths because we want to be absolutely inclusive, but it's not in many of these vaccinated people or people who've had another condition. The COVID is incidental to the cause of death.
Thank you, Senator.
Coming back, Mr Lai, before I move on to the next question, I would have thought it would be fairly simple, given the aged care records, to know whether or not a person died within 4 weeks of getting it as a COVID injection.
Look, Senator, I think I'm outside of my area of competence, but I think to save other officials coming up, I think the complexity is one, working with the states and territories around settled death data, which takes some time, and then I think there's the additional linkage to the system, Dr. Murphy, that covers immunisation.
Yes, we certainly can link to the immunisation record, and that data analysis can be done. And as you know, Senator, the TGA also does get reports of deaths reasonably close to vaccination. Many of those are considered completely coincidental and not related to the vaccination. So we can explore what we can do by data linkage to see if we can come up with an answer.
Yeah, I'd be surprised if you couldn't tell me if someone died within 4 weeks of getting their injection. But anyway, we'll see what happens.
When 1,000 people per week in aged care die, and in a busy immunisation program, there will definitely be some who die within a month of their injection, just as a matter of...
Oh, I accept that. Yeah. But we'll see if there's any trend.
Senator Roberts, we've got a break at 11, so you need to conclude by then, so I'll just give you that heads up.
Thank you, Chair. Moving on to the second set of questions. 1 in 3 nursing homes continue to spend less than $10 a day per resident on food, despite being given an extra $10 a day by the Morrison government. How are you checking whether the cash that the government gave providers is being used for its intended purposes?
So, Senator, I might hand over to Ms Laffin and to the Quality and Safety Commissioner as well on this. I mean, the short answer is that we have required people to report to us on nutrition based on that uplift in funding, and those people who hadn't given us assurance that they would report to us, their additional funding has been stopped. And then we have a process by which people who haven't met the standard are referred to the Quality and Safety Commissioner. I'll let Ms Laffin give you a complete answer, and then I think I think the Commissioner's here. She could give you more detail again.
Amy Laffin, First Assistant Secretary of the Quality and Assurance Division. So as Mr Lai said, first we require providers to provide an undertaking that they will use the money with a focus on food and nutrition, and then we require quarterly reporting on matters of food and nutrition. We've recently released the data from the first 2 quarters. What we found is that 75% of providers reported on-site only spending on food and ingredients, with an average spend of $12.25 in the July quarter, and $12.44 per resident per day in the quarter starting in October. Those providers that spent less than $10 per day were referred to the Aged Care Quality and Safety Commission. And Ms Edison may be able to tell you what she's been doing with that information.
Janet Anderson, Aged Care Quality and Safety Commissioner. Senator, we received a list of 883 services referred from the department, which had reported less than $10 expenditure a day on a calculated basis. We looked closely at that list, and then we added some services to it on the basis of our analysis of risk. We added to it services who appeared to use only pre-prepared food, and then added a further number who used a combination of fresh and pre-prepared food where they had a relatively low expenditure on food and associated labour. And so we looked at a list of 955 services, so a larger list than came across from the department. And we looked at we made an assessment of their food and nutrition profiles. Now, the way we looked at that was in the way we assess risk generally, looking at a number of different parameters. We looked at their relative ranking in relation to the quality indicator for unplanned weight loss. and the top percentile of concern there. We looked at the relative number of complaints that we had received about that service in relation to food and nutrition, and rated those low, medium, high. And we also looked at the any findings of non-compliance that we had made about those services in relation to the standard in the requirement in the aged care quality standards, specifically relating to food, for 3F, where meals are provided, they are varied and of suitable quality and quantity. And on the basis of the analysis of the 905, 4.5% of those services were rated as high risk for non-compliance with the expectations in relation to food and nutrition. Another 41.3% were rated at medium risk, and the balance were rated at low risk, or they had not yet submitted their quality indicator data, which meant that we weren't able to do a full risk profiling. So we then looked to the high and medium rated risk services, and those services we've rated as high risk profile will be prioritised in our monitoring schedule in terms of their compliance with specifically with that requirement in the quality standards. And I won't go into more detail about that because if we are to undertake a visit, our visits are unannounced. But I can say that there will be a greater intensity in the monitoring that we undertake of those services. And then services which have been rated as high or medium risk will be required to participate in an education program that we're currently putting together, which will give them more information and be clearer in the expectations that the Australian community has of them in relation to food, nutrition and the dining experience. And we'll be expecting both staff and management to participate in those educational sessions.
So would it be fair to say that they know they're being watched?
Absolutely. Yes, that would be accurate.
Okay, thank you.
Can I ask just one question, Senator Roberts? The high-risk facilities, did they, I'm not going to ask you to name them individually, but did they tend to be major providers or smaller independent providers? Was it a mixture? Was there any sort of trend there?
I'm sorry, Senator, I really don't have access to that detail. It is an interesting question, I agree with you, but I really can't answer it today. I'm sorry, I haven't to take it on notice.
Next question on this, second question on this. I understand you measure quality and safety standards. Have the rates of breaches of quality and safety standards improved specifically? Can you quantify it?
No, there's been no material improvement in assessed compliance with the aged care quality standards. However, it's a complicated question to answer succinctly because we have been improving our capability as a risk-based regulator, which means that we are more able to identify the higher risk services because we are more proficient and skillful in understanding bits of intelligence that come to us. We put them together as information in a risk profile for individual services, and we understand how that profile relates to other profiles for peer organisations. And in that risk profiling exercise, we then pay greater attention to those who are rated as high risk. So our detection rate for non-compliance has actually improved because we know where to look. And so we are finding high levels of non-compliance, but we're also looking in the right places for non-compliance. So that is why I can't say categorically we are seeing overall improvements in quality and safety, because as a regulator we are becoming more efficient and effective in identifying non-compliance.
Minister, would it be possible for one of my staff to come and have a talk with the agency?
Sure, that would be fine.
Okay, last question. Last question?
Yep, last question.
Senior Australians have different needs and health issues to younger people, yet they're treated as part of a larger community segment. Why do we not have purpose-built seniors-focused healthcare facilities, including seniors' hospitals? Would that be a way of not only improving the service but saving money?
Senator, the average age of the inpatient in our major state and territory public hospitals is about 70. So effectively we do have hospitals that are looking after the elderly, because mostly, obviously, as you realise, chronic disease and disease burden increases as we get older. So, but I think your point is valid, that there are some specialist services that are very much directed towards dealing with the elderly, and we have a very strong focus in the department on enhancing and working with the states and territories to get geriatric services into aged care facilities, and there are now some very good models of InReach where those aged care services get those specialist geriatric services and specialist mental health services. But essentially, you know, our hospitals are largely for the treatment of people of more advanced years, given that's the nature of disease.
It's a useful point you raised, because hospitals I find daunting, many people find daunting, so for an elderly person it's even more daunting. And some doctors say it's better to stay out of hospitals. They're not being derogatory, they're just saying...
you don't want to be in a hospital unless you really need to be in there.
Right, that's what I'm getting at.
That's absolutely right.
Senator, the budget measure, the multidisciplinary outreach measure in the budget is precisely about bringing gerontologists, some of those health experts, into residential aged care to give that access in their home setting, rather than, because we see where people have a more complex set of health circumstances, that what we don't want is the residential aged care facility just quickly admitting them to hospital all the time and having that experience, if that could be delivered in the residential facility.
Thank you. Who do we contact, Secretary, for the previous question?
Well, I think if we to get a briefing request to go to Minister Colbeck's office. Yeah.
Thank you.
All right,
Thank you, Chair.
Thank you very much, and well timed. So on that note, we'll take our break and we'll resume at 11:15, continuing on with outcome 3, and we'll go to ALP at that point. Thank you. We'll now suspend. I'll resume our estimates hearing, and I'll give the call to Senator Watt.
Thanks, Chair. Could I just clarify one thing from earlier? I think there was some commentary about how much funding overall is now being provided to aged care and what the increases have been. So did someone say that the government is now providing $18.8 billion for aged care?
In response to the Royal Commission.
In response to the Royal Commission.
18.8 billion is the response to the Royal Commission. And I noticed, I'm just trying to clarify also some different figures. I don't know if you've got budget paper 2 with you, page 86, which goes through the aged care measures. The text below the table says that the government will provide $468.3 million over 5 years from 21-22. You can see that. But the table obviously doesn't add up to 468. I think it adds up to about touch over 120 million. So this is the extra money that's been provided on top of MyEFO, on top of what was provided in MyEFO. So I'm just trying to reconcile those figures.
So, Senator, I think, so there's a few things. First of all, the 15,000 extra training places are in the DESI area, so there's a $50 million difference there.
Sorry, they're in...
Which is over and above the 468.
A different department's budget papers?
That's right.
Right.
And I think the pharmacy measure might have been a decision taken, not announced, and it has been announced.
Right. Would you mind just getting someone to work on that for us, just to inform us how we get to the 468.3, whether it be in this department or others?
We can do that. We're happy to come back. Yeah.
Thanks. Also, just briefly, before I hand to Senator Grogan, the budget paper there sets out the measures that have been announced in this year's budget. Really, the only significant one in terms of dollars is the $345 million for administration of medication management. There's a few other small bits and pieces there. I think the aged care sector's overwhelming reaction was one of disappointment that there wasn't more money in this budget for aged care. As we've already gone over this morning, there's really nothing there to address the chronic workforce shortages or wages or a whole range of other issues that have been identified. I guess my question, probably best to put to Mr. Murphy, Dr. Murphy, did your department or your minister seek extra funding through the budget that was knocked back? Was there anything beyond what you got money for that you sought money for?
Senator, we're always suggesting proposals to government, but I think the government's position was that they'd made an $18.3 billion investment, and subsequent investments were at the margins around these things, and so that the extra money was on top of what was the singular investment last year. So, I mean, we're not going to go through all of the discussions with government, but they ask us to put up proposals, and we put up proposals, and some of them are taken forward.
Without going into the detail of what those proposals were, the department did seek additional funding for other measures?
Across the whole portfolio, there are always a range of proposals that go to ERC. I can't tell you exactly.
Was there anything more in aged care that was requested?
Senator, that goes to the deliberations of cabinet processes.
Well, again, I'm not asking, for.
Well, actually, you are, Senator Watt. You are actually asking. The heart of what your question is for deliberations of government.
Seriously?
In ERC. That's exactly what
Minister,
you're
you've
asking.
spent more time speaking than anyone else in this room this morning.
Senator Watt, the Minister has the right to answer questions as well. However, we will return sorry, I was distracted at the time.
I'm not asking.
The question was directed to.
I'm not asking for the detail of proposals. I acknowledge that I can't get that answered, dollars, exactly what the measures were. What I'm asking is, in general terms, did the department put in budget requests for aged care funding that went beyond the measures that were funded?
Senator, I think I've said all I can, that we always in the build-up of the budget process, we deal with a lot of proposals. Government asks for proposals, we put them up, but what actually happens in ERC I can't go into.
Because either you did ask for more money and got knocked back, or you didn't ask for more money, which I think would be pretty puzzling given the range of problems in the aged care sector. That's why I'm asking for that to be clarified.
I would just characterise that we are working through the recommendations from the Royal Commission systematically, and so these measures reflect that. They respond to Royal Commission recommendations, 10 of them additional to the last year's package. Without going further than Dr Murphy has gone, I would say that always individual agencies will bring proposals to the budget process, and sometimes there are whole of government or other agency initiatives at play, and it's only when all of those things come to the table that you see, this proposal on workforce, for example, is going to be dealt with via another initiative. And so, there's a 15,000 job trainer places here, which is very welcome, but it wasn't, we had line of sight to it, but we weren't the initiator of that. So I would say to you that that's probably the best explanation I could give you for the budget process.
Can I say?
I was aware of that. Senator Gray.
Thank you. If we can just talk a little bit about the Fair Work Commission and the pay claim for aged care. Can I ask, has the department done any work analysing that situation in terms of understanding whether one would make a submission to the Fair Work Commission?
Yes, Senator. We have. We've provided a number of pieces of information to the Fair Work Commission already. The information that we've been asked for, but we haven't been asked for a submission by the Fair Work Commission. We do anticipate we may be asked for a submission, so we have, I guess, considered the sorts of things that could be in that submission, including bits of information around current rates of pay, how our funding system works in terms of ANAC and home care. But yes, we have given some thought to that, but we haven't been asked for a submission yet.
Cool, but you don't need to be asked. The minister could just decide to make that submission. I'm not sure the process, but at the moment we haven't been asked for a submission, so we haven't provided one. Okay. And have you had any legal work done or any legal briefs done regarding what the implications of doing such a submission might look like, given that you're now, alert to the fact that you may be asked for one?
Not that I'm aware of, no.
So no legal...
On a submission. We have had legal advice on the information that we've provided already to the Fair Work Commission.
Okay. And are you able to elaborate on that for us at all?
I think it's just, I think the advice has been, and Ms Gleeson might be able to add to this, it's just to really check that what we're being asked for, and some of the information's been requested by the parties who've gone to the Fair Work Commission, so the ANMF, and just to check that we're providing what they're asking for. So, and our submission goes through Australian Government solicitors, so they're representing the department. Yes, so that's how we get legal advice.
And have you had any engagement with Treasury over the issue of the Fair Work Commission?
I'll ask Ms Gleeson if she knows, not that I'm aware of, but we may have.
Yeah, in regard to Treasury, I mean, we've spoken with them in general terms about the wages case, but there's been no specific work being done.
Okay, maybe this is best directed to Dr. Murphy. Does the department have a position on providing such a submission voluntarily to the Fair Work Commission?
I think that the department's position is that we probably expect to be asked for a submission, and that would outline the information that the Commission would like, and we would be very happy to comply with that.
And in that, would you be supporting a wage increase?
I think what we have said, and Minister Colbeck has said this, and the department officials have said at the Royal Commission, that we do believe that there is a wage disparity between the aged care sector and the rest of the health and aged care sector, and that is an issue in attraction and retention of staff. And I think we have said in general terms there is a case. It's not the position of officials to support or otherwise the outcome. That would be a decision for government, but we have acknowledged that there is an issue.
Okay, and would your advice be, and you may not be able to answer this, would your advice be that a submission should be made to support a wage increase?
That would be a decision for government, Senator.
Okay. Minister, maybe you could answer that question. Do you feel that, given that there is an acceptance by Minister Colbeck, by the department, by most people in the country, that there's a wage disparity in aged care, that the issue of providing a submission voluntarily might be a good idea, and also can you advise us whether you would support a wage increase in that circumstance?
Well, look, thank you, Senator Gregory, for that question. And as Dr. Murphy has indicated it, and I know that the Minister Colbeck has also, there is certainly a wage disparity there, and we do need to do more work to support and train and recruit new care and support workers. The government has already done quite a lot in that area, not just in the health sector and aged care sector, but also in the disability sector. So in relation to the specifics of your question, I'm not in a position to answer that on the specifics of that on behalf of the Minister, but what I will do, I'll take it on notice and see if I can get some further guidance and come back to you.
Okay. Because it would seem like a straightforward way that is, the independent umpire assessing the wage scenario, that I'm confused, shall we say, as to why the government wouldn't then voluntarily make a submission to that.
Well, as I said, that is a level of
umpire.
detail that I haven't discussed with Minister Colbeck, given the short notice with which I'm here representing him today, but I will certainly do that. But as we discussed earlier in relation to the Fair Work Commission and in terms of their deliberations, we will certainly wait to see what their decision, their determination is, and then if we're re-elected, we'll obviously look at that and provide a response. and then go through any budget process to realise that response. So anyway, I'll take that very specific question.
And just to be clear, waiting until they've come up with a decision as opposed to being part of that decision and showing leadership in trying to improve wages in the aged care sector is my point of concern, that a leadership role for a government that genuinely is concerned about wages would lead you to believe a voluntary submission supporting a wage claim in whatever manner that you see fit, given that the
Senator Grogan, I've
support.
got the politics of your question, but also the detail of what you're asking. And as I said, it's not a level of detail that I have available now, but I will see if I can get some further information on the actual technical nature of the question, and I'll leave the politics sitting around that to your statement.
Senator Grogan, the time's expired for your 15 minutes, but can I just ask a clarification around the Fair Work Commission case, because it's something that I'm just trying to, in my head. Are the nurses that we've talked about with the 24/7, are they actually part of this, or is it just the support workers? Both. So it is both?
It's all aged care workers. So all workers that are come under the Aged Care Award, the SHADS Award and the Nurses Award.
Okay, I just wanted to clarify that. So thank you. That's just for my clarification. Senator Wright.
Thanks, Chair. I want to go to the report that was in the ABC yesterday of reporting to Human Rights Watch about inappropriate use of antipsychotic medication, and basically showing that we've still got the situation where 1 in 5 residents in aged care facilities are being given antipsychotic meds. There were homes where more than 75% of the residents were given these drugs. Obviously, this was something that was picked up in the Royal Commission about the widespread and inappropriate use of chemical restraints. Do we acknowledge that we've still got a big problem here?
We absolutely acknowledge, Senator, that the work that we started pre-pandemic actually on addressing this issue still has a long way to go. I think what we are seeing now is much more visibility, because we're requiring previously we only had sample data. We now have mandatory reporting, which is why we're seeing this information. But Ms Laffin can go through just what we have been doing and what we are doing, and it remains an issue. There will always be some antipsychotic required use, but we would accept that the rates in the recent reports are still too high. So, Ms Laffin.
Yeah, and sorry, Senator, just to clarify, the reports of the 75%, I think those reports were published in 2019 of early data. So these are some significant reforms that have been progressively introduced since 2019. So our first legislation started the 1st of July 2019 with a number of requirements before physical and chemical restraint could be used.
So what you're saying is that those reports that Human Rights Watch picked out in their report of greater than 75% were all early? They were all
my understanding,
pre-2019?
Senator, is that was a report released in 2019.
Because that's certainly not how it's reported here, where it's analysis of your recent data, the mandatory data collected for the Department of Health from the more than 2,400 aged care homes.
So the 75% figure that you referred to in your opening, that's the 2019 figure. But you're right, there was some data released recently, and that's around the 21%.
The 21% of residents
received
antipsychotic. I mean, because certainly the way that that's reported here is Human Rights Watch saying we found homes where more than 75% of residents were given these drugs, and there was not adequate documentation of why they needed them or relevant.
And that was that was published in 2019.
Okay. All right. So do we have any data? So we've just started collecting mandatory data. So do we have any sort of trend data as to whether are things improving? Are the measures, of mandatory reporting, of working with the aged care providers? So
at the moment we have the first quarter of data for that mandatory quality indicator on the use of antipsychotics. So I think we'll have that the second quarter released in coming weeks, so we'll be able to track that trend. What we do have is in 2019, some measures were introduced around the authorisation and prescription of risperidone, and we do have quite a significant decrease in that prescription. I'll just, find my... So data captured through the PBS about prescribing use in residential aged care. So there was a 28.8% reduction in risperidone prescriptions between April 2018 and 30th of June 2021.
Okay, so on that drug, but
yes.
But so you won't have any other trend data basically until you've got the second quarter.
That's the major drug that is used in that context.
Okay. All right, so we'll just have to stay tuned and see whether there is a downwards trend.
Chair, can I also just raise this? I think, Senator Rice, this issue, the unauthorised and inappropriate use of psychotropic drugs, is something that we've also seen and become aware of in the disability sector. And it is something that has shocked myself and my colleagues to see the prevalence of this inappropriate use of these drugs. And that's why we've launched between the sectors, between aged care, health and also disability, quality and safeguard frameworks have launched a joint approach to actually tackle this. It is shocking that in this day and age that psychotropic drugs are used for behavioural restraint in particular, but it is a problem that we are now aware of because we do have, through the various quality and safeguards frameworks, we are actually making this data visible for the first time so that we can tackle it. It is something that I think goes well beyond any partisanship in politics, and it will require... So in terms of dealing with it, it will require... So if you have a look at the framework that we've put together, it actually will take time to work with the sector to eliminate it.
Yeah,
and we also need... And what we're doing in disability, I know looking at aged care as well, is more training in behavioural support so that there are alternatives to chemical restraint to deal with behavioural issues.
I think it's quite important to note that perhaps one of the major measures in the current budget, the pharmacists being embedded in residential aged care facilities, we have very good trial data from a trial that was done in Tasmania, that intervention in and of itself has a very substantial impact on inappropriate prescribing, and we hope to see that having a major additional boost on the inappropriate use of antipsychotics.
But we've still got a situation, I'm just reading more of the details of the Human Rights Watch report, that for the financial year 2020-2021, we had 347 aged care services were found to be non-compliant with the 3 requirements of the quality standards that may indicate issues with chemical constraint. So clearly we have still got a very significant problem, and looks like that there is more actions that are going to need to be taken.
We don't dispute that the problem is not yet solved, Senator. We are working... It's a very high priority for the department, for Ms Anderson's commission, for us to essentially eliminate all but the most essential use of these drugs. The evidence would suggest that probably around about the less than 10% of people would have a legitimate reason to be on an antipsychotic drug, and we've still got a way to go. We would accept that.
And do you acknowledge that the large reason behind it basically comes down to staff shortages?
I think it's much more complicated than that, Senator. It sometimes goes to the built environment of the facility. It sometimes goes to staff training. It's not necessarily the numbers of staff as much as their capacity and willingness to deal with difficult behaviours. It goes to also some of the prescribing behaviours of the GPs who work, and we've done a lot of work to try and educate GPs. When I was Chief Medical Officer, I wrote a personal letter to every high prescribing GP, and that also had an impact. So it's a complex, multifactorial
But
issue.
you wouldn't deny evidence, as was in the ABC report, of former aged care nurse who basically said, she witnessed workers using antipsychotics as a form of restraint because they did not have the capacity to care for residents. I went home often in tears because I thought it can't stay like this. It has to get better. It has to improve. We can't be treating elderly people like this.
Senator Rice, I'll pick that one up, given that I have had a long-standing interest in this. And I think it is, as Dr. Murphy has said, there are many complex reasons for this, and this is not something new. So it is a practice that has been around for many decades, but unfortunately a lot of it was also regulated in homes and facilities by states and territories.
Okay.
So what I'm saying...
I'm just looking at the time, I know I've only got 5 minutes, so I've got two more
It's not a
changes of
binary
questions.
single reason. This is a long-standing practice that we are now seeing because we're measuring it and we're having it reported so that we can actually deal with it. But as Dr. Murphy says, there's complex reasons that relate to GPs, to staff having no other method for behavioural support.
Thanks, Minister, because I've got to move on now, just looking at the time. I want to actually go to the levels of booster vaccination rates in aged care facilities and what percentage of residents at all aged care facilities have received their first booster dose.
We'll get General Fruin on the line again.
Morning, Senator. Lieutenant General John Fruin, Coordinator General of the National COVID Vaccine Task Force. Was the question about boosters, Senator?
Yes. So what percentage of residents have received their first booster or their third shot?
Would you like
Dr. In aged care residential facilities, it's 94%.
Thank you. And how many facilities have yet to receive any first booster doses?
Every facility has had at least one booster visit, Senator.
Okay, so they've all had at least one. So I didn't quite hear the end of your answer there, General Fruin.
Yes, no, every aged care facility has had at least one booster visit.
Okay, visit, right, resulting in the various 94% having actually received these boosters. Will the second booster shot rollout, which has just been announced, will that be undertaken in the same way as the rollout of the first booster shot?
Yeah, so we're very experienced now in both the primary course doses and the booster dose through the aged care residencies and the disability residencies. And there are multiple pathways for delivery. There is some facilities now have the capability
Can I ask you to be
vaccinate
brief,
themselves.
please, General Fruin, because I've only got a couple of minutes left. So is it basically going to follow the same process as was followed for the first booster rollout? Or have you taken any actions to improve it?
We are constantly learning as we go, but you'll see from the high rates that this is a very effective program.
Okay, and will eligible staff be offered their second dose of the booster shot during this rollout process?
Absolutely.
Noting, Senator, that the fourth winter shot will not be available to most staff unless they're over 65, because it's not the winter shot, which we're talking about as this fourth dose, is not a broad population eligibility. So, but if staff there are over 65 or have immunocompromised and are eligible, they'll be able to get a booster.
How are you're calling it a winter shot. How does that account for tropical Australia that doesn't have winter?
I think Tropical Australia understands the concept of winter. Perhaps Professor Kelly can explain the reason why ATAGI adopted that term.
Yeah, it's a good point, Senator. I understand that, but we have the same issue with flu vaccination every year. That's at a particular time, recognising that Northern Australia actually has a slightly different flu season, but that's just the way nature of these matters. The main reason is to get away from the is it a fourth, is it a fifth, is it a third. It was getting a bit confusing with the numbers.
Could be mid-year. It sounds very southern state-centric. As a Victorian, it makes sense to me, but I imagine if you live in Darwin, you'd feel
I think the most important thing is we're
not paid attention to.
Yeah,
all right,
my
final questions, yes, which are about the allied health in aged care facilities. I presented a petition to the Parliament this week, gosh, it's been a long week, that 20,000 people had signed concerned about the fact that physio and other allied health services aren't being mandated under the new funding instrument. We have considerable evidence from the allied health professionals that there are contracts for physiotherapists that aren't being renewed, and so they're deeply worried that residents of aged care facilities are not going to be getting the physio that they need. How are you going to ensure that residents, in fact, are going to get the physio they need, given that it hasn't been mandated?
So I think, thank you, Senator. So I think we've got kind of four things we'd say. I mean, we have been, first thing to say is we continue to talk to the allied health professions about the implementation of the ANAC changes. As I said before, when we look at the funding that was associated with the introduction of ANAC, we think that there's no reason to think that there would be a reduction in allied health. It is true that ANAC works differently to ACFI. I mean, ACFI has a series of questions that lead to a direct service response. In some respects, that's actually one of the flaws of ACFI because it means that the claiming behaviour is not...
I've got one more question and I know that I'm running out of time, so...
Oh, OK, well,
yeah.
So as I said before, so the four responses we say, as we said before, the ANAC has incentives in it that would encourage reablement. The dollars seem to be adequate. We've committed to allied health that we would measure how much allied health hours are in the system. So, and we're continuing to talk.
How are you going to respond then to the evidence that there are physio contracts that aren't being renewed by some aged care facilities?
Well, we're aware of reports of physio contracts not being renewed, but we've not seen in the figures that we've got that there's a large
I'll get the allied
reduction.
health professional peak body to forward you their information. My final question is about, again, we talk about consulting with the allied health professionals. They tell me that they were not consulted on the supported home reforms. How do you respond to that?
I think that's just basically untrue.
They emailed us a copy of the letter they sent to the Assistant Secretary to the Supported Home Reform branch of the Department, where they stated no allied health bodies were invited to any consultation sessions.
Well, Mr Morgan's here. He might be able to assist you with that, Senator.
Nick Morgan, Assistant Secretary, Supported Home Reform Branch. Yeah, we've conducted a whole range of consultation with a number of allied health professionals through different parts of our consultation process on supported home. We've started with a research exercise last year that Health Consult did for us, which was a data study looking at a new assessment and classification system, and we had allied health professionals.
Why, in terms of the peak body, Allied Health Professions Australia are telling us that they were not consulted?
Well, in January we released an overview paper for supported home, which had a consultation process announced as part of that, which we're in the midst of. And as part of that, we are consulting with allied health professionals.
So you're saying they haven't been consulted yet, but they will be, even though it's planning is well underway.
They haven't engaged with the consultation process, if they haven't been part of it.
They said that they stated that no allied health bodies were invited to any consultation sessions. So you're saying that's wrong?
Yeah, that's not true. We have engaged with allied health professionals along the way.
Okay.
I have responded to that email
Can you take on notice in the list of the allied health professionals that have been consulted with so far and who you intend to consult with?
I'll take that on notice.
Because certainly they're not feeling listened to by this government, I can tell you that.
Final question.
That
Thank
is,
you.
thank
So
you.
Senator
Thanks,
Hughes,
Chair.
Senator Smith just has a couple of questions, and then we'll go back to.
Thank you very much. In the last election, Bill Shorten didn't mention aged care and didn't mention aged care in his election speech. And last night, Anthony Albanese didn't mention anything about home care packages. So I thought I'd just revisit the issue of home care package funding and the number of home care packages that have been made available in the period 2013 to now. Is that you, Mr Lai, or
Dr Hartland?
Dr Hartland. Thank you very much, Senator. So in 2012, 12-13, there are 60,300 odd home care packages. By the time we get to the end of this financial year...
I think we'll go year by year, Mr Hartland. Yep.
By the time we get to the end of this financial year, we're expecting 235,600 odd packages, and at the end of the by July,
so that's 235,000.
597 is the modelling that we have. By the end of July.
What does that represent in terms of a percentage increase from 2012 to 2013?
I think I have a note on it here. So 11-12, there were 59,000 odd packages, and to the end of 24-25, you get to 275,600 packages, and that's an increase of 365%.
365% increase in home care packages since the last year of Labor to this year.
Since 11-12, but yes,
Yep.
that's right.
What can you share with us in regards to wait lists for high priority Australians? Just start with how we characterise high priority Australians.
So, home care assessments have two levels of priority, medium and high. So high priority means if you're in immediate need of assistance, the wait times now for someone wanting to access someone who is characterised as high priority are all under a month.
Under a month. And how does that compare to the 2011-2012 period?
I don't have those figures with me, Senator.
But there've been
they're
some
available
system...
in the report of government services. But in 11-12, the system was very different, so they're not really comparable.
Exactly right. So you wouldn't have been able to see the wait list under the previous
wait list
system.
No, I mean, until 2017, there wasn't a national priority system, so there was no national consolidation of the numbers of people who were eligible for and seeking a package but hadn't got one. The report on government services published elapsed time between assessment and receiving a home care package, but the figures were done on a slightly different basis, so hard to compare, and in any event, I actually don't have the figures with me, so we're probably not going very far with that one.
What can you share with us in regards to alternative policies around availability of home care packages?
Well, I think that's a better question, Minister.
I think that's probably for Mr. Hartland to.
Well, I mean alternative policies. If you mean by the Support at Home program, which we're working on, I think that's something we can talk to you about. So, the government has announced an intention to introduce a new system. As Mr. Morgan said just a second ago, we're deeply involved in consultation on that. We released a paper that outlined how it might work. I would say, I think Mr. Morgan covered this, that it's proposals for consultation, so we've got quite a variety of views expressed to us that we're working through, and I suspect that, the process will be to reflect on that, complete our consultations, reflect on it, and then take it to the Minister to consider implementation paths and the final design of the program.
And in regards to alternative policies from other parties represented in the Parliament?
That's not something I can comment on, Senator. I'm sorry.
You certainly didn't hear one last night.
We didn't hear one last night. We didn't hear one from the previous Labor leader either, Mr. Short.
We did not. Is that your in?
Senator Watt, would you like to elaborate?
Dr. Hartland, could you please give us the updated figures for how many Australians have died while waiting for a home care package?
Senator, I believe you asked me this question at last estimates.
Yeah, I wasn't sure if you had up-to-date figures.
No, I don't have an update since last estimates, I'm sorry.
Could you repeat those figures for us, please?
So in the 6 months from July to December 2021, 3,802 people passed away while they were on the National Priority System.
What period of time was that, sorry?
July 2021 to 31 December 2021.
What can you share with us in regards to the demographic of that number? Age profile, gender profile, a level of frailty?
Well, I mean...
Well, they're people that passed away, so I'm guessing they were probably pretty frail.
I think...
Senator Watt, unlike you, yes, we don't guess.
Can we let the witness answer the
last few
question,
weeks would
please?
suggest it's
Guessing
probably
is
not
not
true.
Minister, you're not
methodology
helping.
for someone who wants to be in
Order.
government.
Minister, you're not helping your cause.
So we'll let the witness answer the question, or
I mean,
take
look,
it on notice, whichever you
we've-
prefer.
I mean, we've always said, and I know this is in dispute in a wide sense, not just among the committee, that that mortality rate reflects the mortality rate of people from the age cohort. So we've said that consistently for the last couple of years, and we've not seen any evidence that would suggest that it's something particular about waiting on the NPS. It's unfortunately that for any age group there's a background mortality rate, and it's reflected on it. The numbers of people that are passing away on the NPS are coming down because the NPS is smaller. So we don't celebrate all that figure either.
Dr. Hartland?
I think we're on to is the correlation versus
Well, I thought he actually had
causation.
finished, which is why I asked my question.
Sorry, no, I
And I
haven't.
think so the point that I'm going to, Mr. Hartland, is causation versus correlation. Can you expand upon that?
Well, look,
I think Senator Watt's trying to suggest that people have unfortunately passed away.
I think that's a technical question, so
Sorry, Professor
I might answer that, Senator Smith. So I think your point you're making there is that just because someone is on a waiting list for home care does not in itself cause death, but in fact the people that are on that same list are the ones that are seeking care because of their frailty and the like, which makes them more susceptible to death. So as Dr. Hartland has said, that's we're looking to everything we can do to expand home care, and that's the sort of work we're doing at the moment, which would of course decrease that waiting time.
Okay, now we'll go to Senator Watt.
Dr. Hartland, you've given me the figures for July 2021 to the 31st of December. How far back have you got figures for?
So these are all on the public record, Senator, but I've got figures for 2017.
Can you just take me through each year? And are these financial years or calendar years?
Financial years.
Okay, so from the 1st of July 2017?
17-18, we saw 16,000 people, 16,076 people pass away while they were on the NPS.
Yep.
18-19, we saw 11,987.
11,987?
Yes, that's right.
Yep.
19-20, we saw 10,563.
Yep.
And 2021, we saw 8,068. So I believe we provided these to you previously under notice or you questioned, but I hope they're consistent with what I've said to you before.
So since the 1st of July 2017, it's around about 50,000 older Australians have died while on the waiting list for a home care package that they have been approved for.
Oh, I haven't done the maths, Senator, but I'll trust your maths. But, I think the point that comes out of that is that, the national priority system, peaked at around about 120,000 people, perhaps 130,000 people if you go back further. And, that's a lot of people that are in contact with that system. And unfortunately, background mortality rates mean that that's a lot of people that pass away while they're on the list. And, the biggest change in home care is the reduction of the national priority system over that time.
Thank you.
Chair, I'll just in relation, just further to that, I think it's important to note that the home care system and the health system, which is actually responsible for the health conditions of all Australians, including those seeking home care, one does not replace the other. So it's actually quite, I think, a fallacious correlation, Senator Watt, that you're inferring in terms of causation, because home care does not replace, but it complements the healthcare system. And also, I think it's important to note that high care packages are now approved within a month.
Yeah, that's evidence earlier. So, Senator Grogan, you're continuing on?
If I could just talk a little bit about training places. In last year's budget, the 2021-22, there was an announcement of 33,800 training places for aged care workforce as part of Job Trainer. Is that correct?
That's correct. That's correct.
Yep. So could you just let me know how many people have enrolled in the program since it was announced?
Senator, we don't have those. I don't have those numbers of the new who's taken over the 33,800, because we have to get those from the states and territories, and I don't have up-to-date data on that, and that we get that through DESI. But I do.
So, what's the schedule for getting that reporting? Because that was announced 12 months ago.
Yeah, so we're working
nearly.
we're working through DESI to get that reporting going with the states and territories, and I think that negotiation's underway. Ms. Gleeson might have further detail on when we expect to start getting those reports in, but we know, I guess we're talking anecdotally, or we're talking to the states and territories via DESI about how those places are rolling out, and they are rolling out. I just don't have up-to-date data. I don't know, Ms. Gleeson has any further detail.
We can.
We have no sound.
Sorry, can you hear us? Oh, the video's not working.
I think we've got a bandwidth problem.
Bandwidth problem.
Maybe without video.
Maybe you've turned your video off.
Turn your video off.
Might help the sound.
Yeah.
Can you hear me now?
Yes.
Okay. So we do have some figures in terms of enrolment since Job Trainer Mark 1 commenced. So we can't view a number against the 33,800, but we can tell you that since October 2020 to the end of January, there was 23,406 enrolments in Certificate 3 in individual support. Now that actually doesn't disaggregate by aged care. It covers those enrolled in both the disability and the aged care stream. So that's the data we have at the moment since the beginning of Job Trainer. We're working on getting that more detailed data on the aged care places that were part of Job Trainer Mark 2.
Okay, so October 2020 to January 2022, is that right?
That's correct, yes.
Okay, so, but of those 23,000 that have enrolled in Cert 3, you don't know how many of those are related to the 33,800 Job Trainer places?
That's correct, yes.
Okay. Do you have an estimate of when you might be able to understand how that budget measure is rolling out?
I would have to refer that to the Department of Education, Skills and Employment, who are, as Mr. working directly with the states and territories on those reporting arrangements.
Okay. And so, I mean, what I'm interested in working out is, of that piece, that 33,000, how many have been trained, how many have turned out, if there's a preference for where they're going, if they're going into residential aged care, home care, disability care, just to see how it all is actually tracking along, and then to see how many are going in and potentially making a different decision. I met with some aged care workers, both resi and home care, earlier this week, and one of the things they were saying is that people are going through the training and then deciding at the end of it that the wages are too low, the conditions are too poor, and they don't then proceed into the workforce. So I think in looking at this kind of program, we need to be very clear about what's happening with those numbers, because obviously the headline number 36,000, you go, okay, cool, go and get those people trained, but what's happening to them is really important, because obviously one of the critical things within the aged care piece is until we fix wages, we're not going to fix a lot of the other things, because it's less stressful and more financially rewarding to go and work in the local supermarket or things like that, whereas we need people who are vocationally driven to work in the aged care sector. And until we do something about the wages, I don't think we're going to get there. And the training piece is critical, but if they're going through the training and coming out the other end and determining that it's not worth their while for the level of stress, because it's hard work in aged care. It's very, very hard work, and the reward that they get for it is not commensurate, in my opinion, and in the opinion of a lot of other people.
So, Senator, we are doing other things to track how the training program is rolling out and how that flows on to residential aged care facilities. So we work really closely with the Human Service Skills Organisation, and who are also reaching out to registered training organisations, and also trying to improve that link between RTOs and providers, because you're right. We have to get that relationship right, and it's there's a whole suite of supports that a new worker needs to have around them when they enter aged care, and that's what we're trying to do through a number of our programs, talking to providers about the culture that they provide for workers, what's their value proposition, what are their career planning that they do with workers, so that all those things contribute to whether a worker wants to stay in aged care. And that early stage, those first weeks or months that someone goes into aged care are the most important, so we can make sure that we can keep them in aged care.
Yeah, and I think, the combination of the level of support within the facility. Like I say, I met with some aged care workers earlier this week, and some of the stories they were telling would curl your hair about what they have to deal with on a daily basis and the lack of support they get doing it. Yeah. If we've got a bit more time, I can go back to
You've
Murray.
still got a few more minutes, so yes. Senator Watt.
Thank you. Can I just deal with the issue of food standards in residential aged care? And I might need Ms Anderson back again. You've given us some figures about the number of nursing homes that responded to your survey and the percentage that were high risk. Just one question for Ms Anderson. Sorry. Just while you're coming out, what I think you said before was that you're now in the process of assessing the high risk, the 4.5% of providers that were high risk. So we're talking there about roughly how many providers?
Approximately 40.
About 40. And you said that they're now a priority for monitoring, the monitoring schedule?
Yes, that's correct.
As in inspections?
It may be an inspection, it may be other forms of monitoring. We do things other than actually visit sites.
How else would you monitor the standard of food being provided in the 40 high-risk facilities if you weren't visiting them in person?
Oh, we have lots of opportunities. We can require them to produce certain information. We can require them to indicate that they've surveyed their consumers. We can get those reports. We can speak to their consumers directly via telephone or other means. We can also continue to watch for complaints that we may receive about their services and whether we receive any serious incident notifications. As I say, we have lots of channels.
Yeah, surely you wouldn't just wait for further complaints.
I didn't say that, Senator.
No, but that's one of the strategies?
One of a number, yes.
Yeah, but surely wouldn't it be better to actually get in there and have a look at what sort of food's being provided to people?
It would depend on the way we understand them and the specifics of their risk profile. In a number of circumstances, it may be that a visit would be appropriate. If that was available to us in the COVID world.
So there's nearly 5% of residential aged care facilities that your organisation has deemed to be at high risk of providing inadequate food?
Yes, where we have genuine questions around whether they are compliant with their requirements under the Aged Care Act in terms of the quality standards.
So nearly 5% of facilities fall into that category, and at this point the only action that's proposed is monitoring them?
No, that's incorrect. In my earlier response, Senator, I said that we were going to require all high and medium risk services also to participate in compulsory education.
Right. So you don't think something stronger than that is required if these are organisations that your agency has deemed to be at high risk? They've got to do an education program and they'll be monitored?
Senator, the monitoring may lead us to further regulatory action. We are an agile regulator, and at any point, if our level of concern is escalated, then we will take the necessary action and possibly even move to a compliance enforcement decision.
Okay, can I just clarify, this information came out of a survey? Am I better to direct this to you or to departmental officials?
Depends.
Just questions about the survey?
Probably department.
Okay, so Mr Lai or Ms Lappin, that's probably my only questions for you, Ms Anderson.
Thank you.
So the survey that provided this information, can you just remind me, did it only focus on food or were there other issues? Just really briefly, Ms Lappin, because we've only got about 5 minutes.
Food and nutrition. So
Food and nutrition.
Things about bringing whether the food is on site or whether it's being brought in. Also things about, also questions about allied health. Also questions about any kind of new or innovative initiatives that a service might have with regard to food and nutrition.
And was the survey mandatory for all providers?
It was mandatory if they wanted to receive the BDF supplement, yes.
Which is the $10 per resident?
Yes.
Okay, and I think Ms Anderson told us before there were some providers that didn't respond?
There were, yes.
Do you know how many there were?
One moment.
Nearly to time, no?
Yep. 4 minutes, I make it?
As long as I don't need to clarify at the end, which I was just thinking I might.
I think it's
Sorry, there was one that didn't provide the original undertaking, and in terms of submissions for the first quarter, there were 22 late submissions, and the second quarter, 38 late submissions.
Okay, and were all the questions in the survey mandatory, or did some providers respond and provide some answers to some questions but not to others?
At this stage, there are mandatory and non-mandatory questions.
Right, so do the non-mandatory questions, do they include issues around food quality and nutrition?
They do.
So this survey, it was essentially optional for providers in the sense it was not mandatory to respond to some questions about food quality and nutritional standards.
On some questions, yes. On other questions, it was mandatory.
How can we be so sure then if there are some questions that are not mandatory? Why wouldn't you just make it mandatory?
Mainly, it was around that this was the first time this information has ever been reported, and we're waiting for some maturity to develop into the system.
Maturity?
Just reporting maturity and data capture. Having said that, the department will soon introduce quarterly financial reporting, of which food will be a part, and all questions will be mandatory for that.
So, as we currently stand, it's not mandatory for providers to report on their food standards. They have to if they want to get the supplement.
That's correct.
But when they do respond, not all of the questions they have to answer are mandatory.
At this point in time, yes.
At this point in time. So it would be a new requirement to make that reporting mandatory, as in every question needs to be answered?
The additional questions, yes.
That would be a change. And are there any mandatory aged care food standards that already apply to aged care facilities?
Yeah, so certainly in terms of the aged care quality standards, there's requirements around food there.
But are they mandatory? Would you say they're mandatory requirements?
Yes.
Right.
Yes, there's mandatory requirements on food and nutrition. And also, as part of the response to the Royal Commission, the department is currently doing a review of the standards, and one of our areas of focus is food and how we might, increase the requirements of those food standards as part of that review.
And is the reporting, the information you've gained via this reporting, is that publicly available?
Yes, it is.
Broke by home? Is it broken down by home?
Not at this stage,
Right,
no.
so it's aggregated data?
Yes.
Okay. So, again, to make that level of detail reporting broken down by home would be a change to what we see now?
Yes.
Right. Just to wrap up then, the reason I ask that is that the Labor's announcement last night around food quality is clear that all questions in these surveys would be mandatory, and much more detailed reporting than what is currently done would be publicly available. So that would be a change to what we see at the moment?
That level of detail, yes.
Thank you. So, Minister, just to end where we started, when I asked you what you thought of Labor's plan announced last night, you said that you were aghast and that it was basically things that the government is doing anyway. But what we've established this morning is that Labor has said we will require a registered nurse on site 24/7 in residential care. We've established, while the government has said it will do that, there's no money in the budget. Labor says we will increase personal care to 250 minutes of direct care a day. The government is only budgeting for 200 minutes a day. We have said we will formally support a pay rise for aged care workers. You have repeatedly said that you won't do that. We have said that we would require better food for residents, including mandatory reporting, real mandatory reporting where people have to answer questions. We've heard that doesn't happen under the government. We've said that we would require more transparency.
Or is this a restatement of the...
We've said that we would require more transparency.
Very shortly.
What we're not getting at the moment is detailed public reporting. How on earth can you sit there with a straight face and say that what the government is doing is exactly the same as what Labor is planning, when on every single one of those measures, your government is not currently doing that, and that's what the evidence has been today?
Senator, what I, like most of what you've actually said and asserted today, and including Mr Albanese last night, I completely reject the premise of your question.
So what the official
let's
numbers
have a
is
look
wrong?
No, let's just have a look at the facts. You've raised a lot of that. So let's just remind ourselves of exactly what Mr Albanese did last night. Yes, I was aghast. He didn't mention home care, which is not surprising because when in government you only provided 60,000 and we're going up to well over 250,000, in fact more. I'm also aghast that you've made unfunded wage commitments. And also you've got a policy, you've announced a policy but no plan behind it, no proper funding behind it, and somehow you're going to conjure sort of, 14,000 odd nurses in a faster time than the Royal Commission itself has recommended, with no plan. That is what I'm aghast at, because Australians deserve so much more than that lack of ambition, Me Too policy from Mr Albanese last night. We are also putting in food standards. What's what you forgot to raise as well, a 5-star food standards. So
keep going. I was aghast.
I was aghast because
Keep going.
You have something
Can I
that
move an
is
extension
a
of time?
very, very, very poor Me Too of what we are already doing. We have put, for the Royal Commission, $18.8 billion into it on a very comprehensive 5-pillar plan. We are implementing what we can now. We are doing further research, as Mr Lai has said at something, to get the information so that we can do more in the time frame that the Royal Commission has recommended. We're not trying to do something faster than the Royal Commission or we think can be.
So you admit that you're not doing what we're proposing?
Let the Minister answer and then we're going to move on.
We are doing what the Royal Commission has quite responsibly proposed, because you're just making stuff up, Senator Watt. And Mr Albanese last night didn't even mention home care. And shame on him and shame on you for forgetting the hundreds of thousands of Australians who need home care.
So you admit that you're not doing what we're proposing?
Well, it's now past 12:15, so we're now going to conclude our examination of ageing and aged care outcome 3 for today. We will be returning next Wednesday to continue our discussions. But any further questions can either be placed on notice or held over till next Wednesday. And we'll now move on to outcome 1 in regard to programs 1.8, 1.9, and have the TGA, the Office of Gene Technology Regulator, and ATAGI on standby.
Are we TGA?
Yeah.
TGA.
So we're just going to start with...
But the idea is to do TGA up until lunch. Is that right? Yep.
Oh, no. Is everyone... Okay, so I think we're ready to go, so I'll give Senator O'Sullivan the call.
Thank you very much, Chair. Officials, thank you. Wondering if we could just start by just getting an update on more generally, the efficacy of the vaccine program that we have currently running with the COVID vaccines, please.
The efficacy?
Yeah, so how effective is it continuing to deliver the results? Certainly, anecdotal, what I can see in my home state of Western Australia, we've saw a report this morning from a clinician in one of our major hospitals said that no one's on ventilators in any of the Perth hospitals at the moment. So I'm just sort of more generally, you know, how is it?
Can address that. Yeah.
How's the program going?
Thank you, Senator, for the question. There's no doubt that the absolute best way of avoiding COVID-19 is being vaccinated. And we have ample information and data about that with the millions and millions of doses of vaccines that have been given around the world. They are a safe and effective way of preventing death. They're a safe and effective way of preventing severe complications of disease. So what we're seeing in Australia, as is happening in many parts of the world at the moment, is what I would term a decoupling of severe disease from case numbers. So if you see what's happened in the current wave, and there is a wave of the BA2 variant of Omicron in Australia at the moment, as there is in many other parts in the world, case numbers have increased quite a lot, including in your home state of Western Australia, but that has not been matched with an increase in intensive care. It has not been matched specifically in an increase in ventilation, and deaths have remained stable during that period. That's the same as is being seen in other countries with extremely high vaccination rates as we have, primary vaccination, boosters, and from next Monday, the rolling out of boosters for vulnerable people. So to give an example, at the moment, deaths are 7 times higher this year in people that are unvaccinated compared with vaccinated people. They are twice as high for unvaccinated people at risk of going into intensive care. And in Western Australia, and I was talking to a colleague about this just this week, even the numbers we're seeing in intensive care may not necessarily be matched with people being in there because of COVID. They're there because they've been tested on the way in, as we've discussed here before, as a very reasonable screening for protection of staff.
So it's more
and other
incidental
patients.
rather than...
So, for example, in one large hospital in Perth at the moment, there are three cases labelled as COVID in ICU. None of those people, 0% of those people are there because of COVID, they're there with COVID. And that's what we're seeing across Australia at the moment. So highly effective and very important. And it's what's led to our change in our response that I mentioned earlier, that we're talking, and the Secretary also mentioned, we're concentrating on protecting the vulnerable now rather than stopping transmission of the virus.
And is it still the case that the unvaccinated are overrepresented even in those that are in there for COVID? So it was either the Premier or the Health Minister in WA mentioned that it seems to hover around 30% of cases are in a hospital that are unvaccinated, yet represent less than 5% of the population. So is that consistent across the country?
Yes, it is, Senator, and there's a couple of reasons there. What we have seen in the epidemiology throughout this year with Omicron, and Omicron is more transmissible. It's not more severe. It does avoid immunity either from 1 or 2 doses of vaccine, less so from 3 or subsequent doses, and so it is a feature of the epidemiology this year that we've seen many more younger children being infected because they're not partly because they're not vaccinated. So we're seeing outbreaks in schools, we're seeing outbreaks in even younger children now. And in those circumstances, vaccination is a protection against infection as well as severe disease.
And is the Australian government looking at the impact that natural immunity is having on people's ongoing immunity against further strains? And if we're not, are we, because maybe we don't have enough of those cases here in Australia to be able to do that against various other strains, and also because our vaccination rate is so high, are we looking at other countries that have maybe a lower vaccination rate but have had widespread of the disease across the community, that you could determine what impact natural immunity is having on preventing serious illness and death?
There is an impact of natural immunity. It is not as strong or as long-lasting as vaccination. But I know that Professor Nigel Crawford is online from ATAGI, and ATAGI's been looking at this very specifically, the medical expertise on immunisation. So I might, if that's okay, defer to him. Dr. Crawford. He may not be there yet. But John, do you have something you'd like to add?
John Skerritt, Deputy Secretary, Health Products Regulation and Head of a TGA. There's been a number of studies internationally on the influence of prior COVID infection on subsequent infection. And the numbers vary. Some studies show 1 in 25, 1 in 24 cases of people who get a diagnosed Omicron infection had Delta before. And so, as Professor Kelly said, just having had COVID, and this is a really important communication message out there, if you've had COVID, it's not some dome of immunity that covers you for the rest of your life. You can get COVID again. And there's even documented cases in the medical literature where people have had Omicron BA1 and had BA1 again, or even had this new strain BA2. And so while it is true, and there's been studies I think from Israel that have shown that the severity of your illness, so there weren't cases of deaths from COVID, at least from these small studies, of people who had had a prior infection. The main message is that when it's an appropriate time, you should get vaccinated even if you have had COVID. And the advice is up to 4 months, although in some cases clinicians are advising people once you're recovered you can even be vaccinated, and that's a discussion with your healthcare professional.
Yeah, but even if you've been vaccinated, though, you can still get COVID, but it limits the severity.
Yeah,
of the disease.
So some of the studies showed no ICU or deaths among those who had had COVID previously and then caught COVID again.
Okay. In last estimates, I explored with you the policies around the country in relation to vaccine mandates and extending much further beyond what the Commonwealth Government has mandated, which is for aged care and other sort of critical health sector workforces. We're still seeing in my home state a persistence around vaccine mandates for even farm workers. If you're driving a tractor out in the middle of a field, it's mandatory that you be vaccinated. If you want to go to a cafe and sit down and drink your coffee, you can go and order it for takeaway, but you can't have it sitting down in the cafe unless you're vaccinated. Should we be looking at, if the state government want to persist with that, I wish they didn't, but if they wanted to continue with that, should we maybe look at acknowledging and recognising natural immunity as part of the presence of an individual having that protection against serious disease and illness and death?
So firstly, I do remember the question last time, Senator, and I've had some correspondence after my answer. Just to be very clear, I'm absolutely support and encourage vaccination.
Yes, as do I.
and it is our role as health departments, officials, chief medical officers and the like to explain why that is important and why it is a part of a very good process of protecting oneself against severe disease, as we've discussed. In terms of mandating, we did, as the Australian Health Protection Committee, and I supported this, it went to the National Cabinet in relation to very specific circumstances about mandating, and that was about not only protecting oneself but the vulnerable people you're working with, for example, in aged care, disability care and health care. Beyond that, the Commonwealth Government, and it's also my view, is that mandating should not be required. Now, I understand the situation in WA, and I'd commend them to their extraordinary efforts to get the population vaccinated and to be therefore protected.
But we're there now. I mean, that's the point.
I believe
we're at the high rates of vaccination.
Correct,
So,
and I believe that WA is leading the country now with the third dose, the booster dose. So that's extraordinary effort. We met for a full day last week. The AHPPC met about the winter planning. We discussed the issue of vaccinations and mandating at that time. There was a general sense that we should move beyond that now as a nation because of where we're at in terms of of vaccination. So that was a statement was published last night going into those measures. I think we are there in terms of where we need to. We have extraordinarily high rates of vaccination, first and second dose, now third dose, and fourth dose is starting next week to protect the most vulnerable.
and in terms of, last question, fair enough, yep. In terms of recognising prior infection?
So I'd go beyond that, Senator, and say we don't need to be asking anymore.
Okay.
Either of those things.
Right. That's a pretty powerful statement. Thank you.
Thank you. And I just want to acknowledge that Senator the Honourable Anne Ruston has arrived to substitute in for Senator Colbeck, Minister Colbeck, who's away ill. So we'll go to Senator Rennick.
Okay, hi guys, how are you going? My first question, there are now over 118,000 adverse events recorded against the COVID vaccines. That's an injury rate greater than 1 in 200. And that's basically more than all vaccines put together since 1971. What is it going to take for the TGA to take these injuries seriously and suspend the vaccine rollout until the risks of the vaccine are reduced to a much lower tolerance level? And what is the point of having a database of recording all these injuries if you're not going to use it as a signalling system?
Senator, the purpose of the DANE database is to receive reports to actually feed into identification of whether there are signals, safety signals. The reason why we have received many more reports in the DANE database for COVID vaccines is twofold. Firstly, there has never been a vaccination program in which Australians, the overwhelming majority, in the 90%, have received 2 doses, and as we've heard earlier...
most people get their scheduled vaccines as children.
Senator, if I may answer, the majority of Australians are not under 5 years old. So if you look at the absolute number of individuals...
But over the last 50 years,
Senator, if I can complete my answer. If you look at the absolute number of Australians who have been vaccinated in this program, it dwarfs previous vaccination campaigns. The second thing is the awareness...
But the rate, I asked about the rate, and that's what I want to get to. It is a very high injury rate.
Senator, if I can answer your question, I do not accept your assertion as a very high injury rate. I'm talking about the rate of reports. And as we've explained before, there's a very big difference between someone putting a report, and in many of the health systems, it is a mandatory for doctors to put in a report even if they don't believe there's an association, if it's related in time. So
okay, thanks. Can I ask the next question now? Because I've got a limited
I am
time.
conscious that Senator Rennick's got quite a few questions, so if we can just have...
Sorry?
Senator Rennick's got quite a few questions and we've got limited time, so if we can try and just have
Okay, sorry, I've just got to get through these, so it's got to be a short answer. So I noticed in your recent half-year report that over 50% of the reports are actually from the state governments themselves. And what do you do to vet those reports and make sure that the state governments aren't vetting reports? And I'll just put in there that I know a cardiologist who's contacted me. he lodged 3 adverse event reports for myocarditis, and the Queensland State Government went back to him and said he can't do that. It has to be the GP. Now, why is it that cardiologists...
He can report them directly to us, Senator. There's absolutely
Well,
nothing
no,
to say.
because he's been told that Queensland Health...
He can report them. You can
Okay,
report them.
well, I'll pass that on.
A doctor can report directly to
Okay,
us.
so Queensland Health are telling specialists that they have to go through Queensland Health. They can't lodge them directly with the TGA.
I haven't heard of that.
Well, I have. I've heard it firsthand.
Well, they can report
Okay.
directly to us.
Okay, I
Any
will.
individual,
I'll pass that on.
Any
Yep.
individual in this country can report an adverse event to us.
Okay, thank you, because I think it's important that you realise that some of these state health departments are vetting out adverse event reports. Okay, just letting you know. Okay, so a TGA whistleblower has given me data this week that says that the number of reports of death on the day-in database is actually 2,142. When the TGA does its weekly report, why does it only report 810 deaths as received and reviewed, rather than give the total number of reports received?
So the total number of reports received is a couple of % higher than that 800. And we checked firstly for duplicates.
Well, that's not what I've been given. I've been given 2,142.
Well, that's not what I've been given,
Right,
Senator.
okay,
So we check for duplicates and we check for fraudulent reports.
Right.
Very sadly, there are some quite malicious people
Yeah.
who are making up death reports.
Right.
So, for example, we have one report in the name of a doctor called Dr. Fake Doctor.
Right.
We have
So how many? Okay, so I accept that. How many of them are?
Less than 2%,
Right,
we
okay.
believe, are removed from being duplicate reports or clearly fraudulent reports.
Yep.
And even in those cases, there may be a doctor called Fake Doctor. We follow it up to see if there is such a person and whether it is a genuine
Okay,
report.
so they're only 2% of fake.
Or duplicates.
Yeah, okay, that's fine. We just need to quantify that. Thank you. Given Pfizer has tried to cover up releasing all of its COVID vaccine trial data for up to 55/75 years, has the TGA asked Pfizer for the reasons why it refuses to be transparent with the trial data? And is the TGA concerned about the fact that Pfizer withholds data given its prior criminal convictions?
We have the trial data that was required under the conditions under which we and other global regulators review vaccines. We have the complete trial data from Pfizer. I think you're referring to the subject of a US Freedom of Information action. That is very different to the regulatory data package. The regulatory data package for these vaccines can be up to over 200,000 pages of data, so it is extremely extensive.
So I'll note though that data was based on vaccines produced in the laboratory and not vaccines commercially produced, and that matters because there's a different manufacturing process. Has the TGA, and I know that you signed off based on trial data where they used the laboratory...
not true,
vaccine.
Senator. No, that's incorrect, Senator.
So you basically signed off, when you signed off in December 2020, you signed off on data, vaccine trial data that used vaccines commercially produced.
So the vaccines that are used have to be made using a process that is either the commercial process or directly equivalent to the commercial process. And one of the reasons, for example, that we took a long time to review the Novavax vaccine is we went back many times to the company until we were convinced that the small-scale production was equivalent to the commercial production.
So what date
so
did
that's an
Pfizer
absolutely
give you?
critical
Thank
part
you.
of the process.
Okay, so at what date did Pfizer give you the data based on the commercial production of the vaccine and not the laboratory production of the vaccine?
So we have the data from the clinical trials from Pfizer, and we have the data for the commercial production. I'll also remind you that every single batch...
what date was that?
Sorry, if I can finish my sentence, Senator. I'll remind you that every single batch of vaccine is going through TGA laboratory batch release.
Okay, and how much variance have you got in mRNA?
Every single batch of a Pfizer vaccine has met the specifications.
And what's the variance between intact RNA and degraded mRNA?
I can take the question on degraded RNA and notice, but it is extremely low.
Right, okay.
But we do assess for that and we do test for that and we reject a batch if it did not
So what
meet
is
the
your cut-off
specification.
rejection batch?
I'll take that specification on
Right,
notice.
okay. So I refer to Freedom of Information number 3604, where the TGA was unable to provide documentation on genotoxicity issues related to the provisional approval of the Pfizer COVID vaccine. Has the TGA assessed the genotoxicity risks of the vaccine given a large number of modifications to the spike protein, including the replacement of amino acids to speed up the production of spike proteins, the addition of adenosine nucleic acids prolong the life of the mRNA and the replacement of uridine with sururidine, which is used as a signal by the ribosome to stop the production of the protein. Given these significant modifications to the genome of the virus, spike protein, shouldn't there have been significant quality control and testing around the potential risks of the modifications?
So, Senator, those issues have been looked at some length, including the use of pseudouridine, which
So
is...
why weren't they released as a part of the Freedom of Information request then?
because that information is considered as commercial in confidence.
Well, that's not what you said in the Freedom of Information request.
As you realise, our regulatory submissions do contain commercial in confidence information.
Well, that might be commercial in confidence, but that's going into people's bodies, and it's very important that people are aware that the spike protein that they're receiving from the vaccine is not the same genomic sequence as the spike protein from the virus. And I think people, as per the immunisation handbook, have a right to know what the risks and benefits are of the vaccine.
And that's why you have a medicines regulator who publishes an Australian safety report. So, for example, the AUSPAS, the public assessment report, was published the day that the Pfizer vaccine, the very day, at the same time the Pfizer vaccine was approved.
Okay, and I still have a right as a senator, and as a senator, as a representative of the Queensland and Australian people, I've got a right to ask for that information, and I want to know all the data on the genotoxicity of the modified mRNA vaccine, because people think that they're getting a spike protein that's equivalent to the virus, and they're not. It's been supercharged to produce spike proteins, and I think the public deserve to know that.
It's been modified to produce a stable product which will produce a good
that stays
immune
in the
response.
body longer, that increases its half-life.
There is no evidence for long-term persistence of the spike protein.
Okay. Just because there's no evidence doesn't mean to say that there isn't evidence of no dangers. There's a big difference where you put the no. Okay, there's no evidence because there hasn't been enough genotoxicity studies done in the human body.
I disagree with your statement, Senator. I believe that the studies have been adequate.
Senator Rennick.
Well, that's what we asked for in the Freedom of Information, and it wasn't
Rennick, can I just grab
forthcoming.
your attention for a moment? You've got less than 3 minutes to go, and you also had questions, I think, for the Office of Gene Technology and Atagi. Did you have that or not?
Sorry?
You've got less than 3 minutes to
Okay,
wrap
no,
up,
I'll
so-
stick to this one, but I'm happy for the Department of Health to answer this one.
I'd like that information too, Senator Rennick.
Yeah, hang on. Yeah, okay. So I asked last year and I'll ask again, has there been studies on the safety risks of multiple booster shots to the immune system of 4, 5 or 6 shots within a short time frame of 2 years?
There have not been studies in a regulatory submission of, say, 6 shots. There have been real-world studies of the safety and efficacy, say, of a 4th shot of vaccine.
Real-world studies, so no actual trial data.
No, they are studies. A real-world study where you have many thousands of people vaccinated for a 4th time, followed for an extensive period in the health system is...
But was there any studies
and published
done
in an
prior to that?
international journal.
I'm
is
aware there's
Spike
real-world trials because people are being used to work this out, but I'm asking, did you do any trials for 4 and have you done any trials for 5?
The regulators do not run clinical trials, Senator.
Okay, well that's okay.
No regulator in the world runs clinical trials.
Has the manufacturer of these drug companies or the drug companies run trials on 4 or 5 boost?
Well, the manufacturer was
doses?
closely involved, but with these real-world studies, because that is how you gain data. So if you're working with a population that's already vaccinated, the way to gather data on the safety and performance of a vaccine is to use people who have had, let's say, 3 vaccinations and are having their 4th vaccination. But in this case, they are closely monitored for any possible adverse event and also
So you're
closely
using
monitored for efficacy.
real people outside a trial setting, and is this an active or passive surveillance?
Well, in this case, it becomes actively surveyed if it's for a research publication in a top-shelf journal where the study is to say, what is the rate of adverse events after a 4th dose? Is it worse? Are there new adverse events? They are actively followed, and then a study is published in a top-shelf international journal.
Okay, last question, thanks, Chair. And Minister, I may have to get you to follow up this with Greg Hunt, who I did write to about this. Why are we stopping unvaccinated people from travelling overseas? Why do they have to get permission if they've got an Australian passport to leave? I cannot for the life of me see the health risks in an unvaccinated person leaving the country. It seems to me that it contradicts the Prime Minister's statements, and I think Professor Kelly touched on it earlier, that he doesn't believe in mandates. Well, why do we have to restrict people from travelling freely outside Australia if they're unvaccinated. It actually, I would have thought, reduces the risk given there's less people in the country.
Thanks, Senator. I think I know the answer to that, but I'm hoping that the health officials that are in Minister Hunt's office are listening and
Professor Kelly?
Professor Kelly can, yeah. And I'll make sure, well, obviously Professor Kelly is the expert.
Thank you. As the provider of the medical advice, I can stand by that, Senator, and thanks for the question. As you know, we've had various iterations of the, I think, eight emergency declarations after the first emergency declaration under the Biosecurity Act in early 2020. A decision's been made, on my advice, by the government to not renew that emergency declaration after middle of April, 18th of April. There were several elements that were in place that are no longer going to be renewed during that period. Cruise ships will come back. Pre-flight testing will not be compulsory, and a few other measures. But it was seen, on my advice, that it was the safest way was to have a transition out of some of these other measures around vaccination for inward and outward travel. Actually, one of the main reasons for providing that is for protection of the rest of the world. Recognising, as we've talked already in response to Senator
Well, that's not really our
question.
responsibility. I mean,
Well,
the rest of the world
actually-
doesn't have the same requirements. So it's
Actually, it is, Senator, because we are signed up to a treaty called the International Health Regulations, and there is a specific component of the Biosecurity Act which addresses that matter about protection for others.
So you're
Senator
saying
Rennick,
that other
your time's
countries...
expired.
Yeah, sorry. Are you saying other countries have regulations that stop their unvaccinated people from leaving the country as well?
Look, I'd have to take that on notice as to which other countries might have that, but I understand there are still restrictions in relation to vaccination, both inward and outward travel.
Yeah, I know. That's the question I'm asking you: is why is that restriction, and what's the health? What's the health advice on that?
So I've shared what I can with you, Senator, recognising that's...
So it's not health advice.
I've given
It's
to
because
the
we signed up
Minister.
to a treaty.
No, there are certain elements within the Biosecurity Act about protection for other countries related to diseases of concern such as COVID-19.
Okay, so can you might put that on notice, like give me the actual sections of the Biosecurity Act? That's all right.
So you're saying a sunset on that requirement?
So there's no specific sunset, but the plan with many of these things is to not stop everything at the same time, and so that requirement for incoming and outgoing vaccination, international travel to be vaccinated is remaining for the time being, but not under the emergency powers.
Okay, thank you.
thanks.
At this time, I was meant to go to Senator Whish-Wilson. He hasn't appeared on our screens, I don't think. Is Senator Whish-Wilson online? Oh, sorry, I'm sorry. Steele-John, Senator Steele-John.
Double barrel.
I don't think he is, so I might just give Senator Roberts the call for a few minutes, and then when he joins us, we'll...
Okay, I'd like to table these. They're copies of the previous Hansard conversation with Professor Skerritt.
Okay, thank you. So they would be all on public record?
Yes.
Yep.
Thank you all for attending. The latest available TGA Dane report from your website dated 24th of March 2022 says there are 801 deaths, 11 of which are attributed to COVID-19 vaccines. There are, according to the TGA, 801 deaths that doctors have reported as being due to COVID-19 vaccination. The TGA then steps in and reviews these doctor-certified reports and says that there are only 11 deaths attributable to the COVID-19 vaccines. How many of the remaining 790 cases have been reviewed and closed, and how many are still under review?
Senator, when we receive a death report, we do look at it as a matter of urgency. I would emphasise that there are a number, for example, that go to the coroner. So without identifying too specifically the case, we have someone among that list who had a major seizure a week or two after a vaccine, and it was a fatal seizure. Now, no regulator globally has related any of the COVID vaccines to fatal or even serious seizures a fortnight after a vaccine. However, that case, because this person was not an epileptic before they, and sometimes people, their first seizure is sadly their last because it is a fatal seizure. that one is going to that particular state coroner. So that case is still open. So we have some dozen of those number of cases that are either still with coroners because coroners take their time, or, for example, there's still tissue tests being done from post-mortems and so forth. But the vast majority of them have been through the process, and as I've indicated earlier, we go to an external committee of experts if there's any question about causality. So if we're saying, well, gee, we can't really find anything else that would eliminate the vaccine being responsible, we go to an independent committee of experts.
Senator Steele-John has now joined us, so I'm going to have to go to him. Sorry. Okay. Senator Steele-John.
Thanks for that, Chair. Sorry about that. We went over a bit in defence. So my first question goes to the question of the various reports that have been made by the Australian Royal Commission into the violence of abuse and neglect of disabled people. So just for context, on the 2nd of April 2021, the government announced that it either supported in whole or in principle 21 of the 22 recommendations of the Royal Commission's COVID-19 report. So I'm wanting to know, first of all, who is responsible within the department for implementing the recommendations from that report. That's my first.
They're looking around the room.
So I think
Well, that is not a good sign.
No, Senator, obviously there's a joint responsibility between the Department of Health and the Department of Social Services and the NDIA. So that was a joint response. So we have officials in the department who are working on the health side of it, and obviously there are officials in those agencies too. I don't know whether Ms. Rishni wants to add anything.
Thanks, Senator. Tanya Rishnew, Deputy Secretary, Primary and Community Care Group. Senator, as the Secretary has outlined, there were a range of recommendations, and I think we spoke about them at the last time we met at Senate Estimates. My group has responsibility for working with the Disability Advisory Group within the Department of Health. It has a combined membership with states and territories, the NDIA and the Commonwealth Department of Social Services as well. And in terms of looking at the combined recommendations, that has been done across government. So
Okay, so yep, I get that. So I understand, having read the report, that it's there are multiple agencies involved. But since we're in the health estimates section, what I'd like to know is who in health is responsible for whichever of those 21 recommendations you believe are your responsibility. Who is responsible for guiding the implementation of those recommendations?
So, Senator, we take an approach across the group through our Portfolio Strategies Division of coordinating that. The various recommendations will depend on whether they're recommendations around things like vaccination, whether they're recommendations around integration and referral from hospitals into accommodation, whether they're recommendations around working with the sector on primary care responses and mental health responses. So, for example, within my division, we work on things like the Intellectual Disability Roadmap and, as I mentioned, work with the advisory group. And I don't know whether Mr Cottrell would like to add anything to that.
Thanks, Rishnu. Simon Cottrell, First Assistant Secretary, Primary Care Division. Senator, I chair the COVID-19 Disability Advisory Committee, and we convene most of the relevant officials to respond to those recommendations. So, for example, there was one recommendation about improving the reporting of cases and deaths amongst NDIS participants and amongst people with disability more generally. Our Office of Health Protection looks after the reporting of the cases and deaths, and it takes data from the NDIS Commission to do that. So there's kind of a complex arrangement there, And then we have had lots of broader discussions about how to continually improve that data through the advisory committee. It has a data working group that has been continually meeting to match more and more data sets to get a better picture of how COVID's been affecting people with disability and how the response has been working. So that's one example.
Thank you, Mr. Cottrell. Of the 21 recommendations that the government has supported and said that we'll move to, or has said they'll move to implement, how many of those recommendations are being led by the relevant health division in terms of implementation?
I think we need our portfolio strategies division to respond to that, Senator.
So, Senator, can I take that on notice? We'll get that answer for you straight after lunch.
Please do. That's a pretty basic question, and I don't want to have to be waiting until after the election to know who in health thinks which recommendation is something that you're leading on.
No, absolutely, Senator. We've been working through that, and we've been working through that across government. We'll have that answer straight after lunch for you.
Okay, thank you. And can you also tell me of those recommendations which you are prioritising?
We'll do that. We'll do that as part of the comprehensive response.
Okay. And how the effort towards action in the recommendations are, where you're up to in terms of your implementation timeline for each of them. And I'm just going to quickly ask the Chair, I know we're pressed for time, Chair, but it seems like a couple of these I can only really advance once I've got what I expected to be information that the department would have to hand. So would I be able to come back when they've brought that back after lunch and ask some follow-ups? Would that be okay?
I'm sure that will be fine, Senator Steele-John. And also, I know there's a couple of questions that Senator Grogan wants to put on record before lunch with a hope of getting some responses as well. So if you're happy for me to go to that now.
I'll just ask a question on behalf of Senator Cox, and then I'll finish off if that's okay.
Thank you.
I've just asked this question, as I said, on behalf of my colleague, Senator Cox, who recently met with the WA vaccine commander to discuss the vaccine rollout in First Nations communities. She's communicated to me a concern in relation to the consistencies in data that is being used by the Commonwealth and states to estimate populations in regional and remote communities. And I'm wondering whether the department is aware of the fact that states and the Commonwealth are using different data sets to estimate the amount of vaccines required in regional and remote communities in WA. For instance, census versus Medicare data sets are giving very different reads for certain communities, with differences between 900 versus 300 people based on which data set you look at. So it's a concern to Senator Cox and to myself in relation to the impact that kind of discrepancy may have on First Nations communities. So are you aware, is the department aware of the difference in these data sets and the challenges they're causing?
Senator, Lieutenant General John Frewen, Coordinator General of the National COVID Vaccine Task Force. We are very aware of how different data sets are used, particularly in remote areas. And there is no perfect answer because there is a number of different ways of cutting the data. You can do it from point of vaccination, you can do it from point of home address. In those remote small communities, often there is a single common place that people use that they list as their postal address when they don't actually reside there. So we've been working with the states and territories to provide the most useful data sets with the best fidelity that actually gives an accurate depiction. But I might throw to Dr. Detoka, who is most expert in some of these communities and data sets.
Thank you, General Frewen. Dr. Lucas Detoka, First Assistant Secretary, Implementation and Primary Care Response, National COVID Vaccine Task Force. But I only have to say it once. Thank you, Senator. So as General Frewen outlined, we work really closely with our state and territory colleagues, including WA Health, WACS, the WA Country Health Service, and the Vaccine Commander over out west, and as well as the community control health service in those communities. There's no broad discrepancy between the data used federally and in WA. In fact, as General Fruin alluded to, we have been provided some bespoke ways in which the Australian immunisation registered data can be cut on different level geographies to WA Health to aid the very significant vaccination efforts. Wanted to also take this chance to congratulate First Nations people in WA and their combined work by the ACHOs and WA Health and the Commonwealth that has seen vaccine rates soar in WA with more than 83% of First Nations people 12 years and over in WA having received one dose, and second doses climbing really quickly, and the booster rates in WA for First Nations people being the highest in the country. As General Fruin mentioned, just by the nature of small number geography and some of the complexity in addresses in remote communities, granular data in small, discrete remote communities, the smaller you go, the more inaccurate it is, and that's somewhat inevitable. We've done a lot of combined work to try to improve it, including going through the addresses in some of these remote communities and trying to map when there's a post office in a regional town, like people who live in a remote community that has a post office in Broome and their address was incorrectly listed against Broome, so it was inflating the denominator in Broome and reducing it in a remote community. We've been doing a lot of work with Services Australia to improve those and has somewhat improved the granularity, but it is true that in some remote communities with 200 or 300 people, that granularity issue means that the readouts that you get from national data sets might not be as accurate as possible. And that's why
it urgently needs to, I'm sorry to cut you off there, but I'm just aware of time.
Yep.
It is certainly something that needs to be urgently resolved, because if we've got a discrepancy rate of, say, 4%, which is what my colleague has passed on to me in relation to the differences between the two data sets still, that drastically affects impacts the effectiveness of a vaccine strategy for those remote communities. So when do we, I understand what you're saying about the complexity. It is the job of the Australian government to recognise the complexity and solve it wherever you live. So do you have any timeline for when this will actually be, this will be fully addressed and we'll have a clear idea of how many people are vaccinated in these incredibly at-risk communities?
So Senator, a couple of things. So the accuracy of the data has already significantly improved, and we've tested that against other data sets like information from the health services in those areas that had more accurate counts of the people who live in those areas. So it has significantly improved. It doesn't have an impact in terms of vaccine availability because there's more supply than is needed already in those areas, so no one is missing out based on those numbers. But also, can I assure you that the feedback that we get from the Aboriginal Community Control Health Services, like the Kimberley Aboriginal Medical Services that we work really closely with, is that if anything, because of these denominator issues, our numbers are lower than what they have in their own data sets from the clinical information system. So if anything, the vaccination rates in the Kimberley are better than what our data suggests.
Sorry to cut you off.
Okay, thank you. Thanks.
But if there is any further questions from Senator Koch, she's very welcome to come along next Wednesday and continue to ask questions. So just on that point, I know Senator Grogan had one question at least that she just wanted to put on record before lunch to come back after lunch to answer. But in the meantime, I'll just let you know that we're going to release the TGA, the Office of the Gene Technology Regulator, and ATAGI. However, would like to continue with program 1.8 and 1.9 very briefly to answer these questions after lunch. So if that's okay, I'll just ask Senator Grogan to ask her question.
Thank you. So this is about the MRI changes. So in light of the announcements about the MRI items, both billable through the MBS and the changes to provide licences to all MRIs in MMM2 areas and above, could you give us the average cost of an MRI licence for the Commonwealth for MMM1 areas?
The average cost, you mean the average billing per licence? Is that what you mean? The average MBS billing?
Yeah, and the average, so what the licence costs the Commonwealth, hang on, I'm just reading this, we're still analysing your budget papers and finding various things and going, can we quickly get a question in on that?
The licences have no intrinsic value, but each licence magnet can bill, but sometimes the licenses move from one to another, so we could...
The average cost of a licence in those...
We can try and give you the average MBS billings per magnet licence in MM1. If we can analyse that over lunch, we can try. Yeah.
Thank you very much.
Is that your only question? Yeah. Thank you. So we'll now suspend for lunch and we will resume at 2 p.m. Thank you.
Pulling that together so we can come back to you in perhaps 20 minutes or so. Would that be all right?
The problem is I've got some questions I've got to ask in DVA, Chair, and that's at 2:15 my time.
Would you like to put your questions on, or at least state the questions and we can try and get the answers put on Hansard for you?
I'm just aware of the election period, and they really are. I'm just. The frustration, Chair, is that this was only the basic questions to actually get to my line of questioning, and I expected that the department would be able to tell me, these knowledge.
They have said they will come back in about 20 minutes, if that's okay. So we can either defer that till later in the afternoon, but I'm not.
Are you able to defer it? Maybe. I think I will take about 15 minutes in DVA, so would 2:45 my time be possible for you?
I'm sure we'll be able to do that. 2:45 our time.
Yeah. Your time. Sorry, 2:45 your time.
Okay, thank you. Yes,
sorry,
3 hours behind over there. All right, so we'll plan for that. And so in the meantime, then we'll go to Senator Grogan to follow up on her earlier questions, and then if necessary, we can move on to other policy programs in the meantime. Senator Grogan.
Thank you. So I'm wondering if you were able to get the answers to the MRI question.
We are, yes. Ms Shakespeare will come and answer that.
Penny Shakespeare, Deputy Secretary, Health and Resourcing. So I believe your question was about the average cost billed to Medicare on a licensed Medicare eligible machine in modified Monash 1 locations.
Yes.
In 2021, the average Medicare expenditure was $1.58 million per Medicare eligible, fully Medicare eligible MRI machine.
For the MM1?
That's right.
Okay. Great. I think that's it on that one. I will just... Okay. We just, because as we're sort of unpacking the budget, just various questions are coming up. So I'm just waiting to see if somebody's got any further follow-up from that or if that's all we need. Thank you very much. Really appreciate you taking that on over lunch. Will I just plough ahead then?
Yeah,
is that okay?
Going, and when Senator Steele-John rejoins us, we'll go back to him.
Cool. So can we just talk about booster shots for a moment? Yep. So when did the booster rollout third doses start? November?
Yes, it did start in November. Is General Fruin still online?
Should be. Jojo, you there? Okay, I'll kick off.
Yes, he is.
Yep.
He's there.
Okay.
But Tina, you go.
Tina Blewett, Deputy Coordinator General, National Vaccine Task Force, the 8th of November.
8th of November, okay. And the percentage of Australians who've now received their booster, General Fruin, I know you went through some of these figures earlier, but can I just confirm what the percentage of eligible Australians are that have received their booster?
So,
yep.
Go, General. Sorry.
All right, yep. So the percentage of eligible Australians is 68%. That's 12.9 million Australians.
Sorry, I missed that. What percentage?
It's 68%.
68%.
Well,
thank
you. Yeah, 12.9 million Australians.
Lovely. And where do we rank in the OECD in terms of the doses administered?
Yeah, this was covered this morning too, but we're currently, in terms of boosters?
In terms of 2 doses administered.
So in terms of 2 doses administered, we are now 5th in the OECD.
Sorry, I didn't catch that.
What number was it?
In terms of the first 2 doses, we're now 5th in the OECD.
Fifth. Thank you. And in terms of boosters, where do we rank?
I don't have that at hand unless one of the team there has it at hand, Senator.
Senator, we'll have to take that on notice. Thanks.
Okay, if there was a possibility of getting back to us today, that would be lovely. Thank you. Minister Hunt announced a plan for a booster campaign in December. That's right?
No, the booster program, as I say, was started being rolled out on the 8th. Are you
No,
talking about the winter? No.
The campaign to encourage people for the
Oh,
boosters.
comms.
Yeah.
Communication side of things.
We
Is
can
Rachel
get to
Bell-
Ms Balmano can talk about the campaigns.
Yes, I'm here. So the advertising for boosters actually started in January. It was announced that we would be doing that, but the advertising itself started in January.
In January, okay. And can you advise us what the shape of that campaign was in terms of marketing, comms, budgets, etc.?
Yes, so the campaign's ongoing. That hasn't finished. The most recent change in the creative approach was over the most recent weekend.
As in last weekend?
So the advertising actually did start in the last weekend, yes. So the advertising did start initially in December. I suppose the campaign as a whole started initially in December. There were, as you may recall, some changes to the advice around the interval for boosters from ATAGI in December. So there were some changes, therefore. The initial phase was to get that clarity of the messaging of who was eligible and when they were eligible. The most recent iteration of the advertising, which is currently in market, is more around tapping into those factors that will motivate people to get boosters who haven't yet come forward. So it's really about tapping into those experiences in life that we have not been able to have in the same way, and that boosters obviously help us be protected against severe illness and help us return to those activities.
Okay,
so that has been part of an ongoing investment in the COVID and vaccine advertising campaign, which has been commenced back in 2020. So it has, that's sort of the latest stage in that campaign.
Okay, but the campaign that was announced in December, you're saying started rolling out in January. Was there a creative agency or any, what was comprised of that? Was it just departmental or was there?
I know that there is, there's television, there's radio, there's digital channels, there's social media components. So there's paid
so I guess
advertising.
what I'm asking is, can you just step me through the stages of that from January onwards?
Sure. So I'll start with the fact that the campaign has two main components. One of those is the advertising and the other is the public relations activities that go with it. So the advertising has had several iterations, as I said, and it's the most recent. Boosters is the most recent component. We had advertising in relation to the earlier stages of the vaccination program as well. And the booster component is not the only part of the campaign in market at the moment. There's also still advertising around 5 to 11-year-olds, also still in market.
Okay, and so the 5 to 11-year-olds, did that start in January?
In January. Yeah, that started in January. So the boosters started a little bit earlier with the broad messaging, but I've checked the advertising start date. I'll confirm that and come back to you. For boosters, the messaging started in December with the eligibility, but was really about pinpointing who was eligible, given that was shifting at that time. So the current stage, I have got the date here. So the very first advertising for boosters was 17th of December. My apologies.
Okay, you've gone mute.
You're still muted, I'm sorry.
You might have to...
Me now.
They can hear you just.
Yes. Yes, okay. Sorry, my microphone just died for some reason. So the current stage, the boosters advertising first started on the 17th of December. At that stage, it had the message that it was people who had been 5 months since their second dose who were eligible. That advice changed from ATAGI, and so the advertising pivoted on the 30th of December and removed that time frame around the 5 months. And then it shifted again on the 13th of February to pick up that 16 and 17-year-olds became eligible for boosters. They had not previously been approved by ATAGI for boosters. And then the most recent version of the campaign, as I said, commenced in market on the 27th of March.
Oh,
the
so
5 to 11-year-olds yep.
So what component started on the 27th of March?
In March, we pivoted the creative approach across television, across radio, out of home, digital and social channels.
And that was about getting a booster shot?
So all of this has been about getting a booster shot. The most recent version, yes, is also about that, and all of it has been across those channels, as well as both called and Indigenous-specific advertising as well for the earlier stages. That's still under development for the current advertising, which is only just launched.
Okay. And so in terms of the spend across this, what's the spend for the campaign kicking off on the 27th of March?
We don't sort of break it down separately like that because it's been an ongoing spend over a number of years. So overall, the spend in the current financial year so far, just sort of checking. Yeah, the spend in the current financial year so far, that's the increase in spending, sorry. I'd have to double check that. So the most recent budget announcement is for the rest of the financial year, includes 20 million to take us through from April to June. I'll have to just double check what was the spend for the booster period up to the end of March.
Okay, so 20 million spend in April and June.
April, May, June is the current predicted spend for, that's the budget that's just been announced for COVID and vaccine messaging for the rest of this financial year.
And has this been an ongoing contract with a particular agency, like with a creative?
We've had different agencies involved in the creative. So I'll just double check which agencies for which bits. I do have that. The two main we've been working with is BMF. We've been working with in terms of the booster advertising. Just grab up the other agency's name. So the team's just letting me know we'll get to the information about the spend to date from UM. So that's coming through shortly. I'll have that for you in a little while.
Cool.
But we have had different agencies. So we've worked with Carbon, we've worked with and BMF have been the two main creative agencies.
Okay. And so the campaign that started on the 27th of March, what was the difference there in terms of getting the booster out that wasn't available to be campaigned on prior to that? So you've had a campaign running really consistently, you've said, since, last year.
Yeah, so the first stage of the campaign was really informing people that boosters were now available, who was eligible from a timing point of view, and how to come forward and do that. As we've moved along, obviously, the group of people who we're trying to encourage to come forward for boosters has reduced. Most of the, as General mentioned, 2/3 of the population is now being boosted. So now it's really about tapping into, and we did research, obviously, in the campaign development, to tap into what are the things that are going to motivate those who haven't yet come forward. So we've shifted from more of an informational approach to a more motivational approach.
Okay, and so that's the shift from the 27th of March is the motivation piece.
Yes.
Okay.
Yes. So at the same time, we've got the public relations arm. It has shifted over that time as well from being broadly about supporting people around the country and making them aware of how to book a vaccination in particular, and also boosters, and making sure they understand. Quite a lot of partnerships with sporting bodies, community groups, etc. That's becoming increasingly focused on areas with low vaccine uptake and looking at what the things are we can do in those communities with local stakeholders to promote vaccine uptake there. So that is becoming more and more targeted.
Okay. Great. And so...
So I just need to correct what I said before. It's actually BMF did the children's advertising and Carbon did the most recent boosters advertising.
Okay.
Probably just one more question. We've just gone past 15 minutes.
Okay. Then in which case I'm going to go back to the issue of the MRIs. Thank you very much. If I could just quickly go back to that. So, thank you, and sorry. So, 1.58 million per eligible machine. Yep.
That's correct.
Fully eligible machine.
Sorry, I think I said fully eligible machine. That's across all of the machines, including fully and partially eligible.
Okay, so that's your average?
Yes.
Yeah, okay. So going forward, what's the budget measure, what's the budget increase for the measure that you've brought in?
So across forward estimates, the deregulation of, and so no longer requiring licences in MM2 to 7 is 66 million.
66 million over
4 years.
4 years.
Commencing partway through next year. I think it's going to commence from 1st of November 2022.
Okay. So, just to confirm, the 1.58 is in an MM1 area. So all machines in MM1 areas.
Average Medicare billing in 2021. The financial year 2020, 2021.
20. And so, and that's the same price that will continue on over your 4-year estimate, or is there a difference?
So if we were to look at the forward estimates for MRI in MM1, and I'm sorry I don't have that data with me because it wasn't the express question, there'd be, we'd have to look at growth that would put into the forward estimates there, because there'd be population growth. Medicare is a demand-driven program.
Cool. And are you anticipating a tick-up? Like an increase?
So as a result of the budget measure, yes.
Yeah.
And that's been part of the costing assumptions used to reach the budget figure of 66 million.
66 million. Yeah. Okay. Thank you.
Thank you, Senator Grogan. We'll go to Senator Hughes.
If I can obviously move away from COVID, could we get a bit more of a rundown with regards to primary care and what this budget is looking at in that area, but particularly in rural and regional areas?
We'll get Ms. New and Mr. Cottrell's online too, I think.
And Ms. Shakespeare might stay for
Yeah.
Thanks for the question, Senator. So in this budget, the primary care measures total $632.8 million on top of a spend over the last 2 years of approximately $1.7 billion. The biggest part of that was obviously the introduction of telehealth and the permanent telehealth measures, which just since COVID have been worth over $512 million, I think. That's additional. Additional, yep. Mm-hmm. The measures in this budget range from a range of measures that go towards allied health, that go towards primary care through GPs, that go towards rural health, that go towards outreach teams from hospitals with allied health specialists as a combined measure between the Commonwealth and state into aged care. It goes to the 10-year plan, which was launched on budget night as well, the 10-year reform primary care plan, that has a range of measures that really lay the bedrock for a 10-year reform process over the coming years. In terms of the rural measures specifically, I might turn to Ms Shakespeare.
So under the Stronger Rural Health Strategy, there have been an additional range of measures overall at a value of nearly $300 million announced in the budget. I'll just run through those quickly.
Yeah, that would be great.
So additional university departments of rural health under the Rural Health Multidisciplinary Training Program. There'll be 2 of those in 2 areas that were sort of missing University Department of Rural Health in our national footprint in Western Australia. So that's $36.2 million. An additional rural clinical school at Charles Sturt University under that same program, $14.8 million. $2.1 million for ongoing support for the National Rural Health Students Network. So these are all measures to increase support, encourage health practitioners training in rural areas. And, you know, we've got a lot of good evidence that those investments where we've had positive experiences for people early on in their training, more likely to stay and work in rural locations once they've graduated. And $99.3 million for additional medical school places in rural areas. So that's including an additional 80 Commonwealth supported places that will be tied to rural campuses. So the idea there is to have more of the end-to-end training available for people to do their full medical training in a rural area. There's $1.2 million for mapping collaborative maternity services, looking at what models we've got where there are gaps, particularly in primary care, midwife, GP obstetrician-led models, and also supporting the appointment of a senior midwife in the department to support the chief nurse and the Rural Health Commissioner. And then there's a series of investments in outreach programs. So $33.3 million for the Royal Flying Doctor Service, which is increasing their capacity to deliver primary care services, dental services through outreach, but also supporting replacement of aircraft so over the next 10 years. Care flight funding, $18 million, which will buy a new helicopter and fixed-wing aircraft to provide support for aeromedical transfers in the Northern Territory. Additional funding for a group called Little Wings for hospital flights, additional aircraft again, which will increase their capacity to move sick children across rural New South Wales, Queensland and the ACT. $17.4 million for Heart of Australia for 5 mobile clinics which travel around Queensland providing specialist services. The MRI deregulation measure, which I mentioned previously, so that's providing additional access to Medicare-funded MRI services in MM2 to 7, so large regional centres out to very remote locations. And $4.2 million for an investment in mental health services, so providing 19(2) exemptions, so that people who work in rural, remote areas, regional areas for headspace, can bill Medicare as well as be paid a salary.
And I should also mention, Senator, there's been a significant investment there too for women's health and particularly in primary care. So the announcement of $16.4 million for GP endometriosis and pelvic pain clinics, along with an endometriosis plan item, management plan item under the MBS.
Yeah, that was my next question, was actually going to be about the endometriosis plan. Can you sort of maybe outline that a little bit more?
Sure. In terms of the endometriosis plan, it's a significant change, $58.1 million of government investment specifically in endometriosis and pelvic pain management. I mentioned the GP pelvic pain clinics and actually working through with the sector around a significant change in the way that we look at earlier diagnosis and treatment of endometriosis in particular. So the inclusion of MRIs for early diagnosis for endometriosis, an endometriosis management plan, and really lifting the primary care response and early diagnosis and clear pathways for women to seek treatment to what is often an incredibly debilitating condition.
Yeah. And was there something around cervical screening as well, or cervical screening for particularly in Indigenous communities? For cervical cancer?
There is, Senator. So during the pandemic over the last 2 years, one of the things that we've been really focused on is increased cancer screening, and particularly in areas where people may not have been screening as regularly as they would have, given various lockdowns and just the general anxiety of perhaps going to see those screenings.
Yeah.
In terms of cervical cancer screening, there's been significant investment in actually making sure that people are going back to screening programs as a result of COVID. So investment in increasing breast screening, increasing bowel screening rates, but a specific measure around increasing cervical screening rates, and particularly in Aboriginal and Torres Strait Islander women. And you will be aware that there's a new self-collection process for cervical cancer screening as well being introduced that'll take effect from the 1st of July this year, which will allow women who may not have regular access to a GP or health services be able to organise cancer cervical screening for cancer.
Is that like a home test or something that you deliver?
It allows you to self-collect and actually send it into pathology. It'll make a huge
I'm pretty sure every
difference.
woman sitting around this table is thinking, I'm not sure how you do that yourself, but anyway. and you know what, Dr. Murphy, I'm not going to ask you to describe it for us.
There is an instruction manual, and it will make a huge difference for women, particularly in remote and regional and rural areas, but also certainly for women who may have been experiencing intimate partner violence and actually have anxiety in going to a GP and having that test done.
Yeah, okay. Thank you for that. I just wanted to get an update, if I could, and sort of on progress with regards to the stillbirth national plan. I know there's been some work done around miscarriage and recognition there, but there was the stillbirth national plan.
Yeah, we've done a lot of work around the stillbirth action plan, and in particular response to recommendations that had come out of parliamentary inquiries. This budget includes $23 million over the next 4 years for women and their partners and their families who unfortunately experience the tragedy of a stillborn baby. In response to both issues that have come up in parliamentary inquiries, but also in response to talking with the sector, that includes $5.1 million in grants to support women, their partners and their families get specialised support programs if they experience stillbirth or miscarriage. $4.2 million over the next 4 years for hospital to home program, which will provide women and their families who experience stillbirth with intensive individualised support that commences in the hospital but actually sees them through into the community again. $13.7 million to increase the number of stillbirth autopsies and investigations, to provide information on the causes and factors that will help reduce stillbirths in the future, including addressing the workforce shortages. As we know, perinatal forensic pathologists are actually in high demand, generally based in the city. So the package also includes transport costs for parents in regional and rural areas to be able to travel to the city to access those items as well.
Okay, thank you. Ms Shakespeare, I realise my time's probably coming to a close now, but I just wanted to clarify, being a graduate of CSU in my undergraduate, where are those, there's a number of CSU, Charles Sturt University campuses, which ones are going to have the additional rural medical programs?
We're just checking that for you, Senator.
Okay.
I don't know if Mr Rocks is online who could answer that.
So while we're waiting for that, I just wanted to clarify another thing with you. With regards to the Royal Flying Doctor Service, that $33 million, that's not the only funding they get though, is it? Is that additional funding from what they get annually? So what do they get annually? Normally? Or
It's in the order of 100 million in total with the additional funding.
Yeah.
So we've been funding RFDS for a very long time. So there's ongoing funding to RFDS. That's an additional investment, and that's just over the forward estimates. It's I think nearly 90 million over the 10-year agreement, but it's on top of existing funding, which over 10 years adds up to 990 million. So it's almost 100 million a year.
Yeah.
Mr. Rocks is online, I think.
We've got Martin Rocks online who can answer the question about where CSU's rural clinical school will be based.
Sorry, thanks, Senator. Martin Rocks, Assistant Secretary, Health Training Branch. Senator, just in answer to the specifics around CSU, we have 8 sites as part of the hub and spoke model. They are Mudgee, Parkes, Kempsey, Swan Hill, Moorowa, Griffith, Maxwell, Cootamundra.
Okay, so for those of us whose geographies might be a bit pressed, what states are they all in? So I got the New South Wales, most of them, but where are the other ones?
And there's some border work around the New South Wales-Victorian border as well, just around Corowa, which is obviously on the New South Wales side of the Murray there, but there's some border work with into Victoria as well there.
So what was the breakdown in New South Wales versus Victoria? How many?
So we've got Mudgee, so all the sites, the mini sites, for want of a better term, as New South Wales, but just to acknowledge that the coral work, there will be some in-reach across the border there into Victoria.
Into Victoria as well, okay.
Yeah, so I'll just,
All right, thank you, Chair.
Thank you. Who are we going to next? Senator Urquhart.
Thank you very much. Can you tell me, Dr Murphy, who from the department is responsible for the various FOI decisions that are made?
FOIs, we have an FOI unit. Our Chief Counsel is responsible for the policy area and the Chief Operating Officer, but the decision makers are delegated to various senior executive service officials across the country. So it's a delegated model. The decision makers are delegated, but we do have a team that supports them.
And how many is in that team?
Mr. Wan might come to the table and look at that. He's in the next room.
That team, does that comprise of the same people that's delegated across the organisation?
The decision makers are officials who work across the policy areas. So, for example, in Professor Kelly's area in health protection, there will be senior executive people who might make a FOI decision in relation to health protection areas.
Yep, so it depends on the areas.
Depends on the area. There are delegated decision makers for every policy area.
Okay.
On the basis that it's important that the delegated decision makers are across the content and the policy of that area.
Okay. So I refer to the FOI document 3538 that was released to the ABC. The document, which is an email chain between Minister Hunt, yourself, Dr Kelly and redacted others, relates to vaccine procurement. Is that correct?
It relates to vaccine discussions around those times about vaccine procurements and related matters. Yeah.
So because the exemptions are conditional, section 47C, 47F and 47G, the decision maker must decide where the public interest lays. Material relating to the vaccine rollout and the pandemic is naturally of a high subject of public interest. What was the justification to withhold that material?
Mr. Wan.
Senator, sorry, I don't have my name tag with me, but it's Charles Wan, Chief Operating Officer. I was just out of the room. Can you repeat the question, please?
Okay, so I'm talking about the FOI document 3538.
Yep.
And Dr Murphy has outlined that it's in relation to vaccine procurement and vaccine matters. Because my question is, because the exemptions are conditional on section 47C, 47F and 47G, the decision maker must decide where the public interest lies. and material relating to the vaccine rollout and the pandemic is, as we know, naturally of high public interest. So can you tell me what was the justification to withhold that material?
Senator, so in terms of FOI, thank you very much. In terms of FOI, we've got a devolved framework where we have decision makers.
Yep. I've been through that with Dr. Murphy, and I did ask the question about how many there were.
Yep.
But it varies, as I understand, across the areas.
So the difficulty is that me imposing my views on the reasons or the rationale around it is really a matter for that decision maker, looking at the facts before them and the request and the circumstances around it.
Okay, so maybe I'll go back to Dr. Murphy then. What was the justification to withhold the material in relation to that FOI?
Well, Senator, I was not the decision maker. The decision maker...
But you're the secretary of the department.
I'm the secretary, but we have a devolved FOI process. The decision maker makes their decision under the guidance material provided for decision makers, and there is a process where if decisions can be challenged or reviewed, and it's not really appropriate for me to second guess the decisions
so
of
then
the
in relation to FOI document 3538, who was the decision maker in that instance?
We'd have to take that on notice, Senator.
You know what the provisions of that documentation were? It was about vaccine procurement. You must be able to tell me who was the decision maker.
We'd have to take that on notice. We have over 1,000 FOI decisions being made year to date, so it's a huge number, and all those decisions are spread throughout the decision makers in the department.
Okay, well, so, I'm comfortable for you to take it away, but I would like you to come back before the end of the day.
Absolutely.
And tell me who the decision maker was in relation to that particular FOI.
Okay, we would have to seek guidance in terms of releasing that information. It should be possible, but we'll come back with what we can.
Thank you. So we only found out about the government's ignoring Pfizer's request for a meeting in June 2020 thanks to a previous FOI release. Once again, why would these emails, which suggest discussion about vaccination procurement, not be in the public interest?
It's the same answer, Senator. It's decisions about that FOI were made by a delegated decision maker.
I'm not talking about a specific FOI here. I'm talking about, the Labor found out about the government ignoring Pfizer's request for a meeting in June 2020, and we only found out about that because of a previous FOI release. So again, why would emails pertaining to vaccine rollouts, why are they not, and vaccine procurement, why would they not be in the public interest? Why would that decision be made that the public should not know about a vaccine rollout or a vaccine procurement?
So with each application, with each request, the decision maker looks at the request, they look at the circumstance of the request, they have to turn their mind to public interest issues. That's part of statute, that's a requirement of them to do that. If they've come to a view to release or partially release or not release, that's a decision that they make. It is completely then in the applicant's power to go to an internal review of that, then go to the Information Commissioner and go to the AAT if they see fit. So all those options are open.
Yeah, no, I understand about those options. I guess the question I'm asking is, why does the department feel that the question around vaccine procurement is not in the public interest when the public need to know at the height of a pandemic how the government is dealing with the procurement of vaccinations? Why does the government and the department feel that it is not in the public interest to release that information?
Well, Senator, just in a completely looking at some of the claims that they, or some of the public interest criteria, Some of them might go to commercial in confidence. They might go to deliberative. For sure, with the commercial in confidence, if we start to break those relationships, particularly looking back at the period of when we were trying to procure these vaccines, it was a highly competitive market. It was a constrained supply. Anything that might have gone to compromise that relationship would have compromised potential supply in the context of a pandemic. Now, I'm not saying that that's the reasoning that the delegated decision maker came to. I'm just playing out that could have been the context that a decision maker would have to take into account and balance that against the public interest involved in releasing those documents.
So in the case of Pfizer and this particular email, in relation to Pfizer and the email that I'm talking about, or the information I'm talking about, the government ignored Pfizer's request for a meeting in June 2020.
The government did not ignore Pfizer. The department had multiple meetings with Pfizer from early in that year, and we have detailed on a number of occasions the meeting that senior officials had with Pfizer, members of Minister Hunt's office. The vaccine procurement team met with Pfizer very early on in their vaccine development. So I think it's quite incorrect to say the department ignored Pfizer.
So, Dr. Murphy, do you recall the contents of the email?
No, I don't. The emails you're talking about, I'm not even sure what they had anything to do with Pfizer, Senator. So I have not reviewed in any detail those emails. As Charles has said, the decision maker has made their decision on competing public interest, and we have a process where that decision can be reviewed if the applicant wishes to.
Professor Kelly, do you recall the contents of the email?
I'm not aware of the particular FOI for the same reason as the Secretary has mentioned, Senator.
So, Minister, will the government release the emails now?
Well, Senator, I think you've just listened to the responses that you...
Well, are they not in the public interest?
Well, Senator, in the absence, obviously, as the representing minister, I'm having, no more information before me than what we've been discussing here. But I think you've had a very comprehensive explanation as to the process and the basis of FOI. And I'm sure, Senator Urquhart, you've been in this place a very long time, you understand the process of FOI, and you've had an explanation. I mean, and I think, that comprehensive explanation,
I think the explanation to me spells out very clearly that the government didn't want the public to know what was going on.
Well, I mean, you can put on the public record anything that you want in terms of your opinion. What we seek to do as the government is to put the facts on the record, Senator Urquhart. We're not here to make spurious speculation.
And I would say that the department does regard vaccine procurement clearly in the public interest, but there are other competing public interests that the decision makers have to consider.
Senator Urquhart, time's run out, and I've got Senator Steele-John back on, who is coming back in to do his follow-up, because then we'll be able to release some officials. So, Senator Steele-John, you've got the call.
No, we haven't finished, Chair.
Thanks, Chair. All right, so do we have some answers to those questions?
Thank you, Senator, we do, and apologies for the delay. So, in terms of both the reports to Public Hearings 5 and Public Hearing 12 of the Disability Royal Commission. So Public Hearing 5 had 22 recommendations. Of those 22 recommendations, 10 are the responsibility of the Department of Health in full, and 8 in part. Public hearing number 12, there were 7 recommendations. Of those, 1 sits with the Department of Health in full and 5 in part. The government released a response to those initially, and I can go through each of the recommendations, if you like, in terms of the ones that are the responsibility of the Department of Health. But I can assure you that a number of them are underway. So, for example, the involvement of people with a disability and lived experience in advisory committees. As you know, Department of Health established an advisory committee, particularly around the pandemic response as early as April. And so we've been involving people throughout that. So I could go through each of the recommendations separately if you like.
Just in the interest of time, I think could we just go in terms of report 5 of the 10 recommendations that you have that health has full responsibility for? How many of those are any of them considered to be completed, like implemented and done?
I think the answer to that, Senator, and I'll go through each of them, but either they are in the process of being implemented. So, as I said, recommendation 2, ensuring that agencies responsible for planning and implementing responses to the pandemic and any future emergencies establish formal mechanisms to consult with people involving people with a disability and disability representative organisations. That one is obviously in train currently with the advisory group and obviously involves future actions and future commitments. I should say that of all of the recommendations that relate to health, the government either fully supported or supported in principle all of them, except for one that was noted because it's predominantly the responsibility of states and territories.
Yep, that's I understand that. So we've got recommendation 2 is in train. Of the other, so we've got 10 other recommendations that sit with you from hearing 5. So what are their status?
So recommendation 4, which is identification of gaps in the current consultation processes. We continuously, that's a joint one with Health and Social Services. We continuously monitor that, obviously, through the advisory committee. Recommendation 5, which is a health recommendation that the government should ensure that the advisory committee on the emergency response to COVID for people with disability continues to function for the duration of the pandemic and the recovery period, and that it receives sufficient funding to support.
Yep.
Clearly that is ongoing, Senator, in terms of the pandemic is still underway. Recommendation 6, that the advisory committee or a similar body including significant representation is in place after the pandemic has come to an end and recovery is complete. That one, again, supported by the government, but the pandemic is underway. Recommendation 7, the terms and reference for the Aboriginal and Torres Strait Islander Advisory Group should be amended to state expressly that this work is to include providing advice with respect to First Nations people with a disability. And once again, the advisory group for that is underway. It's a specific role.
If I could assist, Simon Cottrell,
Thank you, Simon.
Secretary, Primary Care Division. That recommendation 7, that's complete. Those terms of reference have been amended.
Amended. Excellent. Thank you.
Simon, do you want to continue on with the relevant recommendations?
Sure.
Then? Thank you.
Sure. Recommendation 8, which is the membership of the Aboriginal and Torres Strait Islander Advisory Group on COVID-19 should be extended to include at least one member who represents the interests of First Nations people with disability. That's complete as well. There's a member there.
Yep.
Recommendation 9. This was about working with the NDIS Quality and Safeguards Commission and NDIA to prepare comprehensive guidelines specifically addressing the prevention, control and public health management of COVID-19 outbreaks in disability accommodation settings, taking into account differences. That is complete. Those guidelines have been published.
Great.
Recommendation 10, Department of Health should ensure that a team is established to specifically consider disability issues for future pandemics. So that's in train. We have commenced an evaluation process of the current management and operational plan, and that will that evaluation will talk about how this should be resourced into the future.
Okay. And when will that be completed? When do you expect to complete that?
I think we're aiming to complete the evaluation by mid-year.
All right, and that will talk about how should it be resourced in the future, will be one of the key focuses. Because is it currently the case that it's still you, Mr. Cottrell, who is the only FTE allocated to this area, or are there others?
No, that's not true. So there is a section in my division that looks after the health disability interface, and that has reasonable staffing, and it's
how many people?
Oh, I'd have to take that on notice, but
okay.
But I think it's 8 to 10, that sort of order of things, but it has a number of other responsibilities. And it's led by the Chief Allied Health Officer.
Yeah.
And then the Office of Health Protection also considers disability issues. The Vaccines Task Force has a whole disability element to it. Now there are other parts of the department that have disability responsibilities. So
yeah, I understand. And I'm sorry I interrupted you. Was there more was there a couple more that you wanted
sure.
to say?
I'm scrolling through them. There's one, recommendation 17 is about priority access to PPE and testing, and the NDIA has taken the lead in ensuring access to PPE and financing that, and the access to testing has been taken forward through the state governments who've made special arrangements for people with disability to be tested.
Okay.
Going through 19, the online training on infection prevention and control for disability support workers, that training is still continuing, and we're looking to evaluate that in the future. So that's in train. The rationing of health services, this is recommendation 20, that we should publish guidelines to make clear that access to health services during the pandemic will never be rationed. That was supported in principle. And so the Disability Advisory Committee has considered that issue and took a paper to the Australian Health Protection Principle Committee, which was published as part of the operational and management plan for COVID from the Human Rights Commission about appropriate access to health services for people with disability. So we feel we've addressed that. Sorry, there's a couple more.
That's okay.
So we needed to consult people with disability and advisory committee in that work, and we've done so. That was recommendation 21. Recommendation 22. We should recommend to relevant state and territory departments and agencies that they publish similar guidelines, and so the state and territory governments come to every meeting of the Disability Advisory Committee and also of the Disability and Health Consultation Committee, which is a larger group which includes all the disability representative organisations that we go to when we really need to consult everyone about what's happening. And they have been party to all of these conversations. So those ones are in train. So that's the end of the Hearing 5 report.
Yep. And you've only got you only had one come out of Hearing 12, if I understand it, that is solely yours?
That one was solely for health. And that was about continuing to prioritise access to vaccination for people with disability in residential settings through a strategy to be developed. And it's probably for the Vaccines Task Force to talk to that one.
Absolutely. Thank you, Mr. Costello. That was detailed of you. I appreciate it. Minister, I'm conscious of time. It's Minister Ruston at the table, isn't it?
Hi, Jordan.
Yes. Hi, Minister. So the reason for my asking of those questions of the department today is that I note with concern the observation in the budget papers that health is preparing for a difficult winter, a COVID winter potentially. And it's very much, I think it would be fair to say that the expectation of the disability community, given that the government has acknowledged the potential for that to be a difficult period of time, for us to see not only the recommendations that were allocated to health specifically, but the entirety of the recommendations of the Royal Commission's 2 papers implemented, actioned before the beginning of what the government has identified as a difficult winter. And so what I've been able to do this afternoon is understand clearly how health is responding to those recommendations or has responded. We don't have time to go through DSS and all the other elements, but I just want to kind of place on the record that given the government has been given really clear and actionable recommendations, and we are a couple of months still from the beginning of that winter period, it's very much the disabled community's expectation that we don't go into that difficult winter and then find that some of this stuff isn't complete, if that makes sense.
Yeah, look, thank you. You know, obviously in listening to what you've just said, I mean, we will be working across agencies. This is not just a health issue. This is across many different departments to make sure that we're as prepared as we possibly can be to put in place, all of the supports and provisions that are clearly, we need to support the more vulnerable people in our community. And in the case of health, obviously, there are many people who live with disability that are highly vulnerable to conditions, not just COVID, but many winter conditions like the flu, as an example. And so we will continue to work across government and respond to make sure that things are in place and that we can give confidence to vulnerable Australians that we have we have made provision to ensure wherever possible the safety of them from these sorts of conditions, as I say, where possible.
Yeah, I understand that, Minister. I do note, however, that we've had 2 of these reports, and notwithstanding what Mr Cottrell has shared with us about the implementation of the recommendations, we're in a position where the Royal Commission has issued yet another statement of concern in relation to Omicron, and is currently taking community submissions in relation to the impact of Omicron. And so what I see is a pattern of feedback from the Royal Commission, action or however you'd like to frame it by the federal government. But the brass tacks reality for disabled people is that the net impact of COVID is still so severe and specific to the disability community that the National Royal Commission still has to keep issuing statements of concern in relation to the way that it is impacting disabled people. And every time that happens, more disabled people die, and the government can't tell us how many because you don't record that data, but that is not a conversation I want to keep having with you or any of your colleagues in relation to COVID-19, because it means that there's been pretty bad failings. So thank you, though, for your answers, Mr Cottrell, and their detailed nature. And I'll be asking you in the future about the resolution of the review in relation to resourcing. Okay. But that can wait until after the election.
Thank you.
Senator, if I could just give you some assurance, the Disability Advisory Committee has been meeting weekly, most weeks of this year, sometimes fortnightly, but weekly. We've had specific discussions about the coming winter period and what we need to do to get ready for it. New fact sheets have been issued for people with disability and disability support workers about infection prevention and control in those periods. But actually the best thing to do is to make sure everyone's vaccinated, and the Secretary might want to back me up there. But actually that's going to be the best protection.
I suspect the Secretary would back you up in that if they didn't.
Well, it is the single it's the single most important thing that we can do to protect people with underlying medical conditions, people with disability, people at risk of severe COVID, is to get as much vaccination, including full booster protection, as possible. That is the one thing that will do more than anything else that we can do.
And Senator, if I could just add, it's Paul Kelly, Chief Medical Officer here. So Following on from discussions I've had with you and with the Disability Commissioner and so forth, I undertook to make sure that I really stressed the issue of disability, and particularly people in disability care residents with my state and territory colleagues. I would point you to the AHPPC statement on winter preparedness that was published last night, which mentions disability, I think, on every page. And there is a specific note with 5 different actions related to residential aged and disability care facilities specifically. So we definitely have it in front of mind, and I thank you for alerting me to that as well.
Well, thank you for sharing that information. Between the flight back to WA and an earlier than expected start of defence estimates, I've missed that one, so I will go and have a look. Thank you very much.
Thanks very much. So I think, just before I move on, I think program 1.8 and 1.9 we have now completed. So if there are any officials that are only associated with those, they could be excused, but we do need to keep going with the others. Is that correct? We came back to them because Senator Steele-John, but we'd finished with the others earlier.
Yeah.
So we keep moving on now with other outcomes. In outcome 1, we have asked some questions already, so thank you for your flexibility. Sorry?
Have we done planning for additional doses?
No.
We did have some questions about the 4th doses, planning for that.
Oh, if we want to do those very quickly, but we did try to do that earlier.
And Japanese encephalitis, we had some on too. Is that in this outcome?
They were about to be released, so you
Okay.
need to do them straight away.
Really quickly. Okay. Can I also just ask Ms Shakespeare if I could get the number for a full licence, not the average, in the MM1? That would be really handy. Thank you. We'll just do them really quickly. When you go to the elephants. Have any additional winter boosters been administered yet?
Senator Tendrell, Deputy Coordinator General, sorry. The winter booster program officially starts on the 4th. When's that next?
4th of April, so next week.
4th?
Yeah.
Monday. That doesn't mean that some people may not have taken the opportunity, but it officially starts on the 4th. Yeah.
And in terms of aged care and disability care residents, how is that going to be administered?
Rolled out?
Yeah.
Very similar to how we've actually done the booster doses. So in the case of residential aged care facilities, we issued some guidance on to all facilities earlier on this week, asking to put an expression of interest in if they wanted a Commonwealth Vaccine Administration partner provider, which is what we used for all of the booster program. What we do recognise that's different this time around is many of the RACFs, residential aged care facilities, will be making arrangements to have their flu vaccination. So we're very mindful of making it as convenient as possible for the resident. So yes, so they can co-administer. So part of our communications will be, and we've pushed out some communications to the sector, that where you are making arrangements to have your flu vaccination, which is normally with the primary care providers, so GPs and pharmacists, take the opportunity to also get your COVID vaccine at the same time. So it's the convenience for the resident, but by all means, if they do not align, because we do not want the residents to delay getting their flu, we will provide the InReach service separately for COVID vaccines as well.
Okay, so do you have a strategy for those that won't take it, that aren't going to take either of those
So that's
options?
why we've got the expression of interest out. We've already had some of the facilities indicate an expression of interest already. We'll work with them, but we are very keen to support the convenience of the actual resident getting it done at the same time, where they're probably using the GP. In the case of the disability accommodation settings, a very similar approach. Although we suspect that we might have more of the disability accommodation settings taking up the Commonwealth InReach offer. Although our stats do, off the top of my head, I think do show that even with the booster program, about 45% of those disability accommodation settings used a primary care type arrangement. So similarly, we will be using the same sort of message, that if you are getting your flu vaccination at a primary care, please ask them to get the COVID vaccine at the same time, but we'll be definitely giving them an InReach offer.
So you would anticipate, well, I would anticipate that a lot of those facilities, aged care, disability, etc., would have a plan that they roll out each year in terms of the flu vax. Do you see that they will just add the COVID to it?
So in the case of the residential aged care facilities, they have a pretty systematic approach in terms of doing flus. We have, and the Department of Health has a very strong relationship, so I would describe it with the residential aged care facilities have regular meetings with all of the key stakeholders, and they have regular communications actually going out, so they'll be using those channels to remind people, as I said, when you're getting your flu, take the opportunity for COVID vaccine. Now, which is why I said some of the residents may not be eligible for the COVID vaccine at the time, so we just want to make sure that they don't actually slow up getting their flu vaccination at the time. But RACFs do have a fairly solid approach to getting flu, so it'll just be our messaging encouraging the co-administration opportunity at the time.
And will there be a sort of surge workforce requirement there in terms of additional staffing to cover
in the
off-
facilities themselves?
Yeah. Or in your or where you're going to inReach?
So we have a capacity. So we have. So the inReach actually exists across general practices, pharmacists as well. They already do that. There are funding mechanisms to do that. But in addition to that, we've set up a whole of government panel arrangement. It's called the Vaccine Administration Partners Panel Provider. We've got 82 providers registered across the nation who are able to provide that inReach services. I mean, I've got some detail I can share with you later, but I think from those 82, 78 of them I think could do nationally, and then there's some that will actually indicate they only want to work in particular jurisdictions, and some of them are specialised in working with particular cohorts as well. We draw on that. That has been our main sort of source in terms of offering inReach. So we go out to every single residential aged care facility, as we did with the booster program, and we mapped what we call VAP, so the Vaccine Administration Providers, to every single RACF, and they will all provide an inReach service. So we'll take a similar approach.
All right. And how are the residents being informed?
So once again, there's significant communication that goes out. So there's normally communication that goes out to the residential aged care facilities themselves, and then there begins separate communication that actually goes to the residents, gets passed on. In the past, we've done other mechanisms where Professor Paul Kelly has actually written out to people as well. We've used Services Australia to issue communications, letters to people as well when they're due for their dose, depending on where we're at, primary dose or booster or that. So in the RACFs, it's very well targeted, lots of communications, and I viewers, I think there's plenty of opportunity for people to be aware of when they're due.
And what about eligible people outside of those residential facilities? How will that communication occur?
So the 65 plus, so who are not living, and 50 plus in terms of Indigenous, so Aboriginal and Torres Strait Islander people. So we're looking at a similar thing, getting Services Australia to actually push out communications to those particular groups as well. There are mechanisms, and happy for Dr. Tucker to talk, who co-chairs in terms of the NACHOs. So we have an advisory group for Indigenous people. They'll push out comms through those mechanisms as well. So we'll pretty much tap into all of our regular channels in letting people know that they're to come forward for the winter dose. Recognising the lion's share of those, as say, we're going to pick up in the residential aged care facility and the disability accommodation settings, and the ARCHOs have a strong relationships in terms of going into communities, Indigenous communities for the 55 pluses as well.
And for all of the comms, are you going to be targeting COVID and flu at the same time?
Yes, so where we do an inReach type program,
even just in terms of advising the over 65s,
to take up their opportunity. So I think Ms. Balmano mentioned before about the communications. More broadly, there are formal communication campaigns that will focus on booster, and then we'll be looking at a winter dose type arrangement as well. But the general message is, Senator, that whether you haven't even completed your second dose or your booster or your winter, whatever the arrangements are, we will actually be spruiking, for want of a description, around taking that opportunity to go and get your vaccination, and we make those services available irrespective of what dose you're up to in the stages of that.
Okay.
That was one of the key reasons why Tiger recommended that the rollout of the winter dose was in line with the commencement of flu vaccine, so that GP webinars, communication with the Chief Medical Officer were all consistent. I think it's also important to note that the target population for the winter dose, which is primarily older people, is a group that had an incredible uptake of boosters and flu. So for whom the communication in terms of additional doses was really effective. 60 years people 60 years and over have a booster uptake of higher than 85%. So it's that communication is working.
Cool. And do you have an expected completion date for this?
I don't know that off the top of my head, Senator. What we would normally do is do the analysis in the RACFs. We move pretty fast in terms of, which is why we're very keen to get the expression of interest out this week for the program to officially start next week. So we'll start that mapping. In terms of 65 plus, it'll be about the communications, but as Dr. Tucker has already said, our senior people are very keen, and it's always been great in terms of lining up to get their dose.
And it's important to stress a slight nuance between the booster advice and the winter dose advice. ATAGI stressed that the winter dose is from 4 months after the booster or 4 months after infection if the person who had the infection was already boosted, not at. So it's not a matter of if you're 4 months and 1 day, you're not protected anymore or overdue. They just wanted to make sure that there was an option for people to get it as winter comes in.
Right.
The eligibility in the early stages of the rollout in early April is actually relatively small. Out of the about 4.7 million people who are eligible for a winter dose, less than 200,000 will be eligible at the beginning, with the bulk becoming eligible in May and June. So it cannot all be completed in April because people wouldn't be eligible yet.
Fantastic. And will this data be added to the daily vaccination summaries?
We're looking at, in terms of, yes, adding that sort of array. We haven't got there. Often there's some sort of system things back end we've got to sort out, but yes, Senator.
Great. Thank you.
The time is just about up, and I
Just a few. 3.
Okay.
Thank you. So just in relation to Japanese encephalitis, the budget's allocated $28.2 million to purchase 130,000 vaccines. Is that correct?
Yes, that's right, Senator. I'm waiting for Sonia. Sonia Bennett is there actually now, so she's actually the Deputy Chief Medical Officer, so I might pass to her. She's online, apologies.
Oh, okay, thank you.
Dr. Bennett.
Good morning, Senator. Dr. Sonia Bennett, Deputy Chief Medical Officer.
Thank you. So I've just asked the question about the budget allocation, and I think Professor Kelly said that $28.2 million was available to purchase 130,000 vaccines. Can you tell me, are those vaccines available now?
Senator, not entirely.
You're breaking up.
We have approximately
Sorry, we lose.
16,000.
Sorry, we're losing most. Oh, you've gone completely now.
No, I'm here, Senator. Can you hear me now?
Yes, I can. Thank you.
I was just saying we have 16,000 vaccines in country, or we had 16,000 in country. We received an additional 45,000 just yesterday, in fact, and we're expecting the remainder by the end of April. The 16,000 that we had in country up until yesterday have also all been distributed to states and territories.
Right. Because the reason I'm asking about that particularly is we've been contacted by a farmer in Monaro who farms pigs. He was told by his chemist after ringing 9 times that the vaccine wasn't going to be available till October. So you're saying that you've now got 16,000, there's 45 due soon, and the others will be here by the end of April?
Yeah, that's right, Senator. I'm not sure which chemist. There's 2 vaccines. We've had them in the private market before because traditionally they're a travel vaccine. But these 130,000 are for the response to the JV outbreak. So anyone who's been identified as a priority risk group should be able to access that through their public health unit, or at least public health will be able to tell them where they can source it.
Right, so what information is available to let people know that? Because obviously this farmer, who I suspect if he's farming pigs is in a risk area, what's the government done about advising people about where they could get the vaccines from?
So, Senator, the Commonwealth has procured and will provide the vaccine to states and territories free of charge. the states and territories will be responsible for implementation of that program. They're all doing it slightly differently as they do with vaccines. In some instances, they are providing vaccine directly to infected premises or piggeries where they're able to do that. In others, they're providing them to general practitioners in those areas identified as risk, and GPs have been educated as to who's eligible for the funded vaccine. So they will all do it differently, and it's probably best if anyone who contacts their public health unit in their state or territory would be able to get that information. I don't have exact details of what all states and territories are doing. From the Commonwealth point of view, there have been a number of social media campaigns that have run over March into targeted at those geographic at-risk areas, and there'll be more formal paid television and other advertising and PR commencing next week before the school holidays, which will really inform people about how to protect themselves against mosquitoes as well, but those people who are eligible for vaccines, who that might be, and then it will be advising them to contact their state and territory.
Okay, can you just, can you provide me with those identified areas, the areas that have been identified as risks?
I don't have a list at the moment, Senator, so there's a range of, again, the states and territories, there's a range of infected premises in 4 states, and so
is that list available?
The LGAs in question, as they revolve, that's probably a question for agriculture. I don't have it in front of me because they revolve around the piggeries that have been identified as infected premises mostly.
Okay,
but
you don't.
Could get that
I was just going to say, you don't have it in front of you. Are you able to provide it to the committee before the end of this session?
As I said, Senator, it's probably a question for Ag. We'll certainly get a response back to you before the end of this session.
That would be helpful. Thank you. Thanks very much.
So I think now that brings us to the end of 1.8
So,
and 1.9.
Senator, can I just, Chair, for Senator Cart, I've just been given a copy of the redacted released email. It says CSL will continue to work with University of Queensland. It has nothing, I can't imagine that email has anything to do with Pfizer. It's to do with the University of Queensland vaccine, which was a vaccine
Well,
that we
who would know when it's redacted and not provided, Dr Murphy?
You can't just make stuff up.
No, but I can't imagine that email has anything to do with Pfizer.
Okay, so you've finished now with 1.8 and 1.9 because we're going to release any officials associated with that, but continue on with outcome 1. And Senator McLaughlin has some questions.
Questions as South Australian regards access to primary health care in rural and regional areas. I'm interested in what initiatives we have going forward in relation to providing primary health care to those that reside in rural and regional areas, and in particular around any initiatives on telehealth.
Senator, so we primarily fund primary care services at a Commonwealth level through Medicare. So there will be increasing investment in Medicare over the forward estimates. Recent budget data has just been released outlining what they will be. I don't know that I've got the South Australian breakdown of that, but there's certainly a component for services in South Australia. Telehealth under Medicare is now permanent, ongoing. We've had more than 100 million telehealth services provided across Australia since the widespread COVID items were introduced in March 2020, with Medicare benefits of over $5 billion paid for those. So it's something that's being used on a much wider scale than previously. We had small amounts of telehealth services under Medicare prior to the pandemic, but it's given us the opportunity to roll that out on a significant scale, particularly in primary care, where we've got mostly non-referred services and patients able to see their doctors, which has benefits not just for people that might be in quarantine or sick and worried about spreading COVID or other illnesses, but it's also benefiting those communities who may not have had as easy access to a doctor. So we've got quite a few models that we are trialling at the moment, in particular communities at this stage in New South Wales about, using telehealth to provide additional extended services. So primary care providers travelling around communities, and we'll have some times where they're available to a sub-region face-to-face, and then, the next week they'll be able to see patients via telehealth as well, so they sort of rotate between face-to-face services and telehealth services. So we have also been talking with the South Australian Health Department about what models of care we can trial in South Australia, and looking at flexible employment models where we have doctors who may be employed by South Australian Health or one of the local health districts. They're also then able to provide Medicare services. So we've been having active discussions along those lines with people in South Australia.
So when am I going to see a realisation of those discussions in my own state?
So hopefully soon. It's been something we've been working on for a few months with I think it's the Riverland, Mallee area around Berry.
I mean, each state is different. Obviously, New South Wales,
Yes.
Victoria have a greater population in their regional and rural areas. So is it, if I understand what you've been saying, the model may vary from state to state. Is that my understanding correct?
Yes, so we've got the general service provision models that are available under Medicare to anybody, but we have to recognise that if you don't actually have a doctor in place, it's very hard to provide Medicare funded services. So most of the work we're doing is targeted at solutions that work for local communities and are developed in partnership with local communities and address particular local factors to try and help them recruit, retain services of a GP in the location, if at all possible, but looking at other models where we might be able to share GPs across regions. In South Australia, we've also been looking at the possibility of the remote vocational training scheme supporting an additional GP registrar around, I think, the Streaky Bay area, which is quite remote.
Yes.
And we're continuing to look for support under the RVTS.
Are there any innovations on the horizon outside the models that we should be keeping our eye on, either technologically or other arrangements that might be possible to be put into place?
We're always interested in trialling new and innovative models, and there is a funding pool available to invest in locally developed innovative models. So it won't all be the sort of same types of things we're trialling in New South Wales. There might be things that are going to work better for the South Australian rural communities. And obviously we need to work with South Australian Health about what's going to best fit with their rural hospital services in future too.
Could you take on notice that I'm interested in the data and the take-up of telehealth in rural and regional areas in South Australia? Because obviously when you travel around, it's a subject of much debate about access to health services, in addition, obviously, to education. So
Certainly.
I'm interested in the degree at which that the take-up has occurred, and from your perspective, the success in delivering a service, because telehealth has its limitations.
So we actually have officers from Outcome 2 who'll be here on Wednesday next week, and we can certainly have them prepared to
Yes.
provide that data to you.
And where does this exploration of models fit into the government's 10-year primary health plan? Is it?
Yes, so we've had, I think, 2 separate budget measures investing in flexible models under the Stronger Rural Health Strategy. I think it was either budget or MyEFO last year and the year before.
Chair, that's...
Sorry?
I'm happy.
If I could just assist with one more thing to respond to the Senator's question. It's Simon Cottrell, First Assistant Secretary, Primary Care Division. In South Australia, for the first time under the MBS Section 19.2 arrangements, in December, 3 sites were approved where rural hospitals, doctors working in rural hospitals can also charge the MBS. and those sites are in Ceduna, Lameroo and Wallaroo. So there's some progress there.
Has there been, that's just prompted another question. Has there been any other exploration of models in relation to our Indigenous communities, which are very remote in the north of the state, obviously, and to the west? Are we exploring any particular health models there?
Can I take that
Yes.
on notice from our... we have an Indigenous Health Division, and I need to just check with them.
Yeah, I
about
appreciate
any
the division. I'm just in the context of telehealth and other innovative models.
Sorry, Senator.
Yeah.
Tanya Rishnu, Primary and Community Care. You'll be aware, particularly with Aboriginal community controlled health services,
Yes.
they actually have quite a different model of funding and approach. They can access MBS items, but they have a more flexible block funding model that we fund them for the provision of primary care. We work with them regularly. We'll take on notice specifically South
Yes.
Australia,
Thank you.
but they are already quite an innovative model of healthcare.
Yes. And where I was going was they do have some innovations, and the interplay between those innovations and what's working there and other very remote communities. And I'll leave it there.
All right, thank you.
If you could take that on notice, I appreciate it.
All right, Senator Watt?
Yes, thanks, Chair. We haven't got too much more. Just got some questions about funding for after-hours GP services. Just having a look, budget paper 2, page 97, goes through some of the Medicare-related measures, and one of them is additional funding of $56 million in 22-23 to support primary health networks to commission after-hours healthcare services and address broader drivers of after-hours demand. So this is the funding, this is additional funding the government is providing for primary health network after-hours program, is that correct?
That's correct, Senator. So it's an existing program
Yep.
that is already commissioned in each of the 31 PHN regions for after-hours care. It's commissioned by the PHNs and delivered through various mechanisms depending on the region. And it's been extended for a year to make sure one of the things that obviously has had a big impact on after-hours care are things like telehealth. And access through Health Direct and COVID measures. So it's an extension of an existing program.
Right, but it's only an extension for 1 year.
At this point in time, Senator.
Right, and I note there that it also says that this funding will apart from supporting the after-hours healthcare services, this funding is also to be used to address broader drivers of after-hours demand. Is it possible to say how much of that funding will be used for that second purpose, addressing broader drivers, as opposed to commissioning after-hours healthcare services?
So I might turn to Mr Cottrell for the detail, but obviously, as I mentioned, one of the things that we're looking at, that whole program is trying to provide after-hours access to avoid hospitalisations and presentation at ED. So it's being looked at in the context of the advent of telehealth and permanent telehealth and a range of other Health Direct access measures. But Mr Cottrell, do you want to step in here?
Sure. So the program's been evaluated extensively in the evaluations on our website. We wouldn't be able to give you a precise breakdown between what's a pure after-hours service and what's a preventing people present in the after-hours period. But I can tell you that some of the PHN programs are very focused on residential aged care facilities, for example, to help prevent people needing to be transferred to hospital in the after-hours period. Some of them are focused on homelessness services, which operate in the after-hours period, but the core of that is about serving homeless people. A bunch of them are very focused on disadvantage. Others are more focused on providing a routine service in the after-hours period.
Right. But it would be,
That helps.
it would be fair to assume, though, that at least some of that 56 million that's been allocated will be used to, quote, address broader drivers of after-hours demand, as opposed to supporting the PHNs to commission after-hours healthcare services. Is that right?
All that money will go through the PHNs, and the PHNs either take a direct approach in providing, in commissioning an after-hours service, or commission a service which addresses the broader drivers.
Right. So it'll be left up to
the whole lot of the money goes through.
It'll be left up to the PHNs, but some of the funding could be used for the direct after-hours healthcare services that they've been providing, or some of it could be used for broader drivers of after-hours demand. And you've given us examples
and we would
of that.
expect we'd expect that that's just a continuity of what's been happening to date through that program.
Okay. So equally, you couldn't really say how much of that funding will go to will be used by the PHNs to support after-hours care.
So all of it will go to support after-hours care and reducing the pressure on hospitalisation. Senator, the reason there is differences across all the PHN regions is specifically because it goes to address what are the drivers of the need for after-hours care and where people present. And as you know, we fund PHNs to be able to have regional flexibility in those responses.
Mm-hmm. I don't know if you've got the 2021 budget papers handy, so last year's budget, but BP2 there at page 122 also mentioned that an extension for 1 year of the primary healthcare network after hours program was being provided, but in that case it was 71.9 million. So last year's budget gave 71.9 million to extend the primary health network after hours program for 1 year. This year, it's 56 million to extend it for another year. And it's, I suppose, a sort of a broader purpose. It's the after hours services and also this thing about addressing broader drivers. So why is it that less money has been provided in this year's budget than was provided last year?
So, Senator, the 56 million represents, new additional funding to extend it for a year. However, it also is using unspent allocations within the PHNs. So in terms of services and in terms of the funding for the services that are already commissioned, none of that funding will go down. It's using unspent funds within the PHNs and topping it up with the 56 million in new appropriation.
But presumably in last year's budget, when extra money was provided, there were unspent funds from the previous year that could have also been used.
So, Senator, certainly there may have been, and I don't have the details on what unspent funds were there the year before, but as you will appreciate, permanent telehealth and its application has fundamentally changed the call on after-hours services. The extension of Health Direct services, so the Health Direct clinical lines as well over the last year, has meant the nature of after-hours demand and access has shifted significantly over the last year.
Right. But the fact is that less money is being allocated, less new money is being allocated in this year's budget for the primary health network after hours program than was allocated last year.
Yes.
Thank you.
As a top-up, Senator.
Sorry, so can I just be really clear here, because I think I know where you're going,
Yeah, well,
Senator
it's a
Watt.
cut, isn't it?
No, Senator Watt, it's not a cut.
It's a cut in new funding.
Senator Watt, it is not a cut. And I think, as you have just had explained to you, there has been a significant change in the health landscape around how services are delivered. And one of probably the most revolutionary, game-changing ways of the delivery of service has been through telehealth. So I would absolutely refute that there has been any cut to services. There may well have been different budget items and line items that have been joined together to provide a particular service to a cohort of people. But when it comes to the people who are being serviced, there has not been any cut in funding at all.
Okay, Minister, but I mean, you must acknowledge that $56 million is a lower figure than $71.9 million.
Well, Senator, you can be as tricky as you like.
Well, that's not tricky, that's just
No,
basic
no, you
mathematics.
are being tricky. What you're trying to do is to try to make, draw a comparison between two numbers that may well represent completely different things, and saying that, you know, this number says this number says this, therefore there's a cut. That is not correct. The services that are being delivered, the after-hours services that are being delivered to the cohort of people that you are referring to, there has been no cut in funding. There may have been a change in the way appropriations have occurred because of, underspends from previous years or funding that's available from a previous year. But your suggestion that there has been a cut in the funding available for the provision of that service is not correct.
But, okay, let's just take a step back. Forget about, health policy, service delivery, just maths. 56.
Senator, I'm not going to play this game
56
with you,
is
Senator.
lower than 71, is it not?
Yeah, it's Senator, and red isn't green. I'm not
that's
going to
right.
play this stupid game with you because
It's not a stupid game.
No,
It's
it is a
about,
very
it's about
stupid
funding
game.
for after-hours health services.
It is,
That's
and
not
I have
stupid.
told you that we have not cut any funding to after-hours health services. They may have been provided in a different way or may have used funds that were available that were left over from a previous year. The amount of money that is available for the provision of those services has not reduced in this year.
So you're telling me that reducing funding from 71.9 million to 56 million is not a reduction in funding, is not a cut.
Senator, we can play this game all afternoon.
Well, it's not a
if you
game,
like.
it's about
you were
after-hours
playing a
health
game.
services.
Senator, as I've said,
I'm just intrigued
it's the
about how
amount of
56 can be bigger than 71.
Well, Senator, I'm not telling you that one is bigger than two. Okay, I'm not doing that.
So it is
because
less.
I'm not telling you that. What I'm telling you is that we have a program here to provide services to a particular cohort of people, and I am telling you that that group of people has not had a reduction in the amount of funding that is available to them for the provision of those services in this budget. It may well have come by a different mechanism or a different budget line, but it is not a reduction in funding.
Okay, the BP2 again, same page, page 97, notes that this budget provides $108.5 million in new funding over 2 years from 2022-23 to extend the Federation Funding Agreement of Public Dental Services for Adults. And there's funding there, I think, for the next National Child Oral Health Study as well. So that funding, as I say, is over 2 years. So it will end on the 1st of July 2024, will it?
So, Senator, you're right, the funding goes over 2 years, and that the second year reflects the Child Dental Health Survey in the out years. The funding under the National Partnership Agreement extends that agreement by another year.
Right, but this funding will last for 2 years.
That's right.
From 2022-23. So it will, at this point in time, it will end on the 1st of July 2024.
Yes.
So does that mean that according to this budget, funding to support the states and territories to provide public dental health services will end?
Senator, it's been an extension of that NPA for a year. That's a government decision, and it extends that National Partnership Agreement for a year.
Yep.
That National Partnership Agreement will be extended to the end of June 2023. The reason that the funding goes over 2 years is because the survey goes over the second year.
Okay.
There'll be a decision for a new government in terms of any extension to that National Partnership Agreement.
So it's actually, if we're just looking at the funding agreement for public dental services for adults, it's actually just a 1 year extension.
For that National Partnership Agreement,
Right.
yes.
So again, at this point in time, funding will end for public dental services for adults on the 30th of June 2023.
That's right.
Well, no, hang on. Senator, I know where we're going.
It's not looking
here.
good, Minister, is it?
No, well, unfortunately,
jump
I'm
in
going to
and-
have to spend the rest of the afternoon trying to,
Well, it's-
to correct the impression that you're trying to put on the public record. Now, I know you have never been in government, Senator Watt. I know you've never been in government.
Not at the federal
But I
level.
would have actually thought that you would have known how to read a budget and you'd have
I
understood.
do, I've just interpreted it for you.
No, well, you've interpreted it incorrectly.
Not
so
according
the
to
rea-
your officials.
Senator Watt, when you put budgets together, there are you put them in for a period of time. Sometimes you extend things temporarily or
after
for
an
short
election.
periods of times so that you can have the opportunity to renegotiate things, because we have a number of MPAs that we have in place with the states and territories for a delivery of a number of services. I mean, obviously health isn't my portfolio, but I certainly know in my own portfolio it's the way that it happens. Because there doesn't happen to be funding past a certain point in time, may well mean that there's negotiations to be had, consultations to be had, there may be new agreements that need to be negotiated across all states and territories. Simply because there is not ongoing funding past a certain period of time cannot be directly assumed that that funding will not occur post that time. There is, I would suggest, there is almost entirely, in just about every case, these sorts of programs are renewed after another set of negotiations with the states and territories. So I think, you're jumping to the conclusion by saying there is no funding for dental after a certain
Well, it's not a
period of time.
conclusion, it's a
is
fact.
misleading the people that are listening
It's
to
a
us.
fact. There's no, well, show me
Senator,
where the funding is.
I'd like to draw your attention then, I mean, we haven't got them in front of us, but I'm happy to come back after the break and I'll provide you with a million examples in budgets when your government or your party was last in government, and which will show that there are programs that go for a period of time, and during that period of time they were negotiated for a period post that time. So, it's very disingenuous for you to be suggesting that a program's just simply going to fall off the edge of the world just because it's not funded post a particular time.
Well, I'm aware.
Senator Watt, your time's up.
Okay, can I just be a couple of minutes and then we're done?
All right.
I'm well aware that this budget across portfolios is chock full of short-term fixes to push decisions till after the election. We've got the fuel excise cut, we've got the cost of living bonus, we've got dental services, we had primary healthcare services after hours that are all being given one-year extensions to push decisions.
You're talking about two different things here. I think what you're talking about, and the first two things you're talking about, are temporary and targeted measures to address the immediate impact of cost of living pressures for a whole heap of reasons. Supply chain disruptions.
But they only last for a few months.
Senator, they are temporary and targeted measures to address an issue that is before us at the moment. The other two issues that you're referring to are ongoing, programs that are likely to be ongoing into the future, like many other programs that are negotiated within budgets for state, in relationship between the Commonwealth and the states and territories. So I don't think you can actually bundle a temporary targeted measure, like the cost of living measures in the budget, in the same breath as you're talking about programs that are largely ongoing programs that just get negotiated at different times with states and territories.
Even within this portfolio, though, there are other examples of services that are being given a year's extra funding or 2 years extra funding to push them past the election. We've got $32.3 million in 2022-23 to continue the intergovernmental agreement on digital health with the states and territories for a further year. We've got $5 million in 2022-23 to the Pancreatic Centre at Epworth to diagnose and treat pancreatic cancer, etc. So the government is not at this point prepared to provide long-term funding for initiatives like those.
Well, the pancreatic cancer was the capital funding, Senator, so that's just a capital investment. It's not a recurrent short-term funding.
Well, there's $12 million over 2 years for Health Direct Australia to meet an expected increase in demand for health information and advice online and over the phone. Is it fair to say, Minister, that the government has decided to stop funding these services before the end of the forward estimates?
No, it's not fair to say that at all.
It's just that you haven't provided them funding.
Well, Senator, I think I've already explained to you the mechanisms that are used, and they've been used historically by many governments of many persuasions over many, many years. That sometimes you do roll things over for a period of time to provide additional time to renegotiate agreements. It's probably been something that's happened perhaps a little more in the last couple of years because of the impact of COVID and making sure that, whilst the focus has been on providing, the COVID medical support, that instead of being out there negotiating the new contracts for longer term, they haven't been able to do that because they've been focusing on things like getting vaccines rolled out, and many other things that were impacting our society because of COVID. So instead of, making sure that the continuity of service was there for a period of time, they've been extended for that period, and during the next few months, those negotiations will take place with states and territories and service providers around, the long-term commitment to funding for those services. So I think you're going down a wrong burrow here, I'm afraid, Senator.
Okay. Other people make their interpretations. That we're all done.
No, I've still got some questions of my own I'd like to put on the record.
We are all done.
So thank you. I'm sorry to delay everyone, but first of all, can I just something that you've mentioned earlier has prompted something from me in regard to public dental for adults. What sort of services provided to adults under the NHRA?
So, thanks, Senator. And I should have mentioned in the context of the Dental National Partnership Agreement, one of the conversations that we've been having with the states and territories is in the context of a new National Health Reform Agreement, where the dental more broadly should be incorporated into that. Under the NHRA, there's a range of specialist outpatient procedures provided and acute admitted dental procedures. In the last 2 years' worth of data, $288 million was provided for specialist outpatient procedures and 77.9 for acute admitted dental services funded under the NHRA.
Okay, there is some there. I just had a couple of quick questions. That actually wasn't the questions I was going to ask. It's more about preventative health that I had some questions on, especially in regard to the National Drug and Alcohol Research Centre. So I'm not sure who the right person is for that.
So that's also me, Senator.
Okay.
Thank you.
Can you just give us a bit of an outline on the work of that? It's something that I've got quite a personal interest in, so I'd just like to understand that.
So, Senator, under this budget, there has been a decision to extend the National ICE Action Strategy and have a number of other measures under the alcohol and drugs funding for treatment and prevention services. Specifically in terms of the National Clinical Centre for research on emerging drugs, that was a funding commitment under the National ICE Action Strategy of $8.7 million previously to establish the centre. This decision extends that for another 4 years by $8.2 million of funding, and that is a centre that is kind of a world-class conglomerate and consortia of a range of very experienced organisations. It includes the National Centre for Education and Training on Addiction at Flinders University. It includes the National Drug Research Institute at Curtin University. It includes the National Drug and Alcohol Research Centre at the University of New South Wales and St Vincent's Health in Australia. So doing some really excellent clinical research, particularly around best practice, translating clinical research into best practice, and looking at best treatment pathways for methamphetamine abuse, but also new and emerging drugs.
Okay, so that sounds a promising extension, so that's great, thank you. I was conscious that Senator Rennick had asked for the National Blood Authority and the Australian Institute of Health and Welfare to be here. We've tried to be in touch with him and he hasn't responded, so we will, on that basis, we may wrap up on the health. So, sorry.
Ms Shakespeare had an
outstanding question?
Yeah, I just wondered if she had the answer in relation to the MRI full licence costs that Senator Grogan asked.
So I did touch base with my team back in the department who said that's a far more complicated modelling bit. They are due to appear under outcome 2 on Wednesday next week and they'd be happy to bring the data then.
Right. Is it possible to get the data before then?
I'm not sure exactly how long it will take. I mean, we'll certainly bring it then, but if it's ready earlier, we'll provide it through the Secretary.
That'll be appreciated.
Thank you.
Further question? So with there being no further questions, the committee's consideration of the health portfolio will conclude for today. On behalf of the committee, I thank the ministers as well as officers from the Department of Health and agencies who have given evidence to the committee today. We will now break for 15 minutes and resume with the social services portfolio at 4:10.
Yeah, no worries.
4:15. Okay, we'll go to 4:15. So we're now suspended. Oh, okay. 4:15. Thank you. Okay, so the committee will now commence its examination of the social services portfolio. I reiterate for the committee and officers the earlier statement that an officer of a department of the Commonwealth shall not be asked to give opinions on matters of policy and shall be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. I also briefly draw the attention of witnesses to an order of the Senate of 13th of May 2009 specifying the process by which a claim of public interest immunity should be raised. The committee would appreciate if senators could provide any written questions on notice to the Secretariat by Friday the 22nd of April 2022, and the committee has fixed Friday the 20th of May 2022 as the date for the return of answers to questions taken on notice. Now welcome the Minister for Family and Social Services and Minister for Women's Safety, Senator the Honourable Anne Ruston. And I also welcome the Secretary of the Department of Social Services, Mr Ray Griggs. Minister or Secretary, would either of you like to make an opening statement?
I don't. Thank you, Chair.
Chair Ray Griggs, Secretary. Just like to acknowledge the traditional custodians of the land upon which we meet, the Ngunnawal people, pay my respects to elders past, present and emerging, and extend that respect to any Aboriginal and Torres Strait Islander senators or witnesses today. I just make the point, I have a couple of...
Can we turn it up a
He just did a welcome to, he just acknowledgement to country.
Okay.
Oh, we've turned it up, I think.
Thank you.
Right. We have a couple of key staff unavailable today through illness and absence.
Okay.
And we have a number of video witnesses mainly due to COVID.
So they are on video witnesses are already signed in, we just haven't got any visibility yet.
The comments made by the Secretary that you couldn't hear.
I just acknowledged country. That's
Oh, sorry. I do apologise. I just couldn't understand.
I could hear.
I couldn't hear. Yeah.
Sorry.
Okay, so no opening statement apart from that?
No.
Okay, so we will go first of all to Senator Adcock.
Great, thank you. So can I just start off with some questions around the cost of living payment that will be delivered to eligible individuals progressively from late April 2022. I imagine DSS or Services Australia will notify recipients the payment deposited into their bank account is the one that they're eligible for and not a departmental error that they'll have to repay.
Yeah, I'll get Mr Sloan to provide you details with how we communicate with people who are eligible to receive payment.
Well, to follow on with that, I guess the first point is I presume that you will let them know that it is an eligible payment, and then who will provide that notice? What form will it take? Will it be a letter, a text message, a phone call? What work has been done designing and drafting that notification? And will there be a single notification or more than one? And when do you imagine the first and any follow-up notifications will occur?
Senator, we'll be able to answer some of that. Some of it may be better answered by Services Australia, who will actually be doing it.
Sure.
So we could come back to that tonight later on.
Absolutely. So if you let me know
we'll
which
answer what
ones
we
you
can.
deal with, or if you answer with that, I'll tick it off and come back.
Sure.
Thank you.
Troy Sloan, Acting Deputy Secretary of Social Security. As the Secretary said, a lot of that is Service Australia, but what I can tell you, there will be notifications out to people, because you're right, Senator, with people who, if $250 turn up in your bank account and you don't know where it comes from and you have a reporting obligation, a lot of people will ring up and or try and contact Service Australia, and we want to avoid that that contact, given how busy Service Australia is doing many other things. So there will be communication through the normal channels that people have chosen. So again, you know, people can choose how they receive their information from Services Australia. And certainly, as the Secretary said, more detail than that, I would suggest you talk to Service Australia later in this evening.
Okay, so that notification will come from Services Australia?
Correct.
Yeah, okay. And do you know when that notification will be made?
Maybe I answer it this way. It will take some time because it will new payment. It only just passed Parliament, obviously. Therefore, the build to actually generate into the Service Australia system will take some time. They have to test it and so forth, as they do for payments as well. So it won't be going out immediately, but I would suspect they'll get it out as soon as they can. For the exact dates, again, I would refer to Service Australia.
Okay. Yes, Senator, can I just reassure you, it will be out, within a matter of weeks,
yes,
certainly.
Well, it'll have to be if they're going to get it in late April, Senator.
Yeah, this month. Yep, exactly.
There.
This month is what Services
The first
Australia
today, so...
Well, it'll be this month.
Yeah, so the payment will go out this month and the contact
I
will happen
understand the
before
payment.
the payment
That's why I
comes
was
out.
asking
Yep.
the critical issue about the date
Yep.
as to whether the information is going to hit the people before
It will, yes.
the payment hits their bank accounts.
It will. I just haven't got the date, and Service
Yeah.
Australia will be able to answer that.
And are you able to tell me what you've budgeted for these notifications, both in total and per notification?
So, Senator, what I can say is that the Service Australia cost for delivering the cost of living payment is a little bit over 18 million, so it's $17.8 million in 2021 and 300,000 in 22-23. Now that will include everything. So that's the IT build I just spoke about, sending the notifications, testing the IT, and actual physically processing the payments. As for how much of that is a cost about sending out the notification, again, I would refer that to Senator, to Service Australia tonight, Senator.
Okay. And are you planning on informing the public in other ways? So you talked about the normal process that people undertake, whether that be text or email or whatever. So things like broadcast advertising, digital and social media, general information, booklets and leaflet, any of that sort of information?
Certainly, Senator, there are the... well, maybe I answer this way.
Maybe what's going to make up that 18 million?
Yeah,
maybe that's a better
yeah,
way.
well, again, that would be a matter for Service Australia, but certainly the department is not planning any comms around that, apart from we'll put stuff on our website that saying, the payment has been passed and it will be progressed under sort of these dates and so forth, but we're certainly not doing a campaign, Senator, no.
Okay, so is DSS or Services Australia taking the lead on the public information campaign?
Again, I would say I wouldn't say that there's a campaign that has a certain meaning. What I'm saying is that from the communicating with recipients, that Service Australia is leading that work.
Right, okay. And can you tell me what work's been done developing the information and the design of that information? And when will it start?
Well, again, I think... again, come back to... I would, as I say, like Service Australia in the design, and obviously there has been information included in budget papers, but certainly from the point of view of contacting recipients, that is, as the Secretary said, Service Australia this evening.
Yeah, okay. And, I mean, obviously, Services Australia, as you said, is taking the lead, but is DSS working with any other agency or another agency to inform the general public about the payment?
Certainly, like Veteran Affairs will be making, are involved in this, and Service Australia also makes payments for, for the Department of Agriculture, Water and the Environment. So obviously we'll be discussing with Service Australia. They have relationships with all those, and we'll be working with all those, yes.
So Services Australia and Veteran Affairs, they're the only two?
That will make the payment, I believe so, Senator, but I'll double check that. But well, certainly, it won't be any more than that.
Yep, okay. And can you tell me, you said it was 18 mil and then 300,000?
No, sorry, 17.8 million for 21-22 and 300,000 for...
Something wrong with my hearing today, I think. So
maybe
17.8...
17.8 million in 2021.
Well, that's nearly 18 million.
Yeah, and then 300,000 in 22-23, and for a total of 18.1, Senator.
Ah, right, okay. And which agency is paying for that campaign?
It's not a campaign,
Okay, sorry. Which
Services
agency's paying?
Australia. That's
So that's
Services Australia's
Australia.
cost of delivering it. Yes, Senator.
Has any external advice been engaged in relation to that?
Outside of the department, Senator? No, Senator.
Okay. And have you provided any advice to any other agencies or ministerial officers?
What I would say for officers and the Minister is we provide a range of advice on a range of things during budget, and I wouldn't go into that. And for other agencies, we speak to other agencies, and particularly Service Australia, regularly about a range of things, and we have certainly spoken to them about the cost of living payment, yes.
And I presume you've spoken to Veteran Affairs as well?
Yes, Senator.
Okay. Have you received any advice in relation to this happening during the caretaker period?
No advice about what's happening in the caretaker.
I mean in terms of getting the information out and how you're going to do that.
Senator, I would say that any information we provide will be consistent with the Caretaker Convention.
Right. And then, as I understand, the Caretaker Conventions state that bipartisanship should be sought on campaigns or issues to continue during that caretaker
Senator
period.
Urquhart, can we just be really clear?
Yeah,
You
correct.
keep using this word campaign.
Correct.
There is no campaign, Senator
Okay. It's
a
Urquhart.
notification.
It is just a notification, and I mean, you can speak to Services Australia tonight and they'll sort of outline to you how they go about regular notification to people that they're paying. But you'll see that clearly this is just a standard inline notification of a payment. You know, I'm quite happy for you to give us the Labor Party's imprimatur to pay the $250 to these 6 million Australians if you'd like to do it now.
So can you tell me what work has been done? Have you done any work to seek bipartisan support in relation to the information that's going
Well,
out?
we're not in the caretaker provisions as yet, Senator.
Will you seek bipartisan support?
Well, right now, we're not in caretaker. It was an announcement in the budget, and obviously we didn't seek your advice, or the opposition's advice about matters that were in the budget. But obviously, any decisions that are taken during the caretaker period will meet the conventions of caretaker.
Okay, thank you. Yeah, you've got more.
So are you just moving on? Just wanted to clarify, because we appear to have missed corporate matters, if there was any clarification, because otherwise we'll release any officials that are only here for corporate matters, because we seem to have moved into outcome one quite solidly. So if everybody's happy, we'll just proceed with that and let any other corporate matters officials depart. Okay, so are you going to keep going now, Senator Grogan? You've still got a little bit of time if you want. And then I'll come to Senator Rice after that.
Cool. I'd like to ask a few questions about the revised paid parental leave announcement in the budget. So those changes, which are outlined in Budget Paper 2, under the funding profile, Service Australia gets some, so I appreciate that some of this you may tell us to ask later on. They get some modest funding starting in 21-22, but the significant funding doesn't flow through to...
Which page are you talking about, Senator?
It is on page 168. Oh, is it? No, it's not. Sorry, wrong page. It is page 169.
Okay, yep. Okay, sorry. Can you ask your question again?
Yeah, so the profile that's there, what I'm interested to know is when people can actually apply for this payment. So that profile looks low, but I appreciate that it may be in more than one area in the sense of DSS money and Services Australia money. So I'm just wanting to understand what that profile looks like and when people could expect to be able to access that money, that new scheme.
Okay, sorry.
So, Senator, I'd say from looking at the money, if you're saying it's like the Department of Social Services is the actual where the appropriation comes from. So the 127, 179, 184 in the line for the Department of Social Services is the increase in paid parental leave expenditure because of the changes in policy. So, I suppose I'm just reflecting that. I'm not sure that where you're saying service stray and it's low.
So what I'm trying to understand is when will the payment flow through? So can someone apply for it tomorrow?
The payments, I think the Treasurer has said from the 1st of March 2023. But my understanding is that it's not provisioned in here because when the program was designed, it was designed from the 1st of July. And I think we are hoping to be able to get it earlier, and we'll go through the normal MyEFO process if it is able to be done by that time, which the Treasurer is obviously keen to have it done by. Then there will need to be a provision made for those extra few months as part of the normal budgeting process going forward.
Yeah, and people will just continue to apply for the
Yeah,
payment.
they just won't get it. They just won't get the same. They just won't get the same policy application. So if I apply tomorrow,
if you apply tomorrow, if you are pregnant now, and you are going on paid parental leave tomorrow,
and I wanted 10 weeks, and my partner wanted 10 weeks, could we get that tomorrow?
Right now, you can get 12 weeks and 8 weeks. Yeah, 12 weeks and 8 weeks as we sit here today. However, the difference between what is put, the new measure is that instead of it actually being the primary carer being the one that it's all built around, the new measures basically say it's 20 weeks and you as a family unit can choose how you wish to take it. At the moment, there's a number of things in place that say, you know, the primary carer gets 12 weeks. There's a 6 weeks you can share with greater flexibility, and then there's another 2 weeks that's only available to the father, whereas when the new measure comes in place, it'll just be a straight 20 weeks, and the family, however that family's made up, can design how they wish to take it.
So at this point, is that available from the 1st of March 2023?
That is our intention, but I think there's a bit of consultation that we need to go to make sure that we've got some of the details absolutely correct. So there's a little bit more work to do if we're, and our hope is to be able to make it available by the 1st of March.
Right. So if I was pregnant right now, I wouldn't necessarily, depending on how pregnant I was.
Yeah, it might be just a twinkle in your eye.
It's indeed.
But you would still get, as the Minister said, the 18 weeks paid parental leave, and if they're...
No, I get all that. I get that you haven't taken anything from that.
Yeah.
I'm just trying to understand when the full aspect of the policy will be in play, because I think there's people out there going, oh, okay, but thinking that maybe they can access it, you know, say if they were going to have a baby in 3 weeks' time or 3 months' time, just that sort of sense of clarity about at which point can they access this full 20, work it out yourself, to balance your family needs, like what that. So at this point, that date is the 1st of March 2023.
Yes.
Okay. Yeah, because I think there's probably some people who are going, yay, that's great, and it may not tip in for them at that time. And so I think that communication piece, is there a plan to communicate that in a more fulsome way to people?
Sorry, Senator, before we go to that, I just want to clarify, for that change to happen, it has to be legislated. So Parliament has to pass the legislation. So it couldn't start tomorrow.
Because we don't know what Parliament, we would put the legislation in, it may well get changed in the Parliament. So at that point, then obviously decisions around the communication will be made.
Right, so at this point, it's a policy commitment.
Yes.
Without the detail being able to be done until it's passed the Parliament and a further appropriation scenario is done through MyEFO.
Well, there's consultation prior to the legislation, exposure drafts, etc. Then the normal process that we would go through with any legislative reform that we would be proposing.
So the budget measure also talks about eligible working parents. So can you expand on what that eligibility requirement would be?
So currently, Senator, again, I think it will start with the where we are at the moment, and then the changes if that would be helpful. So at the moment, for the primary beneficiary, usually the mother. Income has to be below 151,350 to qualify. And then if the primary partner is below that income and qualifies for a work test, which makes sure there has been engagement in the workforce, then they qualify. Under the new test, the primary beneficiary can still use 151,350 per annum, but the government has introduced a secondary family test that allows if the primary recipient is above 151,350 per annum, they can take a combined family income. Now, this was designed around gender equality. And so, for example, in a world where the mother, in this example, in this cameo, was, say, earning 50,000 and the father was earning 200,000,
Or the other parent.
or the other parent. Okay, this is a cameo. But yes, thank you, Senator. The other parent is earning 200,000. Then that family would qualify. If you switched it, where the primary recipient was earning 200,000 and the secondary member was earning 50, they wouldn't qualify because the primary is over 200, over the 151, 50. Yeah, correct, Senator. So therefore, in this case, it allows for higher earning females to higher earning primary recipients to still claim the payment.
Okay, so the new test is a combined test. Is that what you're saying?
It's a two-part test. You can use an individual test. If you pass that, you can apply. If you fail that, you can then go to the family income test.
Okay, so just so I'm really clear, the primary test is on the birth parent, shall we say?
Yes.
And if they don't qualify because their income is too high, they can then take a different test,
correct,
which is a combined family test.
Correct, Senator.
And if their partner is on a lower income,
It's
and
got nothing to do with the partners. All it is the primary carer or is on that. It takes the first income test.
Mm-hmm.
If they fail that, then the test then applies a $350,000 family income test. It's not about the other carer has to be under that amount. It's just a straight out 350 family income test. They could both earn 175,000, or one could earn zero and one could earn 349,000. It doesn't matter. It's just a combined income test. So it was designed for that, as Mr. Sloan said, around that equity proposition to say, if the primary carer was the primary income earner, then we're not discriminating against them on that basis.
So just a point of clarity then on that. The first test is 151, but you're saying the combined test is 350?
Mm-hmm.
Correct.
Mm-hmm. Okay. So therefore allowing this, got it. And so the work test requirements under the new scheme, do they remain the same, and do they apply to both parents equally?
Yep. I'll do, don't they?
They apply to the primary recipient, and it's the same. Yes.
So no changes?
Not to that.
And does the second parent need to comply with the same work test?
They don't need to, because it's we're just saying you are a family unit, however you are, and if you meet the test, so if the primary carer meets the test, that's it.
Yep.
Okay. So in terms of this policy, how do you envisage sort of measuring success? What's your measure of success for this program? Like, are you anticipating more people applying? Are you anticipating, do you have any sort of KPIs on it in terms of how it's going to be measured and how you would judge the success of the program?
I think the basis of the changes come on top of, since the program's been in place, we've received, correspondence, and I'm sure you have too, about the sort of the discrepancy around the fact that, and look, without going to mum, dad, definition, is so often found that when the primary carer, who normally is the mother, has earned slightly more, that she was finding that she wasn't able to get access to it, and so we wanted to make sure that that was the case. So a lot of this was driven around that. The other thing that drove it was also if you were a single parent, under the previous model you would have only been eligible for the 18 weeks because of course the secondary payment, which is the dad and partner payment, isn't available to you because you haven't got one yet. So what this seeks to do is to just provide an equity proposition that says whatever your family looks like.
Whatever the unit is.
That's it. You choose how you want to use it.
Great. Thank you.
Time's nearly up, so you've probably got about 2 minutes left.
Would you want to go to someone else and then come back to us?
Okay,
Is that all right?
happy to do that. Senator Rice.
Thanks. Thank you. And hello, Minister. I want to follow up on the conversation I had at last estimates about the poverty line. And Minister, are you aware of the Melbourne Institute's latest Poverty Lines Australia report?
Senator, we can probably have the same conversation that we had last time about the comprehensive support system that's provided by Australia's welfare system.
Minister, that's not my question. So you're aware that you're aware of their latest report?
I read a massive amount of reports. I'll check with my office whether it's one of the ones that's been through my inbox, but I'm aware of a number of reports in relation to the matter that you're talking about.
Well, they update their the Henderson poverty line every quarter, and they've just done the update on the September quarter, and where the poverty line was then set, the Henderson poverty line was set at approximately $88 a day. So, and I know we had the discussion with you last time about assessing what the poverty line should be, and we had a discussion it would be a really good thing for the government to do, actually, to do that work to assess what the poverty line should be. But we've got the current rate of job seeker at roughly now $45 a day, compared with the latest update of the Melbourne Institute poverty line at $88 a day. So it's about half. So surely, Minister, you have to acknowledge that the rate of job seeker is below the poverty line.
Well, Senator, if you want to go through it again, I'm more than happy to explain why Australia's social security safety net is designed the way it is.
That's not my question, Minister. I just want a basic acknowledgement that given on any assessment of the poverty line, it's, and there are, I agree, a range of different assessments, but the Henderson poverty line or the Melbourne Institute poverty line is the one that has been going since 1976, I think, and it's now at $88 a day. We've got job seeker at $45 a day. Surely with that disparity, it's just black and white that you've got to acknowledge that $45 a day is below the poverty line.
Well, Senator, the $45 a day that you refer to is the base rate of job seeker without any of the additional supplements and targeted payments and supports that are available to people that reflect their individual circumstances. As an example, we've just recently announced an increase in the amount of rental assistance that somebody who is on a primary payment is able to get access to. There are a number of different things that are available to target the circumstances of an individual. It could be, family tax benefit where people have children. It may be. The energy supplement, it might be, but there's also a number of other direct transfers that people who are, or all Australians benefit from, whether it be universal healthcare and the fact that access to a healthcare card and other measures. So the oversimplification of your question, misleads in relation to the targeted nature of Australia's welfare system. But, Senator Rice, I absolutely agree that the quality of life and of somebody who is on welfare is acknowledged as being below that of somebody who is in the workforce. And this government will work and continue to work tirelessly to make sure that Australians who are able to work have the opportunity to be able to get a job. And that's why we have focused so hard on making sure that we're driving the unemployment rate down, so that because there are jobs and making sure jobs are available.
But for people who aren't in a job for whatever reason, and there are a whole range of reasons why people aren't in a job, they're having to survive on the job seeker rate. I've just done the calculation that, you know, the job seeker per fortnight at approximately $45 a day is $642.70 a fortnight. The typical maximum rate, including supplements, goes up $10, $651 a fortnight. That brings it up from $45 a day to $46.50 a day.
You've just added one of the things.
No, so that's the typical maximum rate, including supplements.
So you haven't clearly not added or considered rental assistance. You've clearly not considered, any family tax benefits that might be available.
This is for a single job seeker with no children. So
who owns their own home?
I don't think. Well, I would. I'll come
Well,
back
he's
to
not renting. Because a single job seeker who was renting would.
Can you tell me what that is then?
140. 145.80. $145.80.
$145.80. Yeah, that's right. Which is, and if you're paying it, so $145.80 per day. What do you?
Per fortnight.
What's
Per fortnight.
per fortnight? So that's the additional $145.80 a fortnight. So that's the rental assistance. So okay, so it's six. Didn't really want to get into doing the calculations here on the. You know, let's go with it. 161.50 plus 145.80 is divided by 14. Okay, so we're up to $57. $57 a day, compared with the Henderson poverty line of $88 a day.
Well, Senator, as I said, there are a number of other things that are available that are targeted.
No, we've just added them all in, Minister.
Oh,
We've
no,
just done the calculation.
Senator...
Because okay, the typical maximum rate, including supplements, I had added in. We've now added on rent assistance. So we're up to $57 a day.
Yep. Have you added in I think it's $520 a fortnight of transfers through universal health and the like, that on average it's available? I mean, clearly you haven't...
No, but I'm pretty sure that they're accounted for in the poverty line estimates the Melbourne Institute use as well.
So I mean...
this is what people need in order to be able to survive.
Senator, first of all, I don't necessarily accept the premise behind the calculations that sit behind the Henderson poverty line that you're referring to. But what I would say is that the Australian government over many, many decades under different governments have always taken the view that we need to have a social security system that is absolutely targeted at the individual needs of people, and it reflects the particular circumstances of individuals. It is set at a level that is fair for the people who need that support while they're without a job, but it also needs to be fair for the people. Senator, I would appreciate you to allow me to finish what I'm saying. But it also has to be fair for the people who are paying for it. But most importantly, Senator, it has to be sustainable into the longer term, so it's there for future generations. And so it is a balance that is struck to make sure that there is a safety net there for people when they find themselves without work. But we also make sure that we target programs to break down barriers so that we can get people off payment and into work. Because, as I said, people who work absolutely, I can see, have a better quality of life than those people that are not working.
Minister, it's very clear that you say that it's a balance, but that at the current rate it's below the poverty line. I just want you to acknowledge that. I understand the justification of your government as to why you are making that political choice to keep people who are on income support in poverty, but I think you need to acknowledge that including the maximum rent assistance, you're looking at $57 a day, whereas the most preeminent assessment of what people need to not be living in poverty is $88 a day.
Well, Senator,
whether that's and particularly for people who are on income support for a long period of time. It's not just people sort of going in and out, being there for 3 months and being able to draw upon savings. You've got people who are living in poverty for years and years and years.
Well, Senator, you and I are just going to have to once again agree to disagree on the premise that you're putting forward.
And that it's a political choice, that you're making that political choice. You're making a political choice for stage 3 tax cuts, which are going to cost the budget bottom line $158 billion over 10 years. It's a political choice to be keeping people in poverty.
Well, Senator, I refute the premise on which you're putting this to me. I've been very clear, as have governments over many, many years. We provide a safety net to people while they find themselves out of work, and we'll continue to do so, but we will continue to make sure that we have we do have one of the most targeted, comprehensive welfare systems in the world, and we'll continue to provide that safety net to people when they find themselves out of work.
Minister, tell me what the intent of the $250 cost of living payment to welfare recipients in the budget was.
Well, it recognises that currently we have a set of quite extraordinary circumstances that are washing through the economy, which have seen, for instance, prices of fuel go up significantly, which is why we also had the excise measure in the budget as well. And also the impacts of the unrest and the war in Europe, particularly around the energy supply. So what we've sought to do is to provide, I suppose, a top-up payment to help people through this, what appears to be a very temporary situation. We've already started to see prices come down, particularly as a result of the excise measure, so that they are able to maintain their buying power through this time of this sort of temporary, unusual situation that we find ourselves in at the moment.
It's a once-off payment, isn't it, Minister?
Yes, it is.
Yeah, so it's a $250 once-off payment that people will get this month?
Yes.
Is expected, that $250 on the people living on income support who are currently well below the poverty line isn't even going to get them to the poverty line. It is expected that their the costs are expected to go down again after April.
Well,
basically that $250 payment wouldn't even get them to the poverty line for a week.
Well,
if you add it in, it brings them up rather than the $45 a day to $62 a day. Or if we, rather than the $57 a day, it would bring it up to about $70 a day. Wouldn't even get them to above the poverty line for a week.
Finished?
Yeah.
Well, Senator, as I said, the temporary nature of the situation that we find ourselves in at the moment because of these unusual circumstances with supply chains and the disruption in Northern Europe have seen, a spike in prices, particularly at the Bowser. So the $250 payment that people will be receiving, 6 million Australians will be receiving in April, we hope we'll be able to provide them with some additional cost of living pressure relief. Last week, the 20th of March, we saw for pensions the largest ever indexation increase, where we saw a $30 increase for couples, $20 increase for singles, and a $13.20 increase for people on working age payments. So combined, collectively, plus obviously the measures that relate to the index, the excise on fuel, there are a number of measures that the government has put in place to try and make sure that cost of living pressures are eased, and making sure through indexation we make sure twice a year that the buying power of people who are on payments dollars are maintained at an equal level.
How long do you expect these cost of living increases due to the current situation we're in to last for?
It's probably a question best directed to Treasury because, of course, they do all the modelling. But as I said, twice a year, every year, there is an indexation that is applied to both pensions and working age payments that seeks to
No,
make
but I'm
sure
asking
that...
about this $250 extra payment. So how long, I mean, as I said, that isn't actually even going to bring a job seeker above the poverty line even for a week. How long are you expecting them to have to eke out that $250 to address these cost of living increases? I mean, if it was 10 weeks, for example, that would give them, $25 a week.
Well, Senator, as I said, there is a stabilising mechanism that's built into our social security system that says twice a year people's payments, whether they be pension payments or working age payments, they will be increased in line with the cost of living so that their buying power is maintained. This is in addition to that, and it's also in addition to other measures like, as I said, the excise measure in relation to fuel, because we knew that the single commodity that was actually under the most pressure at the moment was the increase in the cost of fuel at the Bowser. So there are a number of different measures that have been put in place to alleviate the cost of living pressures that Australians are facing at the moment.
Minister, do you believe that $250 bonus payment adequately addresses the increasing cost of living, particularly for job seekers?
Well, Senator, I mean, I don't know whether you're choosing to not hear me. This is in addition to the normal stabilisers that are in place, which is the indexation. It is an additional payment, recognising that we have this unusual set of circumstances at the moment, particularly as a result of the war in Northern Europe, that is having an impact right now. And so this is an additional payment, but under normal circumstances, every 6 months, our payments are increased to reflect changes in the cost of living. And that will continue to happen as it always has, but this is in addition to that.
And people will continue to live in poverty.
So, Senator Rush, your time's expired. So, Senator Groden.
We're up to outcome 2.
All right.
Oh, okay. I've got
Senator Urquhart, you didn't have any others? Okay, sorry.
I've got two more lots in outcome 1. One was in last estimates. I asked Services Australia about the 27 recommendations they've met or are meeting in Economic Justice Australia's report, Debt, Duress and Dobbin Centrelink Compliance Process and Domestic Violence. And
probably need to ask Services
No.
Australia,
They
right?
informed me that the department would take the lead in relation to any consideration of the recommendations that pertain to policy. So I want to know whether the department has considered the report and its recommendations in regards to improving policy for people facing domestic violence.
Senator, certainly we are aware of the recommendations, and we talk with Service Australia regularly. I'm just wondering if Mr. Abel is online, if he is able to. Oh no, sorry, it's Mr. Please join us. Sorry, apologies.
Senator Nick Latimer, Acting Branch Manager, Participation Supplementary Payments. We've continued to discuss the report with Economic Justice Australia over the past few months, and the recommendations which particularly relate to us, which are about our policy guidelines, have progressed. We've recently provided drafts for Economic Justice Australia's consideration.
Okay, and so you're... That's good to hear. So when would you expect to have a finalised recommended changes to relevant policy items? And can you tell me what are the sort of changes that have been considered?
Senator, I wouldn't want to put a time frame on it because we're obviously working with an external party and we'll rely a little bit on when they're able to respond to the drafts. I think I'd need to take on notice whether we're able to share drafts with the committee at this point.
But certainly, Senator, as Latimer was saying, we have been sharing drafts and working closely. We meet regularly. The Secretary met with EAJ recently. We have a very strong relationship with them, and we are looking at ways of ensuring that the Social Security Guide is in a way that is, that can actually sort of make it easier for people to understand what the policies are.
All right, well, I look forward to hearing future updates. My last question in outcome 1 was about the review of the disability support pension impairment tables. And basically been asked about whether submissions to that review are being published. And if not, why not?
So I suppose, yeah, okay, Senator, I think the issue is around that there wasn't, we haven't explicitly asked everyone whether they were comfortable with their their submissions being put up on the website. So there's obviously an issue there about privacy. Certainly those organisations who have put submissions in, are free to put them up on their own websites, and I understand some have. So I suppose that's the answer, that when we would have to go back and check with each individual, and I think there's over 120 odd off the top of my head.
So why weren't you asking people whether they were happy for those submissions to be published? That seems to be a bit of an oversight. I would have thought that government was pretty used to this sort of stuff by now.
I suppose the issue was, particularly for individuals, we wanted them to be free to express what they wanted to express without being worried about whether what they were saying, and particularly for individual cases where they would be made public, Senator.
Did you request submissions? Was there a public request for submissions?
We put on our website asking for submissions, yes, Senator.
And so was it a form that people filled in, or was it just an email address that they were given?
You could sort of just upload something if you wanted, or there was a guided series of questions. I think there's about 10 questions, Senator, that you could then fill in and click on that and say, yep, I've answered that one, move to the next one.
So wouldn't it have been a sensible thing to have had on that guided series of questions a question as to whether you were happy to have your submission published on the website?
I would have to take that on notice, Senator. It was some time ago since we...
Pretty basic community consultation, and then to have transparency as to what people are saying in response to those impairment, in general, but in particular with response to the impairment tables. Are you actually going to request, are you intending to publish any of those submissions? Is there a process of actually asking those 122 individuals or organisations whether they would be happy to have them published?
No.
So you're not intending to publish them?
I'd say there's not a process at this stage to go back to.
But you could ask them. You could, you've got all their contact details.
I mean,
there's certainly a desire from the sector to have those submissions, readily available for people to be able to, peruse them. And almost all other, government consultation processes, you have your list of submissions and you can see what other people are saying, and it's very easy to do so.
Senator, what I'll do is I'll commit to go back and have a look and see what we can do.
Okay, thank you. Thanks, Jeff.
Thanks very much. So that brings us to the end of Outcome 1, and officials in relation to those programs can be released, and we'll move on to Outcome 2, Families and Communities, and I'll go to Senator Grogan.
I wanted to talk about the Strong and Resilient Communities grants. Give a moment for the right people to...
Liz Heffernan, Deputy Secretary, Families and Communities.
Now, the Strong and Resilient Communities grants, the measure is 45.1 million over 4 years. Is that right?
That's the correct amount. I believe it's over 2 years.
2 years, not 4.
What page are you on, Senator?
That would be 168.
Okay.
Which basically...
Yeah, for over 4 years. Yeah, the government will provide 45.1 million over 4 years.
Apologies, 4 years.
Yeah, cool. Lovely. And that's beginning 21-22?
That's correct.
So can you tell me what the funding criteria is for these grants?
So there are grant opportunity guidelines for the Strong and Resilient Communities grants, which are available on our website.
So are they on your website now?
I'll just check with my colleague Mr Burford. So we've just recently run around. There was a call for applications last year under the same grant program because there's an existing funding for this grant program ongoing. This is a supplementary amount. I'll just check whether the guidelines are on our website currently.
Patrick Burford, Group Manager, Communities, Senator. Good afternoon. Regarding the previous round, there are grant guidelines that have been published on the website. The allocation that's published in the budget, no such grant guidelines exist yet. That will have to be developed and briefed to government for a government decision.
Okay, so that money's running out in 21-22, starting in 21-22. So how long is it going to take you to develop those guidelines? Are they going to be the same, or are they going to be? Is there a variation on the intent of the program?
So it's the same program. So the guidelines will essentially be, very similar to the guidelines we've used for this program in the past, but there may be some specific tailoring.
Yeah, I guess because there's money being put into this. Is there a new target or a new variation, or you're not sure?
Senator,
it's going to run the same as it has previously. Just are there any changes?
I just wanted to clarify, Senator, that the actual current grant that has been concluded, that'll run out to the end of, to mid-2024. So the round that's just been run has allocation that takes funding out to 2024, which gives us time to develop guidelines for the next round that's reflected in those dollars that's published in the budget papers.
Right, so I think I just got more confused there.
Sorry.
I think so. You have a program currently, and you're saying that the current program runs out to 2024, and then there's an extra 45.1 been put into the same program to run over 4 years to 2026.
It starts in 2021-22, so yes. 20.
So is it money being put into the same program, or is it additional money into a sort of parallel program, and are there different guidelines?
So they'll be the same general guidelines. So for the program, so Strong and Resilient Communities program, in the past it's had a number of different streams within it. It's had an inclusive community stream, it's had a resilient community stream, it's had a research stream. So it will be the same overarching guidelines, but there may be some specific aspects of new guidelines for this component of the funding. That has not been settled yet.
Okay, and what do you think the time frame will be to get that done?
We're working on that now, Senator. So we'll be providing advice to the Minister shortly.
So days, weeks, months? Any idea?
Weeks, days.
Days. Okay. Minutes. And so the number of grants is nominated 120?
That's the estimate, yeah.
That's the estimate. So so maybe you can reflect on previous rounds. Is there a general sense of the kind of quantum per grant? I mean, obviously in some programs we see the grants being of a very, very similar value, and in other programs you would see them being quite variable depending on what they're actually for. Do you have a sense that they would be around a particular number?
The current project, Senator, average around 180,000, up to 180,000 per year, with a maximum grant amount of $360,000.
Okay, so that's the current. You would anticipate to be similar for the new money?
Yeah, yep. So it was based on that we estimated around 120 grants could be covered by that allocation in the budget papers.
Okay, so yeah, because there's no profile there, so I guess I'm just trying to understand whether this is going to be like a quick fire round, or whether it's, you're in no rush, you've got 4 years, you've already got a grant program running. Just trying to understand what the sort of perspective, given that you've said that you could be providing advice in days, it would indicate that it's more of a quick fire scenario.
We'll provide some advice to the Minister, and she would make a decision about how we structure process for these grants.
Indeed. I guess what I'm saying is there's no profile in the papers, so I'm just trying to understand.
As I understand it, the funding was allocated in the additional estimates process, so that's why there's no profile in this funding, in this book.
That doesn't make... can you explain that a little?
So if you look at the measure, there's no figures in the years.
That's my point.
Yes, because the funding was already allocated in the portfolio additional estimates process.
Oh, so was it a decision taken, not announced? Is that what you're saying?
It was allocated in the portfolio additional estimates.
But if it was allocated in additional estimate, if it was allocated clearly, then obviously the allocation would have been spread across the years. I guess what I'm saying is, was it one of the scenarios where it's been a decision taken, not announced, therefore it didn't have a profile?
I'll take that on notice, Senator.
Yeah, I mean, happy to go back and have a look at the additional estimates information and provide it to me. Just it's not in here and we don't have a
No.
Yeah, sure, happy to do that.
Indeed. It seems kind of curious. It's a grant program.
It's just the way Treasury and Finance requires it to be written because of the nature of it having previously been allocated by a different process. But we will get that information for you so that...
Thank you.
I get as confused on these papers as anyone.
Okay. I guess are you intending to try and roll out some of this money to... Is it going to be a whole new grant round? Will there be a whole new set of applications? Or will you be...
Sorry, Senator.
Or will you be potentially funding other things that have already been applied for that maybe didn't make it through your first round?
Those are the types of options that we'll be providing to the Minister for her decision. There's a number of ways that grants are, as you would well know,
Indeed.
Arranged. We sometimes have an open competitive round. We sometimes have a targeted round where we directly approach certain people. We sometimes have ad hoc, rounds where there's a specific need and a specific purpose. The guidelines enable the different types of approaches. And so the Minister will be making a decision about which approach.
So from where we are at the moment, it could be that the Minister signed off on a bunch of grants and they were announced prior to caretaker on next Tuesday, or we could be in a situation where you put out a whole new expression of interest and you could be maybe not dispersing the money until the end of the year. And you've got no sense of what that looks like at all.
What I'm saying is that that's a decision for the Minister and no decision's been made as yet.
Right.
So.
And no sense of the profile in the budget.
We said we'd take that notice for you.
Yeah.
Senator, I can share with you what the current program, the broad objectives are of the existing grant program process that we're considering the applications for, if that's helpful, because that might give a bit of an indication of the sorts of things that might be part of our briefing to the Minister. So they're one-off time-limited community projects that support the development of young people aged 12 to 18 who are or are at risk of being disadvantaged, marginalised or having engagement with limited engagement with education and training, people with disabilities and or mental health issues to participate in their community and work towards becoming and or remaining independent and engaged, vulnerable women who are or at risk of isolation or discrimination to participate in their community and increase their sense of self-agency and empowerment, people who are unemployed to address individual barriers to employment and increase their capacity to engage with existing employment training or training services or working towards gaining employment. It's quite a broad range of criteria there and what the sort of things, but again, the tenet of it is about vulnerable and disadvantaged people on a pathway to self-reliance and empowerment through local community-driven proposals.
So, yeah, it would be good to understand the finance issue around it was announced it was an additional estimate, so therefore it's not required to have a profile. I'm failing to understand that. So, if you could get some clarity on that for me, I'd be really grateful to understand how it's going to roll out. It's 45 million. It should have a profile, or maybe we will be seeing it all announced next week. Who knows? But it would be good to understand that. Thank you.
That's at the end of your group of questions. Thank you. Senator Rice?
Thank you. Okay, hold on. I wanted to follow up on the questions I asked at last estimates about the monitoring and evaluation framework for the cashless debit card. So, look, I had a question on notice where you forwarded me the answer to a question on notice that former Senator Seaworth had asked in 2019, so 3 years ago. So what I'd specifically asked for was the specific monitoring and evaluation framework of the cashless debit card for the Northern Territory. There was nothing in that 3-year-old cashless debit card program monitoring framework that talks about specific monitoring and evaluation framework for specific program areas. So can I get some more information, please, about the subcomponents?
Can I just seek clarification about exactly what you're asking, Senator Rice? So you were talking about the Northern Territory?
Yes.
And the cashless debit card?
Yes.
Well, that would not have been relevant 3 years ago.
No, but there has been a commitment to have specific monitoring and evaluation frameworks for specific program areas. So I was asking specifically whether there was a monitoring and evaluation framework now that we had the cashless debit card in the Northern Territory for the Northern Territory. All I got given was the 3-year-old overarching monitoring and evaluation framework. So it basically did not go to my question about what the monitoring and evaluation framework for the rollout of the cashless debit card in the Northern Territory is.
So,
thank you.
Senator, the reason we provided that document is because that's the framework for all cashless debit card sites.
Yep.
So we don't develop a separate framework for every jurisdiction or site. We use a consistent monitoring and evaluation framework for all sites. Obviously, within that, we collect data specific to the Northern Territory, but the evaluation of particular sites is the principles of the evaluation or the methodology or the kind of objectives will be drawn from that overarching framework.
I mean, last estimates you told me that there would be subcomponents that related to all program areas. So
yeah.
we've got a different version. We've got the cashless debit card in the Northern Territory being rolled out by the TCU. And so you're saying you haven't got anything more specific in terms of evaluating how that's going beyond what is in your overarching framework?
Well, the overarching framework sets the framework.
Yep.
Within that, we are undertaking a number of data collection activities, which I'm happy to provide you on notice a list of the data collection activities.
And are they data collection activities to meet your performance indicators in that overarching framework?
Correct, yes.
So to meet...
As well as to undertake other responsibilities we have around monitoring contract performance, etc., for, say, Inju and the TCU. So...
Okay, well, if you could get me those additional ones, because I'm presuming that if they're the only monitoring indicators then, or the only performance indicators that you are collecting data for, as per this 3-year-old overarching framework.
I will provide you with detail of the data, the detailed data collection we're undertaking.
But is there anything more specific beyond what's in this framework? So we've got, the performance indicators about the percentage of numbers of cards have been activated, hotline phone calls, communication products accessible to the community, no successful transactions made at merchants who primarily sell alcohol gambling products, the list of them. So
I don't... so that's a list of... that's in a framework. and that informs the data collection that we do. But there may be additional items we're collecting that go beyond that.
Well, that's what I want to know. And how are you deciding then what are those additional items? Have you got a particular sub-strategy for monitoring and evaluation for the rollout of the CDC in the Northern Territory that would inform what additional data you need to collect?
Well, it's a combination of different documents, I would say. A data analysis framework, a set of performance indicators. Those documents may be commercial in confidence, so we will have to take on notice what we can provide.
Well, it would be good to get that information because that was what I was asking for at last estimates when I got given a 3-year-old overarching framework that didn't go to my question at all. So I would appreciate getting that further information about what you are monitoring for in terms of the rollout of the CDC in the Northern Territory.
Sure, we're happy to provide a list of data items.
Will it go to some of the, looking at this overarching framework, there's a list of potential spillover benefits and potential adverse consequences, which the overarching framework specifically notes that while both potential spillover benefits and adverse consequences will be measured as part of the evaluation, they are not performance indicators. So are you measuring, those things are in these dot points? As part of the Northern Territory rollout?
So we're collecting data on a number of items, and as I've said, I'll provide those items to you. Should we commission a specific external evaluation of the rollout in the NT, there may be additional matters, additional kind of ways of collecting data that also go to those. So you be aware the evaluation that was undertaken of the first 3 trial sites included a very widespread survey. It also included kind of a questionnaire. So we haven't initiated that type of activity in the NT, but potentially, as you say, it's in the evaluation framework, so in the longer term that might be.
So you haven't initiated it, yet you've got quite a different community that you're rolling it out. It's being rolled out by a different organisation, and as yet you haven't commissioned a specific evaluation.
No specific evaluation of the Northern Territory has been commissioned, that's correct.
So is that under consideration?
So Senator, you'd be aware that the legislation relating to the cashless debit card in the Northern Territory passed in December 2020 for a 2-year period. So timing of an evaluation is partly a bit dependent on progress of evaluation, and evaluations generally take a number of months, and in fact some have taken over a year because of the sensitivity of the client group, the need to get proper ethics approval, the need to undertake remote travel, to have translators, etc. It's a significant, it would be a significant cost and a significant undertaking to commence an evaluation. And as you know, the rollout was affected by COVID as well, our ability to travel, etc.
My understanding of best practice evaluation is basically you have a good framework for your evaluation from the beginning of the rollout of a project.
So we have an evaluation framework. We have an evaluation framework that we've provided you on.
But that's the overarching one. We're talking about the particular rollout of the cashless debit card in the Northern Territory by the traditional credit union, which has got a number of specific differences compared with how it's been rolled out before.
So if there is a decision to commence an evaluation of the cashless debit card in the Northern Territory, we will develop a specific evaluation framework for that specific evaluation. But I don't have a specific evaluation framework yet because there's been no decision to undertake a specific evaluation.
But it means, for example, that you're not having a good considered information about what data you should be collecting right now.
We're casting a very wide net on the data we're collecting, and we're in conversations with the Northern Territory Government to boost that data.
Could I go through, in the overarching framework, when we're the little table of the potential adverse consequences, are you collecting data relating to each of those? Let's go through them. Reported practical difficulties using the card.
Senator Ross, I'm just wondering, do you actually know what's going on with the cashless debit card in the Northern Territory and the process that we
I know that it's being rolled out, and I know
Yeah,
that
but do you
I'm
know-
having a
but-
conversation with
No,
Ms.
Senator,
Ms.
the
Heffron-Webb.
reason I ask is the cashless debit card is being offered voluntarily to people in the Northern Territory if they wish to go onto the card. And it is predominantly seeking those people that are actually currently on the basics card.
Mm-hmm.
So
Well, but it's being rolled out. It's a different program, and it's being offered voluntarily to people who are on the basics card. Obviously, it is an income management card, regardless, and they're moving from one income management card to another.
They're being offered the opportunity to.
Yes, but I don't think you can quite say it's being offered voluntarily.
Well,
if they're already on one income management card, they're getting a voluntary option of moving on to another one.
Well, yes, but you're talking about the cashless debit card, Senator Rice, and so I just want to be really clear. The legislation that was passed in the Parliament last year provided for the opportunity for people in the Northern Territory who were on income management to have the choice of being able to go into the cashless debit card because of its hugely advanced functionality and benefit. So I just wanted to make sure that that's what we were talking about.
I mean, for those, let's then talk about whether, people's experience, obviously that evaluation framework probably would have to cover their experiences on the basics card as well as their experiences on the cashless debit card.
But that's not what you're asking.
Well, I mean, I think any evaluation framework would do that if it's a choice and you're basically trying to make a decision as to whether it's a better experience for people. So, Ms. Heffron-Webb, can I go back to the question of whether you've got, of the dot points that are listed in your evaluation framework of, I started saying reported practical difficulties, reported extent of negative financial control consequences, reported feelings of shame or experience of exclusion, reported street begging, humbugging, harassment, abuse or intimidation by others, reported increases in product pricing, merchants imposing minimum purchase requirements or surcharges, incidents of privacy breaches, stolen cards or skimming, and reported circumvention behaviours. Are you collecting data on all of those?
We're collecting data on a number of those, Senator.
Which ones can you tell me which ones then, please, and which ones you're not?
Mr Burford, can you?
Take that on notice, Senator, to get the specifics about which of those ones we are, because we are in constant conversations with colleagues at Services Australia about what access to data they've got, plus the INJU and TCU about their transactional data, plus also Northern Territory Government about some of those social impacts that they are the holders of the data for as well. Again, that's
so you're not
administrative data set.
You're not able to give me any information about that? I mean, obviously Ms Heffron-Webb knew that you were collecting some and not others. You must have some...
I'd have to confirm which ones we are. I don't want to mislead you in terms of which ones we do currently have. So I would have to take that on notice, Senator.
Okay. Look, I will quickly ask some questions about the basics card, Minister. It's still your position that people who are on the basics card who leave the location where it's, that relevant location where it has been issued still have to stay on the card?
That's my understanding, yes.
Yes, that's correct.
And so even if it makes it harder for them to find secure housing in that other location?
So the basics card program, which is income management, as you know, Services Australia provides support to people to set up housing arrangements and housing deductions. So if they can assist if people move to change their housing arrangements and their housing deductions.
Yes, I understand that, and we've shared a specific instance with your office, Minister, of an individual who's been denied accommodation because they're paying with the basics card, and we've been told that Services Australia have been in contact with this constituent on several occasions, and the social worker and community engagement officer have offered support to the constituent. It doesn't help them that they've been denied accommodation because they're having to pay with the basics card and that they can't pay for their rent in cash.
So my understanding, Senator Rice, and I'm not sure whether it's been communicated back to your office, that the specific matter that you're talking to has been resolved to your constituents' satisfaction. But I mean, obviously I don't want to name the constituent, and I'm sure you don't want to either, but Yeah, I'm assuming we're talking about the same thing, the same
So
person?
what, do you understand that they're now in housing? They have been helped?
Well, I have been, the issue that was raised and the problem that this particular constituent that you raised the issue with my office, that the matter has been resolved to the constituent's satisfaction is my advice, but I'm happy to take it offline with you, Senator.
Not the advice that I have, but maybe there has been something that's, more up to date than what I've got. But certainly, this person has told me that they've ended up being homeless on a number of occasions because they haven't been able to secure housing because they've been required to stay on the basics card.
My understanding is that they have been, that the matter has been resolved, they have been supported in their access to housing, but I'm happy to talk to you offline because I don't wish to discuss the individual details of a particular case, as you would probably respect. But as I said, my understanding is the matter has been resolved to your constituent satisfaction, but if there's further issues you'd like to discuss, I'm happy to discuss, but not in camera, out of camera.
Just one last question, which is, since they've taken on this portfolio, that people's issues with income management, these cards, so many people have come to me with issues they're having with them, that they've found them, that basically these cards have had a terrible impact on their lives. What's your response to people like this constituent, but many others, who have found the impact of being required to be on an income management card has been an incredible impost on them?
Well, Senator, as I always offered to your predecessor in this portfolio, Senator Siewert, if there are ever any issues that are brought to your attention around individuals that we can assist with, we're more than happy to do so. In terms of the basics card, one of the reasons that we sought to offer people on the basics card the opportunity to access the cashless debit card was because of its extraordinary advanced functionality, which operates just like any other key card that you or I would have in our wallets, with the exception of being able to buy alcohol and gambling products. So, certainly we're more than happy to work with your office in good faith, as we did with Senator Siewert, to resolve any of the issues that come
there are
forward.
the individual issues, but then it goes to the overall overarching evaluation of whether these cards are a good thing. And it's pretty clear that from so many people's perspectives, they're not. Thank you.
Certainly in relation to the 4 cashless debit card trial sites, as you would have been aware when we sought to pass the legislation last year, the very strong support, particularly from community leaders, around the benefits of the card had offered their communities. But from an overarching perspective, but as I said,
what
my
data
door
you're
is open.
collecting, doesn't it? Thank you.
Senator Urquhart's got a follow-up question.
Just to follow up, Ms Heffernan-Webb, in relation to the question asked by Senator Grogan around the Strong and Resilient Community grants, you indicated that there had been dollar allocations in portfolio additional estimates. Can you just point me to where that is? Because I just was unable to find it.
I don't have my, additional estimates document with me. I've only got the budget one.
Yep.
I might have to ask if any of my colleagues have. It would
or maybe if someone could get that for us before,
Sure.
During the course of the afternoon, that would be helpful.
Yeah, sure.
Okay, thank you. Thanks.
Right, Senator McAllister.
Thanks very much.
There you go, easy peasy.
Hello, everybody. Minister, thanks very much for the information that you provided earlier. I do want to have a discussion about it in the estimates process, so I thought I might table some of the materials for the benefit of other senators. So, Chair, just to explain. Yes?
Sorry, I gave it to your team, and so the Secretary had a copy, so I think everyone has actually got
Oh, so it has been tabled?
Is this the one?
Well, no, I was waiting for you to decide whether you wanted to table it.
Oh, that's very kind of you. Thanks, Minister. Okay, so I might table the letter that I wrote to the Minister. I've got multiple copies. I'll keep one for me. I'll also now table the document that the Minister provided in response to that. And I'd also like to table a document that was provided by the department to this committee this time last year, which was in response to a very similar information request. So 3 documents in total. I'll just leave that with you, Chair, until you're happy with all of that.
So there's 2 pages there from 2022.
Yes, and there's a third document on its way round, which is the document from budget estimates this time last year.
All right.
Yeah, okay. Two to three blocks. Is that what you're expecting? Most of them have an expectation. Right. Oh, yeah.
I didn't realise you were the Cabinet Secretary.
Oh, a new discovery at every estimate stage.
So when was this letter given to the Minister? Today, by the look of it?
Only today, and the Minister very kindly responded to it today, but I did just want to give her and the department advance warning about what I was seeking to discuss.
Yeah, Senator, and as I responded to you, I quickly pulled this together because this particular budget statement has been quite complicated in trying to make sure that we dealt with other agencies, making sure that we brought to account the complexity of making sure that the different funding to make sure that we really had focused on getting a package together for women's safety. So it was more complicated or complex than being able to just do it straight away. But as I said to you in my response to you, I will certainly try and get that information to you as quickly as possible.
Oh, okay. So I have a couple of particular questions I'd like to ask about from the department. Can I start with the page that goes to the measures that are within the complete responsibility of DSS, because I understand that's probably the most easy to unpack. Is it correct that this DSS total of 919.1 million relates to a 6-year period, not the forward estimates?
The reason it relates to a longer, the 6 years, is I think there is some weird small amount of money in 21, 22. I think Ms Heffron might be able to tell you what that is. It's actually, it coincides with the 5 years of the first 5-year action plan for the national plan, but this extra year, I'll let Ms Heffron explain the specifics of that.
So, Senator, it also includes 40 million in this financial year for the escaping violence payment to supplement due to higher than expected demand.
Right, yeah, but I suppose the particular thing I'm trying to just confirm is that when I add up on budget paper 2 on page 66, I look at the payments to be made to DSS and they add up to 778.4 million, but this table adds up to 919.1. I'm assuming that that's because there is an extra year beyond the forwards and that this table incorporates information about 26, 27.
Correct. So we've got
Great.
40 million that Ms Heffron just referred to, and some ongoing funding that goes through to the 5 years on some of the programs, which is the information that obviously I understand you're looking for.
Yeah, okay. I had asked from you, Minister, information about the profiling of each of these measures, at least across the forwards, and you've provided me a total investment number across a 6-year period. Is there a reason that the department can't provide information about how this is to be expended across the forward estimates?
Well, it's not so much that, it's just that in order to give you a clear picture, I was not able to do it in the last couple of hours. But that I'm more than happy, as I said to you, to provide you with additional information, but obviously it just needs a bit more work than we were able to do today.
Okay, so
I'm saying I'm not giving it to you, I just wasn't able to do it in the last couple of hours.
Yes. Can I ask you, I'm just having a little trouble hearing, sorry, 'cause between... Okay, so I suppose we're going into an election period. It's very likely that there won't be another opportunity to get information from the department prior to an election. Women's safety is a key focus for many citizens, and I would like to understand the profiling for the measures that are in the budget paper. I recognise the time constraints, Minister, although I did ask you about this earlier in the week.
I thought you asked me for a briefing earlier in the week, and which is so equally happy for that to happen.
Yeah, okay. Well, I wonder then, right, so I wonder then if there's a way that we could manage this, given I think you are willing to provide me this information. I wonder if we could have a commitment that you might provide it to me or to the committee by way of letter by Monday or Tuesday, rather than having a big argument about it now.
Yeah, no, certainly. I'm not seeking to have an argument, and I'm not seeking to hide anything or pretend. I'm more than happy to take to get this information to you as quickly as possible. There's no intention here.
Right, so by letter to the committee by Tuesday?
I'll do my very best, Senator, but certainly I will.
Yeah, I mean, I feel quite certain someone who's responsible for the department, possibly Mr Bennett, does have a sense of the profiling of these measures. Surely, Mr Bennett.
Well, as I said, Senator, I'm more than happy to do that. The other thing I'd be really keen to do, because as you'll see from the profiling, as the 22-23 has got a number of measures that that are still ongoing from current programs. They're measures from the 4th action plan that some of them are still on foot. They're also ongoing measures. So I just wanted to make sure that I give you the full picture, because I mean the clarity around the measures that exist in that 5-year action plan that we're seeking to provide the predominant amount of funding for. Here, it goes past the end of the forwards because of that 5-year envelope around that 5-year action plan. So I just wanted to make sure that what I provided you with was really clear for you to understand what the whole sort of package of that that $2.5 billion that is the commitment to the 5-year action plan.
Can I ask for something rather narrower though? What I'm looking for is an understanding of the measures in budget paper 2.
Yeah, no,
I appreciate that it's possible to aggregate those with measures that were announced in previous budgets, but what I'm specifically looking for, so we don't have any misunderstanding, is the profiling of the measures that are listed in the text in budget paper 2 on pages 66, 67, 68 and 69. I appreciate that they interact in complex ways with announcements previously made, but I don't want them aggregated together.
No,
I'm just looking for a single explanation of the budget paper.
I hear what you're saying. Absolutely.
Okay. And I'd like to have it, if it's possible, the profiling for both the measures that DSS will be administering, but also the measures in the budget paper that are administered by other agencies, as I assume you are coordinating them across the plan.
Yep. I hear exactly what you're asking for, Senator.
2 more questions about the finances. In budget paper 3, I note that on page 49, the payments to the states and territories list for the National Partnership Agreement are listed as being 0 in the 23, 24 and 24, 25. Is it the government's intention to reduce the funding of the National Partnership Agreement to 0 in those years?
Well, Senator, the funding's ongoing, as you know, to 2023. And then we would obviously seek to renegotiate with the states and territories during that time.
Right, but based on just assuming, even without indexation, a similar level of funding to states and territories over the first 2 years of the partnership, that's then $270 million that could reasonably be expected to be in the national plan funding, but is not in the budget.
It is obviously a matter for further negotiation. The funding that's contained in the women's safety package
is in addition, or it's not included. It's a matter for decisions at another time.
Right. Is it the government's intention, though, that it dropped to zero?
Well, Senator has said it's a matter for negotiations with the states and territories around, how we work as we go forward in the implementation, not just of the initiatives and the actions that the federal government has committed to in relation to the next national plan to end violence against women and children, but also in relation to the states and territories, and so we've still got more work to do in relation to discussions and consultation with women's safety ministers from the states and territories to make sure that all areas of government work together so that we've got an extremely coordinated approach to the various elements that make up the support that various governments give to DV, which is one of the main roles of the DV Commission. And Commissioner will be around making sure that when we collect all of the resources that are being put forward, that we are making sure that we, collectively between all levels of government are providing the kind of support that needs to be provided to ensure that we are providing the support that unfortunately so many Australian women require as they're escaping violence.
I did do a brief exercise of adding the commitments that were made year by year in the last budget to the commitments made year by year in this budget. And by my calculation, in the next financial year, just after an election, the funding for women's safety peaks at 622 million, adding the two sets of measures together. But by the out years, that almost halves to 312 million.
Look, I'm going to have to obviously to take that on notice and get you the exact figures. But what I would say is that there are a number of measures that are in here, some of which sit within the DSS portfolio and some that sit in other portfolio areas. And there is, there is every possibility in relation to, as we go forward, that there will be other new measures that are added as they see fit going forward. This was, a set of measures that have been agreed to date, but as I said, subsequently there are further negotiations to be had with the states and territories, and there are a number of things that obviously will happen over the duration of the 5-year plan. It's not started today and nothing changes going forward. I mean, clearly over the 5-year period there will be much opportunity for negotiation to make sure that the measures that are included in the plan and the various plans of the states and territories meet the needs on the ground, both throughout the whole process, whether it be prevention, early intervention, response and recovery. I mean, clearly, as you would have seen from much of the early announcements around this, the federal government is taking a very, very strong role in leadership around prevention and early intervention, which I know that you have been calling for, as many others have, about actually stopping it before it starts. But this is a women's safety package that recognises that there are those 4 pillars, but it also recognises that we've got much more work to do with the states and territories around combining our various programs as well.
Okay, so you are undertaking to get by letter to the committee the profiling by Monday or Tuesday next week.
As I said, as soon as I possibly can, I will.
I will say, Minister, I'm happy to defer it. I'm not happy to defer it indefinitely because, as you know, it's quite possible that the Prime Minister may choose to call an election. Everybody knows that that's on the cards. We'd be naive to think it wasn't. Sure. And to be honest, I do think that a department should come to estimates in a position to explain the profiling of a measure that's in Budget Paper 2. I don't think that is an unreasonable expectation in an estimates period. In fact, it's very ordinary. Any department I've ever asked has been able to tell me.
Look, Senator, I absolutely hear what you're asking for. I make no that, but what I would say, this is one of the, this is a historic commitment to women's safety. and I will, absolutely. We are as a government, have a very strong track record of commitment to supporting women and children who find themselves in violent situations. So, I think our record speaks for itself. Very strong commitment, another $1.3 billion across the government now, on top of the $1.1 billion plus other measures that are ongoing. A $2.5 billion commitment over the initial commitment over the 5 years of the first 5-year action plan, I think is a pretty strong commitment.
Mr Griggs, is this a task the department's capable of undertaking?
Providing you the information, yes, Senator.
All right. Well,
we will get it to you as soon as possible.
I think it would be reasonable to give me a time. To be quite frank, it would be reasonable for me to insist that it be provided this evening. I think it would be helpful, Minister, if you were able to indicate a time next week when you were willing to provide the information to me and to the committee.
Can I seek to get back to you tonight with a time frame? I'm not suggesting for a minute that what you're asking for is unreasonable. I'm not. I just don't want to say to you, I'm going to give it to you at a certain time and then not do it. I will commit. If I make a commitment to you, I will meet that commitment. So can you just give me an hour or so, and I'll see what I can come back with in terms of what is able to be provided and when.
Thanks. Just on the question of another national partnership agreement, and you may. The ERO supplementation for the Housing and Homelessness National Partnership Agreement expires in 2023, and there's no extension in the budget for that, is there?
The extension of the ERO in the budget for the 2 years was so that the ERO coincided with the negotiation on the next National Housing and Homelessness Agreement, and so we spoke with the states and territories. And so our expectation is that the next negotiation of the NAHA will be incorporated in that. So that was why we had 2 years of the ERO, was because of the ERO had actually ended to 2 years prior to the expiry of the current NAHA, which is in the process of being renegotiated. In fact, I think there's currently a PC inquiry. Yeah. Yep.
So what can you tell us about the approach to wages and the cost drivers associated with wages and equal pay as part of the NAHA agreement?
The NAHA agreement sits with Minister Sukkar, but I'm wondering if any of...
So, Senator, what I can say is, as the Minister has indicated, the government, as you are aware, provided extra funding for the 2 additional years that were originally in the NAHA as subject to further negotiation. The Minister wrote to all states outlining the offer for that additional funding, and in that the Minister made it very clear, as she just said in her answer now, that beyond the current 2023, that will be a matter of negotiations between the Commonwealth and the states in the broader context of those NAHA negotiations that the Minister just pointed out. And I would like to take the opportunity to say, as of yesterday, Queensland has signed the agreement for the last bit of funding, so the last state to get that 120 odd million, so all states have signed up to those conditions to get the additional SACS funding for the 2 years, as the Minister outlined. So that will be being paid out shortly, back paid to July 2021.
Right, okay. So, obviously the discussion is about whether the additional resources required to meet the wage requirement for equal pay is set aside as a separate pool or incorporated into the base funding for grants. I wonder if the Commonwealth has a view about the preferred approach on that question.
No, it would be subject to the negotiation with the states and territories on the next agreement, I would suggest, Senator.
And I'd also say, Senator, as the Minister, I think, was indicating, the Productivity Commission is doing a review into the NAHA as we speak.
Minister, in the context of the budget measures, we talked a bit about the national plan. The national plan is yet to be finalised. That's right, isn't it?
Yes.
The sequencing is unusual. So there's a series of commitments here. How do those commitments relate to the national plan?
Well, obviously, through the consultation process, we worked with a huge amount of people in terms of the design of the plan. The plan now is in its, I suppose, its final last draft form, for the want of a better term. It's with the state and territory. Is it with the state and territory? Is it the advisory group? Yep.
So it's been sent to the state territory ministers, the latest draft.
Yep, as well as the advisory group and the Aboriginal and Torres Strait Islander Advisory Council for them to be to finalise. And once we've had the opportunity, they've had the time to have a look at it, we will meet hopefully very shortly, because of course the states and territories equally are working through their budgetary processes about what they're going to put in place. So the initiatives that are contained in the budget this time in relation to responding to family, domestic and sexual violence reflect the final draft plan recommendations.
Right. So what is your expectation about finalising the national plan?
Well, as I said, the plan has gone to states and territory.
About the timing?
Well, we obviously, the timeline that we must meet is the 1st of July 2022. Although I would add to that the measures that sit within the federal government's purview in the action plan are committed to regardless. I mean, these are a formal commitment as part of the budget process. But we are very keen for the states and territories to do similarly. Obviously, South Australia went to an election last week, so we've got a new minister, or actually two new ministers that relate to this particular issue in South Australia that are getting up to speed. But our expectation is that we will be able to get it, hopefully get an approval from the states and territory women's safety ministers to enable it to be formally released in its absolute final form, so that the states and territories can make their commitments in relation to their actions as soon as possible.
Again, we made really on the eve of an election. Do you expect that the national plan will be finalised prior to calling an election?
Well, in the absence of knowing when the election's going to be called, I can't actually answer that question. But obviously we are working as hard as we can to make sure that this is approved by the state and territory women's safety ministers as quickly as possible.
But if it's not signed off before the election, then effectively from a Commonwealth perspective, decision making on that question holds, does it not?
It would be a matter for the
during the caretaker period, it can't be progressed. That's correct, isn't it?
Well, I mean, without bipartisan support,
right,
Senator. I mean, obviously, as soon as we go into caretaker mode, the provisions of caretaker come into effect, and we would operate within the conventions of that caretaker, which would mean that we would have to seek bipartisan support for us to be able to move forward.
Right, and have you sought advice from the department about how the caretaker conventions would interact with that process?
Well, obviously, I am aware that, in the advice that I've received from the department and my knowledge of caretaker conventions is the fact that anything that we would do of this substance would require bipartisan support.
Right. Is it your intention to finalise it during the caretaker period?
That is not my intention. My intention has always been to finalise it before, so that we were able to get the document out into the public as soon as possible. Obviously, the draft has been circulated and was available for comment for quite some time. But as soon as we are able to get the states and territory ministers together, hopefully we'll be able to do that before the election's called. But as I said, if it's not possible, we will operate within those conventions.
Senator, I might just add that, so we had the draft out for consultation. We received a very high number of comments. We have refined the draft on the basis of those comments and, as the Minister said, provided it to the National Plan Advisory Group, the Aboriginal Torres Strait Islander Advisory Council and the States and Territories. We've held 2 meetings with the National Plan Advisory Group to get all their feedback again. We have a meeting with the Aboriginal Torres Strait Islander Advisory Group on Monday, and we had a meeting with the senior officials in States and Territories last Monday. So we are pushing and meeting as much as possible, and everyone has obviously great commitment to finalising the document.
When will the national action plans be finalised?
So, I mean, we haven't announced a specific timeframe for the action plans. Obviously, there's 2. So the Aboriginal Torres Strait Islander Advisory Council are working on the Aboriginal Torres Strait Islander Action Plan. They have had a extensive workshop last December. We're meeting again with them next week. It's beginning to take shape, but they may wish to do some more consultation. In terms of the other action plan, once we've got this national plan kind of finalised, we'll be working with states and territories on the action plan. Obviously, the government's announced its measures that will sit under the action plan, but states and territories will be considering what actions they wish to fund, and then we'll also be looking at what other matters, you know, that may not require funding but are work we can do together. So that will be happening over coming months.
Right, so months until we get a national action plan, but we have the Commonwealth's commitments finalised in a budget sort of before we get to a coordinated action plan with the states and territories.
So the Commonwealth's commitments, as the Minister said, follow the structure of the national plan very closely. So through the 4 pillars, there's nothing in the Commonwealth's commitments that won't sit well comfortably within an action plan. Obviously, we've been working in parallel, but there may be additional actions that come forth through consultation or through discussions with states and territories that come into a finalised action plan.
Right. And I note that you've tabled, or you've published, finally, a report from Monash in relation to consultation today. Is there any further material from Monash that is to be published?
So there's, Monash provided 2 reports.
And one of them has been published?
Correct.
Why hasn't it been possible to publish the second? Well, why has it taken so long to publish this one, and why hasn't it been possible to publish the second one?
So, Minister, as I think we discussed last time, we received the drafts. We had a number of comments on the drafts. We were working with Monash. Then we were undertaking detailed analysis of the reports and to make sure all matters that had been discussed had been picked up in our revised national plan. We provided a briefing to the Minister last month on the 2 reports, and a report's been released today.
So will there be a second report released?
No decision's been made on that, Senator.
Minister, why has only one report been released when 2 were provided?
My understanding is that there was further work being done. Well, there was a lot of work done on both plans for a number of both reports. Sorry, for a number of reasons, and I'm unaware of the finalisation of the other report.
Is it your intention to release both reports, Minister?
Can I take that on notice? I mean, I'm not sure. I mean, obviously, these reports. I mean, this was not the only piece of information that went into the reports. I understand there was also some sensitivities around comments from victim survivors and the like and the sensitivity around that. So I might just take that on notice and respond to you as soon as possible on that, because I myself am not sure.
Okay. Well, Minister, we just are in a situation where this process has been very, very slow. It's the end of a 12-year plan. It's about to run out. You have delayed and delayed and delayed the consultation reports, and still today only one of the two reports has been published. We don't have a final action plan, but we do have a whole suite of measures which may or may not relate to the plan. Victim survivors have been very upset that their material hasn't been in the public domain for discussion as part of the process of finalising the plan. But your position is that the government's got a terrific track record on tackling domestic and family violence. I actually just find this very disappointing, and I think that there's so much we could do as a community if we just took this seriously. And I struggle to understand how we can be just a few months before the expiry of a 12-month program of activity, a 12-year program of activity, and we still don't have a finalised package of measures to roll out in July.
Well, Senator, I'll make a number of comments. The first one is, I can absolutely assure you, no one takes this issue more seriously than I do, and so I'd ask you to reflect on your comment that I don't take it seriously. I can assure you I do.
I was asking about the government, actually, and that's my concern.
It's my responsibility within the government, and I can assure you, and I think you believe me, that I take this issue very, very seriously. So, you know, I would put that on the record. Also, I would put on the record that, you know, no government has made a bigger investment in women's safety than the government of which I am a member of. I would also say that, you know, this has been a really complex process. You know, we started this consultation and then we got hit by COVID. We've tried to be as sensitive as we possibly can be. We have tried to be as inclusive as we possibly can be. We have consulted as widely as possible. And, you know, whilst we've tried to speed things up, we've also been really, really conscious of the fact that, you know, in some instances it's better to let things take a little bit longer to make sure that people have the opportunity to be able to have input in various ways. So I can assure you, Senator, we have worked as fast as we could to be able to deliver this plan under some very difficult circumstances, but in doing so making sure that we gave everybody who wanted to have an involvement in the development of this plan the opportunity to do so.
Chair, I've got another block of questions about a different matter, so it might be sense. I've had a long sequence of questions to the Minister, so you should feel free to share the
I'm
call.
just conscious that you're actually wrapping up and we were hoping to move into the next outcome before dinner, so that was, yeah.
Oh, it's just me.
Yes,
well, let me ask these questions very quickly
and we'll move on.
Because it's not nearly as long as that other set of questions. Look, can I ask, whenever we talk about the escaping violence payments, you've explained that it's a pilot program, you're working to try and get it right. Are you confident that it is now functioning as intended? And if not, what issues are there that you think require attention?
Okay, well, Senator, I mean, certainly since we were last here and even prior to that, you know, we're clearly aware that there were some issues with particularly with the speed of the rollout and the way it was being handled. I met with them, but I think I told you that last time. Subsequent to that, Ms Heffron Webb and her team have been working on a program of continuous improvement, which includes the extra $40 million that you've seen in the budget now, because we actually have seen a higher level of demand than we were originally expecting. But in terms of the specific details, I might ask Ms Heffron Webb if she wanted to add anything to your response to your question.
Yeah, and I'm just conscious of the Chair's admonition that I hurry up, so we might all have to keep questions and answers brief.
I'll just quickly say that as at the end of February, 4.29 million has been paid out versus at the end of January 2.07 million. So there is definitely an increase in the rate of processing. It's obviously we're on a pathway to improve the timeliness, but we are confident that we have put in place with Uniting Care some additional arrangements that will ensure that people get a more timely response. We're negotiating KPIs on those issues, and as the Minister said, there's additional resources because demand is significantly outstripping our projections.
Right, okay. So what is the current wait time for assessment of an application?
So the wait time for a client who inquires to first get a contact back is average of 2 business days, and 81% are getting a contact within 2 business days. The wait time between applications received and application approved is 17 business days, with 58% of individuals having their applications approved within 10 business days. And once it's approved to first payment, it's an average of 2 business days, and 61% are processed within those 2 business days.
And what is the average payment made?
I might ask if Mr Bennett has that.
Yep, thanks, Mr Bennett.
Good afternoon, Senator. Shane Bennett, Group Manager, Women's Safety. I actually don't have the weighted average for, as we discussed last time, because of the 12 weeks, I just don't have that figure at the moment. But if I could contribute something that...
I think I have it. Sorry?
No, sorry, I don't think that that's the true weighted average.
Oh, okay.
And that's why I would not like to have to correct something. So we'll take it on notice if we could.
Okay.
Okay. But if I could add that last time I spoke about the number of people who were getting the $500 early in the process. Now that's up to, at the moment, 1,589 clients have got that $500 very early in the process.
Okay, and I'm interested to know whether anyone has received the full $5,000 package.
I don't have that with me.
I mean, the other thing that's probably worth mentioning is that they can take the payment over a 12-week period for various things. So there may be many people who are midway through receiving or providing requests for particular things around the setting up of their new safe place to live.
All right. I mean, this has been a very slow... Well, this has been a program that was announced, was then the subject of enormous discontent, complaint, concern from frontline workers. It still sounds like you're trying to negotiate the terms of service with the providers. Why has the program, which was initially described as a pilot, been extended given all of the problems that have been attached to the program?
Well, certainly, Senator, whilst we acknowledged that, you know, we rolled this program out quite quickly because because we wanted to get out, and so of course it was you know, we've had to work to make some changes, but the overwhelming demand for the program certainly has highlighted that there is you know, a huge demand out there for the support for people when they are escaping a violent relationship. So I think that we would be absolutely, you know, the evidence is that there is a demand for this program, but, you know, we absolutely will continue to work on a continuous improvement to make sure that it is as fantastic as a program as it can be. But, you know, we certainly are, you know, indicating that we will continue to improve it. There have been some teething problems in getting it rolled out. Yeah, so we will continue to work to make sure that it's the best program it possibly can be, but I don't think there's any doubt there is a demand for the support for women who are escaping a violent relationship to be able to be assisted in this way.
There was it's reasonably well documented that the last women's budget statement was put together very quickly as a consequence of Australian women being very, very angry at the government. Do you regret rushing this measure, given all of the difficulties and problems it has presented for applicants and for the frontline services that support them?
Well, Senator, I mean, you have highlighted, and at the last estimates you highlighted a couple of situations that were unacceptable, and absolutely accept that. But there have been, like on the other side of it, so many positive stories of people who've come forward and said that the support that they've received through this payment had made such an extraordinary difference. I mean, I've got a whole heap of anecdotal stories, and I'm more than happy to share them with you. Of course we can do better, and we will continue to do better. That's part of a trial, and that's how you do it. But I think, I would have to say from the support and, the response that we've had about the support that people have received through this payment has been overwhelmingly positive. But I am not, going to deny that there have been some situations and circumstances that have been less than perfect, and acknowledge that. And I hope that, through this process and the additional funding, the additional $40 million to make sure that we are providing the support to try and match the demand and make sure that we are speeding up the timeframes in which people are able to get these payments improved, we'll see, a quick acceleration and improvement on the program. But I think, to just draw attention to the circumstances that you have without actually also recognising, the other side, where there have been a significant amount of people who have said that they have received the positiveness of this program.
Yeah, I mean, anecdotes are not an evidence base. I accept that, Minister, but to be honest with you, I talk to a lot of services and I ask most of them what their interaction with this program is, and the frontline workers roll their eyes almost uniformly.
So well, that's anecdotal as well, Senator, to be perfectly fair.
I conceded that, but it is pretty universal.
Well, that is not our experience in talking to the people who are actually receiving the service. Correct me if I'm wrong, Ms. Efron Webb, but my understanding is that about 95% of the calls that we're getting are actually self-referrals. They're actually not coming through service providers. So I think, it's been interesting and I suppose quite distressing to realise that, in many instances this is the first time somebody who is experiencing domestic violence has actually come forward and sought help. Great that they are coming forward to seek help, but I suppose it just highlights the extraordinary need, not just to respond to domestic violence, but the fact that we do need to make those investments up front about prevention and early intervention, because without that, we are never going to end violence against women and their children.
And just a final follow-up on another matter we've discussed before. Where did you get to with Prue Goward? You were writing to her to ask her to explain her comments that she'd made about her views about poverty, and you said that you were intending to evaluate her continuing suitability to serve on the NPAG. Where did you land?
Gosh, I'm going to have to take that on notice, because I do remember you asking me, but I can't remember the...
Did she write back?
I have to take that on notice, Senator. She's still a member of the NPAG, but I will check whether she wrote back.
I see.
Yeah, I'll check that, but yes, I did write to her, but not something that jumps into my mind immediately, but I'll certainly take that on notice and get back to you.
All right then, Chair, I'm going to stop there, but I do note that the Minister's undertaken to provide an indication about when the information about the profiling could be available.
That would be great. Thank you very much for that. So that brings us to the end of outcome 2, and we will now actually take an early dinner break and resume at 7:20, if that's okay with everyone. But we will also been advised that there's no questions in program 3.1, so we'll be going straight into the NDIA and NDIS quality and safeguards and the NDIS straight after the dinner break.
Thanks, Chair.
Thank you. So we'll now suspend until 7:20. Sorry?
Can I maybe ask the questions before the dinner break, or is that set in stone?
No, they're not here, so we have to. That's why we're going early.
Okay. Oh well.
So we'll resume at 7:20. And moving straight into outcome 3.2, And heading into the National Disability Insurance Scheme with the NDIA and the NDIS Quality and Safeguard Commission. Mr Hoffman, did you want to make an opening statement today, or you're happy to keep going?
Good evening, Senator. No opening statement.
No worries, thank you. Minister, did you want to make an opening statement, or are you happy to just
Thank you,
keep
Chair, but no.
Okay, thank you. In that case, I'm going to go to Senator Steele-John because he was waiting patiently before. So we'll give him the call first. Can you hear us?
Thanks, Chair. Appreciate it. All right. So, first of all, I'd like to ask if we can start with a brief explanation of the role of the Fraud Intelligence Unit within the NDIA.
Martin Hoffman, Chief Executive Officer, NDIA. Thank you, Senator. The Fraud Intelligence Unit is a team within our Chief Risk Officer group. It's responsible for intelligence gathering in respect of fraud against the scheme, providing advice for action that needs to be taken through a graduated series of responses from education, compliance letters, through to formal investigations, prosecutions through the task force with the AFP and Services Australia.
And who currently heads that task, heads the unit?
The SES officer responsible for the area is Mr. Scott Britton.
Okay, thank you. And what budget does the unit receive?
I'm sorry, Senator, I didn't quite hear that.
What budget does the unit receive?
Senator, I'll take that on notice. It's within the operating envelope for the agency as a whole and for the wider risk officer group. The exact budget within that particular sub-branch, I'm not sure, but I'll take that on notice for you.
Is anybody else at the table able to shed any light on that? Even a rough figure would be useful.
Senator, yes, we might be able to get that before we finish this evening.
Okay. And can you tell me how many staff currently work within the unit?
I can't, Senator, but as I said, I might be able to get that before we finish.
Oh, okay. So both of those pieces, amount of budget and staff, you might be able to get for us?
Yes.
Yes, I'm sure Mr Hoffman has somebody listening in who can make every best endeavour to get that information ASAP. Senator Steele-John.
Okay, thank you. And how many providers has the Fraud Intelligence Unit commenced investigations into in the last financial year?
How many providers?
Yeah.
Depends, well, thousands of providers have received correspondence from the area in terms of, as I said, that graduated set of activities, which is the normal way fraud and compliance is done. Many of those are queries as to why certain billing has occurred, and as I think I've testified before, that's had a very positive response in terms of withdrawn claims and modelled estimated future avoided claims. So there are thousands in that sense, which are generated through the intelligence activities of data analytics, looking at the billing and claiming patterns across the huge flow. In terms of then sort of the next levels of investigation, I might be able to give you some information on that. So I can say that for the current year, or for the first 7 months of the current year to 31 January, the number of full formal fraud investigations is 32, and that's an increase from the year before, where it was 22, and an increase from the year before that, where it was 11. So we are stepping up significantly the level of sort of formal large-scale fraud investigations of providers. A number of these have resulted in prosecutions and convictions, forfeiture of assets, and recovery of funds.
And so that was 32 provider investigations?
I'm sorry, Senator?
32 investigations involving providers?
That's right.
Okay. And in relation to the same period of time, how many investigations have been instigated in relation to individuals, participants?
Senator, the numbers, I don't have the number of that. It's relatively low, but I will come back to you on that one.
Relatively and comparatively?
Yes, yeah, definitely.
What was that, Minister?
So lower than the 32 major provider fraud investigations.
So my recollection, Senator Steele-John, and again, I'm sure somebody will be looking for that information now, but my recollection is that comparatively between participants and providers, it is significantly more providers than participants.
Okay. But there are participants that have been the subject of investigation by, or are currently the subject of investigation by the unit?
Yes, Senator.
Okay. So we currently have a situation where there are resources allocated to the investigation of participants, and I'm sure both yourself and the Minister would be aware that in a context where people struggle to sometimes get basic provisions of access equipment like wheelchairs, for instance, or basic provisions of AT in a shorter period than a year, the existence of a unit which is currently investigating participants under a presumption of fraud is sometimes the subject of concern, and it is that I share. Minister, can I ask you on your view of the appropriateness of the allocation of resources to the unit at a time when we still see such significant backlogs in relation to processing of basic NDIS support?
Senator Steele-John, unfortunately, human nature in a very small percentage of our population is that where you have very large government funding schemes, whether it's in childcare, education, NDIS or health, there will be a small percentage of people who do try to defraud not only individual participants out of the money in their plans, but also defraud the taxpayer as well. So that is certainly the case with the NDIS, and certainly as a federal custodian of a $30 billion budget, a year budget, and with Mr Hoffman, we have to make sure that people are not defrauding the scheme and that we deal appropriately and effectively with those who are doing that. And as Mr Hoffman and his team can go in much more detail, but there are different types or categories of fraud and behaviours that are looked into. The focus certainly has been on providers, as Mr Hoffman has said, and we have a whole sort of range of behaviours going from legal fraud, which are criminal acts and which are referred, as Mr Hoffman has said, to the AFP and prosecuted. That is deliberate criminal fraud. And I'm sure Mr Hoffman's got many examples he can go through with you. And then there's another spectrum of behaviours that are looked at. And one of the focuses, as Mr Hoffman has said, is where providers are either pushing the envelope, I think you could say, in terms of what they claim, or deliberately doing things like charging. So some of the letters, for example, that have gone out to providers might be that somebody has charged, for example, 24-hour service for one particular person, or their bills just don't look right. So it gives them an opportunity to pay it back and change their behaviour, through to people who are making genuine mistakes because they don't understand the system, or they don't have the accounting systems and administrative processes. So those are ones that we work with. So is it appropriate to deal with all of those? On behalf of the taxpayer, absolutely. And on behalf of participants, and we do have many examples where providers, for example, gouge, and they say, oh, well, it's only taxpayers' money. Well, in fact, it's actually coming out of participants' budgets, and it's reducing their ability to maximise their services. So, Senator Steele-John, it is essential that we do this.
And so to build on as the Minister referred, a couple of examples.
Sorry, just before Mr Hoffman jumps back in, I just want to clarify, because I am well aware, and I think most disabled people are well aware, that when it comes to the issue of service providers, there is a long history predating the NDIS, where service providers have sought to financially and otherwise exploit disabled people, and there are horrific cases of those that are well known, and it is right and proper that the federal government is involved in the investigation of those activities. However, it is one thing to be looking at providers. It is very much another thing to be looking at participants, particularly in the context where, as has been alluded to, there are less than 32 investigations ongoing in the context of a scheme of 500,000 participants. And I am very concerned, as I'm sure you have seen today, Minister, the reporting by the Guardian's social affairs editor in relation to the actions of this unit in the case of a participant who took their situation to the AAT. Now, it appears that this example demonstrates a situation in which the NDIA cherry-picked this fraud unit within the agency, cherry-picked social media posts for the purposes of attempting to discredit a participant's claim for support and influence the judgment of a medical professional. This is highly unacceptable behaviour that has been called out by the tribunal in its ruling, a ruling where an individual with hypermobility spectrum disorder was indeed, as they always should have been, upheld in relation to their claim for access to the NDIS. And quite frankly, the agency should know better than to cherry pick somebody's social media posts, LinkedIn posts, Facebook posts, when attempting to discredit medical information offered to the tribunal. So one thing to do this with providers, you will get no argument from me there in relation to investigating providers. But when you're trawling through participant social media accounts from years ago to try to discredit a totally legitimate impairment, that is quite another thing.
So, Senator Steele-John, I will hand over in a second to Mr Hoffman to go through the detail of that specific case you've mentioned. But can I make this point, is that while the majority of investigations are we're looking at providers, we certainly do have incidences where less of them, and certainly proportionally in relation to the 500,000 participants we have, it's very small. But we do have participants who do the wrong thing. And particularly, we also have examples where we have fake participants, where people are actually have created documentation and reports to defraud the scheme. So we can't. So we do have to deal with that.
This person wasn't fake.
So but Senator Steele-John, the broader issue is that. Just let me finish, please, Senator Steele-John. The broader issue, again, as custodians of this scheme and stewards of the scheme, is there are many, potential ways for people to defraud, scam, gouge, and do the wrong thing, criminally or unethically. and we have to look at all of those. Most of them, as I've said, are providers, but we cannot not look at things that relate to individual participants, because individual participants do infrequently, but they do still rip off taxpayers' dollars. And I'll just pay to Mr. Hoffman now to actually talk about the individual case you've mentioned.
So thanks, Minister. Senators, there's a few points to cover. First off, going back to your original questions around investigations of participants, I'd give three types of examples there. One where the nominee misuses the plan and spends, this was a case of actual conviction in Bundaberg. The nominee was misusing the plan for speedboats and motor vehicles, and that person, as the nominee, was prosecuted and convicted. The second example of the sort of investigation we do on the participant side would be, as the Minister mentioned, around establishing the bona fides or otherwise of participants when we suspect that it is a fraud by a provider group that is reusing application documents to set up multiple participants with the same information, and we need to investigate the bona fides or reality of the existence of that participant in that case. The third example I'd give is a very small number of not actual fraud investigations, but what we would still class as compliance investigations of self-managing participants, where we see expenditure on things like airfares, restaurant meals, gambling, alcohol, and so on. A small number of cases, but does exist. So there are legitimate situations, much less, as I said, than provider fraud, where it is appropriate and necessary to undertake compliance and investigation activity in respect of participants. In respect of the particular example,
thank you.
Yeah, in respect of the specific example that you have raised, that was a report of publicly available information. It was of limited evidentiary value and usefulness. I've made inquiries today. I'm informed that that is the only example in an AAT matter where such a report was provided to the AAT or third parties. I have reinforced today that it is not appropriate because it is not useful or valuable information for the purposes of the AAT. And that message has been communicated and understood. And I reaffirm my prior evidence to this committee of a year or so back that use of social media is not part of any planning or access decision-making processes in the agency. So this was one case back in 2020 where it was used, and I would agree that it is not appropriate or useful information for the purposes of the AAT. I go on to say, however, that if I could just finish, please, Senator, I would go on to say that I want to put this in a broader context of access decisions that the AAT is making. You rightly said that the AAT in this case held that the access decision and review that the agency had made was not the correct and preferable decision and substituted it. In the same week as that judgment, there was another judgment, not the same week. I'll just, in order to maintain confidentiality, it was not the same week. It was certainly recently, where the finding upheld the agency's rejection of access and said that the applicant had exaggerated their functional incapacity and had used manipulative behaviours to influence their own expert. This is not a common thing, and I'm not suggesting it is a common thing, but it just goes to the wider context in which our staff and the AAT have to make very difficult and complex judgments and decisions, and I think overall they approach that task with a great deal of seriousness. and they do a very good job as best they can in matters which are often very complex and difficult, making subjective and qualitative judgments.
Senator Steele, John, your time's passed, so just one final question.
Yeah, one final question, thank you. You have said that you have communicated that this was not an appropriate action for the agency to undertake in relation to this case, that social media content is not relevant to access decision making. Who made the decision to acquire that information and provide it in the way that it was provided to the AAT process?
Senator, I'm not going to go into the individual involved. That's a matter for me as agency head. I take responsibility as agency head for what my agency did. I've ascertained that it was a single case. I've communicated that it is not useful or valuable information, and that action will not be repeated.
Have you apologised to the participant? If you're taking responsibility, have you apologised?
I have not as yet, Senator, no.
Would you like to take the opportunity to do that now?
I think, yes, Senator, as I've said, I've acknowledged that this was not useful or valuable information in the process, and I'm glad the decision was made and access was granted, the correct and preferable decision was made, and I certainly regret the fact that my agency used this information at that time.
Thank you.
Thank you.
Thank you, Senator Steele. Senator Grogan.
Thank you. I'd like to talk about the particular part of the NDIS funded for early childhood services under the Partners in Community program. Can you give me an idea of how this works and who the people are that receive the services? Is it mainly young children with autism, or is there a broader? I know there's a broader cohort, but my sense is that's the largest cohort within that group?
Yes, Senator. So the early childhood approach applies to all participants 0 to 7. Within that group, of course, there's a wide range of disabilities, but yes, over half of that group would be either developmental delay or autism, yes.
Okay, thank you. And in terms of the percentage of the rest of it, do you have a percentage for the other issues within there? So autism, developmental delay?
Senator, I don't have the sort of the exact breakdown. I can very easily provide that to you on notice or
that would be
even
great.
before we finish this evening.
Yeah, a breakdown would be lovely, thank you. So in terms of the current arrangements with that program, with the early development approach, how much time is spent developing a child's plan, but before it goes to the delegate, so that planning piece?
Senator, it varies, but it is usually a process of hours, several hours.
I would have thought. So several...
But as I said, there is a wide variation around that, depending on the complexity of the situation.
Do you have an average or a sort of bandwidth of what it might take?
Senator, I'll be happy to get that to you on notice, yes.
Yeah, well, my sense, like with developmental delay, autism, I mean, you could be looking at sort of unpacking a whole range of things from speech, behaviour, mobility, physio, hearing, family dynamics, learning. It's quite a...
Yep. And some of that will have been provided to them by allied health professionals, etc. So they're not doing those assessments themselves in all cases. Often the early childhood partner organisations, their staff are allied health trained of various types and will get involved there, but they're very happy to provide more detail on that.
So can you step me through the process? Obviously the start point is valid in terms of if it's a new referral or an ongoing, that planning piece about how much history is already available. Can you step us through the process of getting that plan developed?
Senator, I might ask my colleague, who I believe should be online Mr. Desmond Lee, who is our Queensland State Manager. He'd be better placed to answer some of these questions, I think.
You can see his name.
He's
Good evening, can you hear me?
Yes, we can hear you, Mr. Lee.
Might need to speak up a bit, Des, though.
There we go.
Thank you. Desmond Lee, Queensland State Manager for National Delivery for NDIA.
Please get the volume up a little bit.
Yep, keep going.
Senator, with regard to the process of planning, as Mr. Hoffman mentioned, that can vary widely depending on the complexity of the developmental delay or the disability at play, and of course the amount of allied health support and records that the family may bring to the conversation. But ostensibly, as a young person enters the early childhood pathway, specialist early childhood planners would begin working with that family to gather together the evidence and records required to determine what things are at play for this young person, and if those particular records aren't available or those allied health assessments aren't available at the time, then they would work with that family to seek to have those assessments completed to help inform the plan that would be established for that young person. So as Mr. Hoffman mentioned, that process can vary quite widely based on what is available at the time and what assessments are required to be followed up.
okay. So there would be a process whereby somebody is appointed to do the plan, a range of diagnostics and assessments, I assume?
That's correct.
And then the planner, correct me if I'm wrong, the planner would then go through those reports, go through that sort of diagnostic piece, do some analysis on what it would take. Obviously, there would be some situations where you have a fair bit of background about the kind of things that have worked for the child before, the situation the child's in currently. But that would have to be done for each of the issues that that child might be facing. So as I said, maybe if they've got behavioural issues, speech issues, all of those things would have to be assessed individually. So it's quite a complex process.
It is, and that's broadly the process, Senator.
Okay. And what sort of time frame would this happen over? Like, a week, vary. 10 weeks, depends.
That can vary, Senator. As we mentioned, depending on the particular situation for the particular individual. And as Mr. Hoffman mentioned, some of those average timeframes could be provided on notice.
Senator, I'd just add that, of course, we, one of the participant service guarantee timeframes requires the first plan for participants younger than 7 to be completed within 90 days of the access decision being completed. And we're doing that over 90% of the time in the December 21 quarter. And we'll update that for the March quarter very shortly. So it's within that sort of elapsed time that the plan is being completed.
So for a planner, what sort of time would they, like on average, be looking at putting aside per case? Obviously, you have to manage caseloads, so you'd need to have some sort of understanding of what sort of time frame it would take them.
Des, do you want to talk about the sort of timing for the planner spends on the plan approval?
In terms of the plan approval...
I don't mean when it gets to your sort of delegate, I mean the...
Sorry.
Yeah, no, the person constructing the plan under the Yeah.
Des.
Look, that information I don't have to hand, but it would be, that process could be a matter of hours or days. Yeah.
Hours or days, did you say? Sorry.
Yes.
Yes, that's correct. Hours or days.
Okay, so quite a complex...
We've undertaken to give you a fuller breakdown and description of that sort of range, including by disability type, as you asked before, Senator.
Okay. Will we get that tonight?
I think not. I'd want to check, make sure we have it accurate and correct.
Cool. Would you have a sense? And the only reason I'm asking is if you say, oh, it'll be by the deadline in mid-April or whatever it is, then I'll probably want to probe a little bit further.
I will undertake, Senator, to get that to you before the official Quan deadline, yes.
So maybe Monday or Tuesday?
What's today? Friday. Is
Friday.
Friday all day, yes?
It is.
If you give us Tuesday, we'll get you it on Tuesday.
Tuesday, okay, thank you. So once that piece of the puzzle has been undertaken, taking a number of hours or potentially days, how much time is then spent by the NDIA delegate to review that and provide the approval?
Senator, the time for that process, that delegate approval, can be between an hour or 2 hours, can be longer than that, but that's around about the average time.
So I assume that you would have, like, the plan would come from the childhood, early childhood provider in a particular form, so that it'd be easier for the delegate to sort of work through in a systemic fashion?
Yes, it'll be in the business system, the computer CRM system with the attached information that the delegate will work through, yes.
Cool. So if I can just refer to the Oz tender notice, I'll give you the reference, SPC 00001863, which has gone out for an early childhood and or local area coordination service for the Partners in Community program. The fee schedule that relates to the tender is an Excel spreadsheet document titled SPC 1863, Annex D to Schedule 2. It shows that in here that the successful tenderers will be required to complete a plan development meeting in an average of 2.4 hours. Is that correct?
Senator, I don't have that spreadsheet in front of me, but if you've said that, I'm happy to say yes, that's what it would say.
Yeah. I can pass it over.
No, I wasn't in the slightest saying it wasn't true, saying I don't have it in front of me, but if you quoted it accurately, then...
And also it is consistent with what Mr Hoffman and Mr Lee has said, so that sounds about right.
Cool. Okay, so the 2.4 hours seems very low to me. When I think about the kind of level of assessments that would have to occur for a child with a disability, 2.4 seems pretty light in terms of an allocation. In terms of what fits in those 2.4 hours, obviously if an outsourced assessment of some sort, that's not counted obviously because the planner's not doing that. But obviously your business system, the people would have to load stuff into your business system. There would have to be, I would imagine, a significant amount of time spent with the parents, child, any, digesting and understanding any reports from any professionals. Do you think 2.4 hours is sufficient?
On average, Senator, that's the what we've asked in that tender, as you've said, to be costed. I think it is consistent with resourcing, consistent with producing quality plans. We've seen significant increases in the sort of funding in this area through the life of the NDIS that has brought a lot of benefit to children through that process. And it's the way, as I've explained and as Mr. Lee has, that we've been working to date. And we can certainly get, with the new business system we'll be currently implementing, we'll get improvements in efficiency and timing, etc. So that is the way, by and large, it is working currently. And I think the outcomes that we've been reporting in terms of kids in the scheme and the benefits to them reported by their parents in terms of engagement, development, satisfaction, show that that is working well. It's good. We want to get better, of course, as we keep going. So that seems the appropriate sort of timing.
So how long have you had? Is the 2.4 is a new number? My understanding is it used to be 5 hours. Is that correct?
Senator, I'm not aware of that. That is the sort of benchmark level that we have put in, as you've noted, in the spreadsheet for tendering purposes. What actually results in the contract and in the partnership agreement will be subject to that competitive tendering and bidding process.
So there's no one here who could advise what the contracted period for developing a plan has been in the past?
Senator, I don't have that, but...
No, I appreciate that you don't, but surely you have some... you've got quite a few department officials here. Maybe one of them has some understanding of how this program has changed in terms of the assessment.
So I'm not aware that we're reducing from 5 hours or anything like that, Senator. No.
I'm pretty confident it is a reduction. Or maybe the Minister has some further information.
I think, this is an area where we are making constant improvements. In fact, we call it a reset. And this contract reflects a lot of input and a lot of engagement from families and providers into this process. And one of the things that I think is really important in this is that children don't actually require a diagnosis to receive supports in early childhood. And so many of them will actually enter the scheme with an identified developmental delay, but not with a specific diagnosis. And that then occurs as the child progresses through the scheme. And early childhood partners do have an important role in assessment and support of childhood development, but they do employ, as has been said, early childhood specialists to do functional assessments and other things. So maybe, Mr Hoffman, it might be helpful just to sort of go through that process and how this tender has been set up and in terms of what's expected. Because again, it is the result of significant engagement and also sort of advice. And so what is actually in the tender does, and certainly from the briefings that I've had, it certainly does reflect that.
So, I think I've got a sense of where the programs are. I'm very conscious of the time and I'll be wound up any second now. But I'm really keen to understand, my understanding is that the number of hours set aside in your tender for that planning piece to be done by one of the people in the Partners in Community program has changed significantly from 5 hours to 2.4 hours. And as you said, like approximately 50% of the children in that program are have autism, and there are many challenges and many elements
Senator Grogan, I think
should be dealt with.
They're very good questions, and they're questions that, as I was going through this, also had to come to a clear understanding. So what I think the best way to describe this is the previous contract and process, particularly with LACs, is actually quite different to what we're doing in terms of what and how it is delivered. So it is quite possible that those hours have changed because we are also, as part of this, the expression is, let LACs be LACs again. And so that's, they're not comparable. So because we have made a lot of changes, and perhaps Mr. Lee might be able to sort of go through some of those changes and how this new contract is evolving, the PITC scheme and also the role of LACs.
Well,
So-
maybe I can just sharpen
Local
the
area coordinator, sorry,
Yeah.
I've got too many acronyms.
Just so I've worked in disability.
There you
know
go.
what they are.
Of course.
So if I could just be a bit more pointed with the question, just for the fact that it's Friday night and we may not want to stay here all night. The number of hours invested in developing the plan, Mr. Lee, are you aware that it was that the number has reduced for whatever the number of hours allocated within the tender has reduced, and what the rationale for that would be?
Senator, no, I'm not specifically involved in the tender processes and the planning for that. However, what I would say is that while 2.4 hours may be an average time applied, you have to remember that first plans will take longer. However, reviews of plans may be quite quick by comparison. So, to call that out.
So I'm wondering, in the tender, are you aggregating that?
And Senator, if I could also just add, you've picked out one particular item there in the costing spreadsheet, the 2.4 hours per episode for the planned budget development function only. There are other functions in the tender with much greater hours that cover the key part of the partner role in working with the child and family. For example, the early connections is 10.1 hours, and this is only benchmark for the purposes of the tendering. Early connections is 10.1 hours, covering the initial assessment of the needs of the child in the first plan. Obviously, subsequent plans can be less and quicker. So I think we've focused in on one line item in the
I have
total
very
function.
specifically, yes.
When the actual function and engagement with the child and family, as per the tender, is broader than that. As I've
So I
just given
guess
an
that's why I'm
example.
asking the questions, because I see a reduction. So if on initially asking the question, you would say, oh yes, that's because we've upped the hours over here to have more early engagement, we've changed the hours here, then that answers my question. But to this point, you've said you don't have that understanding and those
Senator
numbers.
Grogan, can I just perhaps suggest, I think it's pretty clear what you're asking, and if we, rather than speculating at the moment, if we also come back on Tuesday and actually
Very
provide
happy
an
to do
answer
that.
to that more specific question that we've been discussing around, if that would be acceptable.
I would just add that we haven't previously described and broken out the level of detail that you're seeing there. So we haven't previously shown a number for planned budget development only, which is the 2.4 figure. Now we have, to give greater assistance to tenderers and bidders, including those who may not have currently be providing the service. So it's just one line item of the total work that is done to both do the first plan and do subsequent monitoring and engagement, and then subsequent plan reviews. So we'll set that out clearly in terms of the response to you on Tuesday.
So,
Okay.
Senator Grogan, just on that then, I think just to be clear, just to make sure Senator Grogan will answer what the question you're asking, is if the agency comes back and maybe sort of has a look, because I've said it's quite a different contract and different, as Mr Hoffman has all expanded. So if we come back and just do perhaps a comparison of the previous contract with what we've asked for in the new contract, and just
That
so
would
you
be
can
really
see the
helpful, so I can
similarities and
see
differences.
how that's going to work. And the other spreadsheet I have here, which is from the same tender piece, is for adults, where again the number 2.4 has been nominated. If you can maybe provide the same sort of response on the basis, I'm sure it sits with the same rationale.
Yep.
I'm just unable to find that rationale, and obviously you don't have it, so that would be useful to have for those
Senator Grogan,
changes.
we will get both of those for early childhood and also for adults, and just so you can see that comparison. So we'll get that to you, through the committee on Tuesday, and then we can have a further discussion on that when we're back on Thursday.
Great, thank you very much.
Thank you.
Thanks, Senator.
Senator Urquhart.
Thanks very much. I'm just going to whip through these because I am conscious of time and it is Friday. So maybe if I could ask if you could condense your answers, that would be great. So I understand that Dr Dennis Napthine has been announced as chair of the NDIA board, and I think his term starts today. Is that correct?
Yes.
Minister?
Yes, yes, it does.
Okay, April Fool's Day, so there you go. So, Minister, can you explain the process to appoint Dr Napthine? I guess I'll just run through. What was the nature of the process? Was it by expression of interest?
So the process was conducted in accordance with the NDIA Act, which actually requires me to consult with states and territories prior to making an appointment. But unlike the appointment of the Board of Directors, which does require majority agreement from the states and territories, the NDIS Act, which again was implemented by Labor, requires me to consult on the appointment of the chair.
Okay, so was it expression of interest? Is that the process that you did? So obviously you've got to consult with the states, but was it by expression of interest? Is that how the person came?
No. So there was the states and territories provided majority agreement for the appointment of Dr Napthine as an NDI board director, and they did that last year.
Okay.
And then I went through the process and made the appointment in accordance with the Act.
Okay, so how many other candidates for the position were considered?
Well, Senator Urquhart, as I've said, that's not the process that is required under the Act.
No.
And
So there were none?
Well, I'm not saying that. I'm just saying I did it in accordance with the Act.
Yes, but my question was how many other candidates were considered? Were there other candidates considered? Whether you did it in accordance with the Act or not, were there others?
Well, I think what I can confirm is that it was done in accordance with the NDI Act and also cabinet procedures as well.
Minister, I understand that. My question is, I'm not questioning the process that you went through, whether it was under the Act or not. I'm asking how many other candidates were considered.
All of the current board members were potential candidates and were considered.
Were they all considered?
Absolutely.
Okay.
And so Dr Napthine was clearly the standout candidate.
And how many board members are there?
The full complement's 12, and I believe there's currently 10? 9.
9. So there were 9 other candidates.
Potential candidates, yes.
Okay. When did Mr Napthine first express interest in the position?
Well, my presumption was that all of the board's directors would have been interested in being considered.
Minister, that was not my
for the
question. My
appointment.
question was, when did Mr Napthine first express interest?
I'd have to take that on notice. So I'd have to take that on notice because that is, take it on notice.
And was there any form of selection criterion that you used?
Dr Napthine is an eminently qualified...
I understand his qualifications.
Please allow me to finish the question.
Yeah, I'm just asking if there was a selection criterion that you used.
I did, again, it was completely in line with the requirements in the NDI Act and the cabinet procedures.
And does that have a selection
He's eminently
criterion?
qualified. He's got a passion and experience. He was involved in the establishment of the scheme. And so not only does he have extensive engagement with the sector, with the scheme itself, and also as a parent of
Minister, I'm
member of the scheme.
not having a go at his credentials at all. He's a very distinguished gentleman.
He is.
I understand that. My question was there any form of selection criterion that was used? Do you have a tick box? Do you have a selection criteria that people
Senator, it was, as I said, it was done in accordance with the NDIS Act, and if
So I take that as a no,
I can
Minister.
refer you to the relevant section. I don't think I've got the relevant section of the
That's
NDIS
fine.
Act here.
I'll take it as a no that there wasn't a selection criterion. When was the decision taken to appoint Mr Napthine?
Again, I'll have to take that on notice because I don't have the letter of appointment here with me. But I will just...
No, when was the decision taken?
25th of March.
So not long ago. Did more board members vote on his appointment?
That's not part of the requirement under the Act.
I'm not asking that, I'm just asking if they did.
Well,
so.
no, Senator Urquhart, as I've said, I did it in accordance with the NDI Act.
Well,
And
maybe
maybe,
we
Chair, if we
table
can get
the
a copy of that, because I don't actually have a copy of the Act here, but it was done in accordance with that and with Cabinet procedures.
Were agency officials involved in the decision to appoint Mr Napthine?
No, because it's my decision under the Act.
Okay. Would you say that Dr Napthine was your top pick for the role?
Well, clearly he was because he was appointed.
Okay. Cover that. So you've already outlined that state and territory are partners in funding the scheme that would be interested, and you go through that process because that's a requirement. So what was that discussed? Was the process to appoint a new chair discussed at any disability reform ministers' meetings?
I'll go back and check the minutes, but we've certainly, for the board members and also for the chair, it was discussed at least at 2. But
Okay.
we'll have to go back and have a look at the minutes. And the outcomes of those, the communiques are all publicly available as well.
Okay. Can you tell me what dates the chair position was discussed?
As I said, those documents, the communiques and outcomes are available publicly online. They are published. So we can take that on notice and provide them if you haven't got them. So in relation to the criteria, as I said, in accordance with the Act, is the board members that the board members are to be appointed by the minister.
Sorry, I don't want to cut you off, but just in terms of time, are you able to table a copy of that, the criteria?
Well, that's actually in the Act. So I'll give you the section. So it's the NDIS Act, and it's section in Division 2, members of the board, and it's section 127. That's a board members, which also includes requirements, what I needed to satisfy myself for the chair.
Okay, so that's the criteria that
Absolutely,
was measured against.
as I've said, yes.
Okay, no, that's fine. Can I ask what was and you'll come back to me with the dates, the position was discussed?
They're on...
Oh, they're on the website,
They're on the
Okay.
website in the communiques, but we'll go through and check.
What was the view amongst the states and territory disability members about the process to appoint a new chair? I know the communique is out, but I'm sure that doesn't go to the extent of what the state and territories view was.
Senator Urquhart, as I said, I did it in accordance with the Act, in
Was it
accordance with
supported?
Cabinet processes, and I consulted with states and territories.
Was it supported by states and territories, the position?
Is that it? Not sure if that's... I want to share deliberations and between my state and territory
I'm not asking
counterparts
for
without having
deliberations,
their
I'm just asking
approval.
whether it was supported fully by the states and territories.
Senator Urquhart, that then goes to the content of my communications with individual states and territories. I don't think that's appropriate.
I'm not asking you for which states and territories, I'm just asking you whether it was supported by all of them.
It's not, but Senator Urquhart, as I've said a couple of times, that's actually not a necessary prerequisite. And I consulted with them.
Okay.
So just in terms of, because you asked about, so I'll just go through just so that there's
So the requirement is to consult but not have agreement.
So
Is that as I
in
understand
subsection
it?
3...
Yeah, no, that's fine.
No. Sorry, I'll just go through
I
this
understand.
because I'm not sure... Sorry, I'll just read this out because you asked me. The Minister must consult the host jurisdictions about the appointment of the chair. Before the Minister appoints a board member, other than the chair, the Minister must go through a range... where are we? But that's actually for board members, other than the chair, which, of course, we did when he was initially appointed. So when Mr Napthine was appointed, I sought the support of all of the host jurisdiction for the appointment and be satisfied that the appointment is supported by 2 things: the Commonwealth and a majority of the group consisting of the Commonwealth and the host jurisdictions. So for Dr Napthine to go on the board, that threshold to get on the board was absolutely met in accordance with the Act.
And that's
then
is that after the appointment, did you say? Sorry,
12 months ago.
No. So
Okay, yeah.
there's two, in the NDIS legislation, there's two separate provisions. One is for the appointment of board members, which is what I've just gone through,
Yep.
and the other one is for the appointment of the chair.
Yep.
And so Dr Napthine went through the process, like for other new members of the board, in terms of consultation with the states and territories, and that a majority of the group consisting of the Commonwealth and the host jurisdictions did concur. But for the chair, it is a different requirement. So he's been through both. So if you want to look for it, that's section 127.
Yep, I've written that down.
1 to 4.
Okay. All right, thank you. I think is that it? Oh, just 3 or 4 more in relation to the AAT cases. So can you tell me how many NDIS appeals have been lodged with the AAT in the 3 months from January to March 2022?
Sandra, I won't have March's number because it only just finished yesterday, so I won't have that with me. I do have the first 2 months of the year. Or I thought I did. We tend to work off our quarterly reporting data, which was up to December, but I will have the...
So did you said you had January, February?
I'm sure I'll have that very shortly, Senator.
Right, okay. Somebody's getting that to you, are
Yes,
they?
they are.
Oh, sorry, I didn't know whether you needed
No, thank you.
a quiet moment to look through your papers or whether someone's going to come and present.
He's waiting for a message to pop up on his phone.
Terrific.
Yes.
Okay.
Thank you, Senator. I appreciate your understanding.
No problem. Can you tell me how much in total has been spent on external legal fees during that time?
Senator, I can tell you how much has been spent for the 8 months to February for this year, yes.
Are you able to break it down into months?
Month by month, Senator?
Yes.
Yes, I can. I don't have that data there, and it's not necessarily depends when it gets billed, depends when it gets recorded in the system, so it's going to not be sort of smooth in that sense, or particularly related to the level of activity because
within that month. Yep, understand. Yep.
But I can certainly get that. But I can happy to tell you for the amount for the 8 months to February was $31 million.
And I take it that's starting end of June last year, so in the financial
July
year.
1.
Yep. Okay.
Fiscal year.
So $31 million. Can you tell me what information does the NDIA record about AAT outcomes? So both in relation to settlement outcomes and when it goes through to an AAT decision, what information do you record about that?
Well, the outcome is all designed at reaching a correct and preferable decision in terms of if it's a plan review or a planning AAT matter as opposed to an access matter. But if it's a planning matter, then the outcome is seeking a planned decision, which is either reached by agreement, conciliation, and then endorsed by the AAT, or comes from an actual decision by the AAT itself. So that's what will be recorded.
So if it's settled through, I guess, a conciliation process, is that recorded?
Well, yes, because any time a matter is in the AAT and it's settled by consent, that is by consent of the AAT itself, and so we know what then has to be implemented
and so
in
that's
the planning
recorded.
system.
Yep.
Correct.
Okay. And what about when it goes through to a decision?
Well, it's the same. The decision will be the decision of the member of the tribunal, written findings, and that will include either affirming the agency's original decision, which is about half the time, or varying to some extent that original decision.
Okay, so you record those irrespective of whether it's a settlement outcome or a decision?
Because recording in the sense that we have to give action to where we got to, and we have to update the plan effectively.
Okay. So what data does the NDIA maintain to record when additional supports or funding are included in a participant's plan following an external review process?
Sandra, could you just repeat that again?
What data do you maintain to record when additional supports or funding are included in a participant's plan following an external review process?
So we record the current plan decision.
Right.
So whatever that is. Now, that can be complicated because at the same time that we might be in the AAT, either through conciliation or through an actual formal hearing, and that leads to some decisions.
Mm-hmm.
In parallel, of course, we're still working with the participant, and there might be other reviews to their plan which are being done at the same time, other requests for supports that may be handled within the agency or may be joined to the AAT case. So it is actually quite a complex and dynamic process at any point in time. But at any point in time, we have the current plan, and we would have we'd have some knowledge of the prior plan. Now, our IT system as designed does not keep a full record of all previous plans and all sort of permutations of them, nor record the different sources of where a change came. Was it an AAT decision? Was it a separate plan review that was done? But at any point in time, the accurate thing is, what does our CRM say about what the plan is?
So somebody
and
may...
So I can just add, in January there were 233 new matters, and in February 560.
233 and 560.
Yes.
Okay, thank you. So just in relation to that then, so if there are additional supports or funding after an external review process, there's not necessarily, this is what I'm understanding you're telling me, that that will be recorded in the person's plan, but you may not necessarily know that is from an external review because it may be an update of the plan. Is that
correct? Yes.
Right.
Now, we would still be able to go back to as it were, the case file of the individual AAT matter and see what is in there, be it the decision of the member of the tribunal.
But you've got to troll back through that.
Through those,
you don't
those
actually
cases.
have.
Correct.
Like, so in the records that you keep, you don't have something that says this additional support or funding is related to an external review process.
Through the AAT? No, we don't.
Why is that not the case? I don't understand why that can't happen.
Well, there's nothing to stop it happening in theory.
You
It
just
is
don't
simply
do it.
that the SAP CRM system that we use was not designed or built to record the source of all changes to particular plan line items.
So the system is not capable, is that
Correct,
what you're saying
that's right.
to me?
And in fact, AAT reviews are what we call off-system, in that they are not actually on the SAP system at all.
Right, okay.
in time.
What is the NDIA's process for reviewing outcomes from AAT reviews as part of the continuous improvement strategy?
So we have quite an active process, particularly where it goes to full hearing of reviewing those decisions and looking at any updates we might need to make to operational guidelines or SOPs to reflect that. And we have a oversight committee for such matters, as well as our OG update process that takes into account AAT findings. Yes.
Okay, and then so what records and data are retained by the NDIA as part of that process?
Well, it's really, as I said, the file, the file
It's that
of each
same
matter.
process, is it?
Yes.
Right. Sounds like you've got a clunky system.
I would not disagree with you, Senator.
Okay. Excellent. Thank you.
But we are making, as I've testified before or spoken about before at this and other hearings, we're making significant investment currently in the upgrade of that, replacing the current SAP system, which should give us significant additional functionality for the benefit of our staff, but particularly participants.
Okay. Thank you.
Thank you. So that brings us to the end of the questioning for outcome 3. I do have a message from Minister Ruston in relation to earlier questioning from, in regard to Senator McAllister's questioning, so I'll just read that. It says, I will endeavour to provide the Community Affairs Legislation Committee with comprehensive information regarding our historic funding commitment to end domestic, family and sexual violence requested this afternoon by Senator McAllister prior to the convening of the next estimates hearing for the Department of Social Services. So that's by next week. So thank you.
Chair, I can answer one of...
I was going to say, is there any other questions on notice that
I can answer one of Senator Grogan's
to?
questions from before, if that would be of assistance. This was the proportion of our child participants and disability type. So 47% developmental delay, another 11% with global developmental delay, as you said, with your background, understand, 27% with autism. Then they're the 3 big categories, and it drops away quite significantly. 5% hearing impairment, 3% intellectual disability, 2.4% cerebral palsy, and then there's probably half a dozen to 10 other categories, all under 1%.
Lovely. Thank you very much. That's very helpful.
Right, so thank you very much, Mr Hoffman, and we will now release all officials in relation to outcome 3, and we're going to move on straight on to Services Australia. I think they should all be available.
Do you want me to tick off these few that we had left over from there?
We might just suspend briefly for a short moment till we're organised. Yep, that's right. With Services Australia, and I understand, Minister, you might have a brief statement to read.
I do have a very brief opening statement, so thank you very much, Chair and Senators. I just thought it was important to recognise a number of significant achievements by Services Australia staff in the floods. So I just wanted to make a few comments about that. Since the devastating floods hit parts of Queensland and New South Wales, the government had acted very swiftly to support Australians in their time of need. And since the 1st of March, we've supported more than 1.5 million Australians in flood-affected regions and have paid more than $1.4 billion in Commonwealth financial supports to some 81 local government areas. And we have Services Australia frontline staff, including social workers, on the ground within the first 2 days, which is certainly a record in terms of speed of access, particularly in very challenging circumstances on the ground. And across flood-affected regions, Services Australia has more than 200 service points directly assisting, already directly assisting over 25,000 people on the ground. And in mid-March, I did have the opportunity to meet many of the staff working on the ground when I visited Ballina and Lismore and heard firsthand about their experiences and their accounts of the circumstances that they found on the ground with so many people who had lost everything. And I'd really like to take this opportunity to thank from the bottom of my heart, and I'm sure on behalf of the committee members as well, thank the work that Services Australia staff have done. I know from previous portfolios, when we think of emergencies, we think of people in orange and yellow uniforms and in military uniforms of various types, but we don't often stop to think about the blue uniforms of Services Australia. and not only the frontline staff who have been out there in incredibly challenging circumstances, often travelling 4 hours a day to get to and from the 200 points across the region, and they are just incredibly dedicated and just amazing people, because long after other uniforms, emergency services and defence personnel have left, the Services Australia personnel are there for months, and possibly in this case for years. But it's not only the staff on the front line, it is also the staff right across Australia who've been processing the millions and millions of claims so quickly. So it could be somebody in Darwin, in Perth or elsewhere who have joined in that effort. I'd also like to thank those in the 24-hour operations centre, the tech support staff who have worked and done an incredible job to turn around these payments so quickly. And again, some of them have worked overnight for many, many, many weeks, and I'm very grateful for that. The agency's ability to scale up to meet these challenges is underpinned by its long-standing transformation program and their flexible and very agile surge capability. The agency is continuing to improve their capabilities and service standards, particularly its digital service offer. Sorry, it's late at night now. Their digital service offer, I'll say that again, and which has made it possible to process up to 100,000 claims that were coming in each and every day, which again is a speed and a volume that was unprecedented. So can I just finish by... I do have a statement to table with some more facts and figures, but I don't want to take sort of any more time. But I just think, given the extraordinary and largely unheralded work that Services Australia staff have done, it is worthy of an enormous thank you, because it has made an enormous difference, as I saw on the ground, to the people who have literally lost everything. So on behalf of us all, thank you.
And thank you, and on behalf of the committee, I'm sure we'd also like to record our thanks as well. So thank you, and thank you, Ms Skinner, for joining us tonight. And the first item is the whole of portfolio and corporate matters, and I don't think that... Have you got any in that area? Because I know...
I've got a few that was... I tried in cross-portfolio
Okay. So
that they couldn't answer, so maybe if I could start off with a few of them. Yeah, there was a few. So
Senator Urquhart.
Thank you. So I asked a few in cross-portfolio and they were able to answer some, but they directed me back to Services Australia, and it was in relation to the cost of living payment that's going to be delivered to individuals or eligible individuals progressively from late April. And my question was whether or not the recipients were going to get notifications, and I asked who would provide that notice, and I was told Services Australia. I was told that it would be done in the normal channels of how people choose to get advice, whether that be by text or email or whatever. So my question in relation to that was, could you tell me what work has been done designing and drafting that notification?
Senator, I can have Mr Egan go into particular details, but the payment, we've done a payment like this several times, so this is quite a business as usual payment for us, and we have been enhancing the way in which we communicate with customers. So if you have a look at the Services Australia website right now, there's very clear customer advice about who will get the payment. It is clear it is still subject to the passage of royal assent. The legislation passed the House, I believe, yesterday. Yeah. And then we will, so that communication has already commenced, if you like, and that if people were to call us, they're also able to be directed into an interactive voice response to that question, which will advise them that if they are one of the cohorts that will receive the payment, there is nothing that they need to do.
Right. I guess the part of the... Sorry to jump in, but I guess the main reason for me asking this question was so that recipients who are eligible for the payment didn't just wake up one day and there be an amount in their bank and it would give them horrors about robo-debt. So I wanted to make sure that that notification was going to be given at an inappropriate time, so that people were well aware that it was a payment that they were entitled to.
So the eligible customers will receive an SMS if they've got an SMS number Mr. Withers around 2 days before their payment is made.
Okay,
but as I said, these cohorts have received similar payments, and we have not experienced anyone who calls us will get advice that they don't need to do anything. So I can be, you should be confident that customers are getting the information they need should they contact us in that way, and they will get a notification post the payment. The payment is clearly separated from any other payment they receive, so it won't be bundled into an age pension. It will be clear it's a separate Australian government payment. And they will get follow-up notification either in the mail or through MyGov, whatever their channel of choice is. So there'll be multiple
more
ways.
than one notification.
That's right. They'll be able to see,
so
get an
that's
SMS,
before and after,
see it
is
in
that
their
right?
bank account separately, and a notification. The MyGov letter would likely go about the same time as the payment.
Okay. Now, I think
in the bank account, it will be, because of the work that's been done around modernising the payment platform, rather than just Australian government payment, it will say cost of living payment.
Okay, so it'll actually have a line item. So I asked the department the cost of what was budgeted, and I think they said to me 18,300,000.
Yes, that's
right. Correct,
So most of the money is for this year because the payment is being delivered in this financial year. And Mr Egan can go into the sort of detail about why it goes over into the next year, because it does depend on when someone might become eligible if we haven't actually processed. So someone on... I'll let Mr Egan explain it. He knows why that would go into the next year if you're interested.
Senator Russell Egan, Deputy Chief Executive Officer, Customer Service Design. So I think your question went into the small amount of money allocated to next financial year.
300,000.
There's a range of reasons why a customer may not receive the payment this financial year. For example, there's a reassessment of a claim which makes them eligible for a period which covers the 29th of March, which is the reference date for the payment. So in circumstances like that, then the payment might be later. There's a small number of customers that we will need to also write to obtain bank account details to make the payment. So there may be a small number in that
lag
category
over
as
into
well.
that time frame.
So that's why there's that small allocation.
Okay, that makes sense, because it didn't make any sense. 18 million and then 300,000. Okay. Are you planning on informing the public in other ways? So I guess I'm wondering if you're going to do digital social media, billboard or display advertising, booklets or leaflets, any of that?
We will do what we has been an effective approach with all of our communications. It's already on the website. There may be at a point where the agency spokesperson will do some media interviews around that. There will be so we also run a social media channel, so people will often text, we will respond. So we will do all of those things that we do as part of our normal course of communicating and engaging with customers on all sorts of payments.
And I asked the department about other agencies, and they indicated that they were working with that you would work with Veteran Affairs.
Do work with
Are there
Veterans
any
Affairs.
others?
Do you want to go through the cohorts?
Yes, Senator. The Department of Agriculture, Water and the Environment would be the other, because they're the policy agency responsible for the farm household allowance, which is one of the payments.
I was going to wonder how they fit into it. Okay, yes, great, thank you. And got the cost. How much will it cost for the campaign? So how much is it going to cost you to provide that information? So that's the 18 mil and the 300K, is that correct?
I'll ask Mr Egan just to go through the breakdown there. Just so we're, just to repeat Senator Ruston, there is absolutely no campaign. This is just our normal communication channels with customers about any of the products or services that we provide. So there's no campaign, there's nothing additional here other than our normal way of communicating with people. The SMS is an additional layer that's part of our transformation and our ability to engage
digitally with customers where they have that access available, and things like being able to say cost of living in the actual payment. They're new features of which also play on our transformation. Most of the funding falls in two parts, mainly the technology piece of work, but also the service delivery costs. And I'll ask Mr Egan if he wants to go through those.
So, Senator, there are the total cost, as you know, is 18.126 million over 2 years. The breakdown is service delivery costs, so that's costs for our service delivery network of 9.8 million. Costs for Services Australia Canberra, so that's essentially the supporting functions, of 5.6 million. The largest component of that is in relation to print and postage costs for correspondence for non-digital customers in particular. And then there's the ICT costs, which are 2.6 million.
Great, thank you. And which agency is paying that?
The money was received by Services Australia as part of its portfolio budget this year, and we will pay the bills from that.
And have you engaged any external advice in relation to the information?
No.
No.
Okay. Have you provided advice to any other agencies or ministerial officers?
Senator, it is typical in the formulation of policy for us to provide implementation advice to policy agencies, and we certainly did that in the context of this payment.
Okay. I think that wraps up that section, so thank you.
I don't think there's any other questions in regard to whole of portfolio or corporate matters, so we'll now move into outcome one. I'll go to Senator Rice first.
Thank you very much. Minister, I want to go to the staffing levels of Services Australia. And am I correct that as part of the budget there's going to be a further 2,719 jobs, or 9.4% of total staff, being cut from Services Australia?
That is actually not correct, and it actually represents, I'd suggest, a slight misunderstanding of how the budget and the Services Australia staffing works. Each year in the budget, Services Australia has a baseline amount, and then we have surge resources that are provided, and again, as the CEO I'm sure will be able to expand on shortly, to provide extra staffing that's needed to deal with things like the floods, COVID payments, etc., which is a combination of public servants from other departments, but mainly external workforce to deal with the surge. So I'll perhaps, CEO, if you'd like to go through that in a bit more detail.
Thank you, Minister. Senator, if I can draw your attention to page 171, if you've got the social services portfolio, PBS, but if you haven't, there's a footnote that points out that the 21-22 average staffing level
on page 171, Senator Rice.
171 of our yellow book, Senator, just to help the context of as Minister Reynolds has just alluded to. So if just to the PBS for 21-22 had a baseline ASL of 26,838. That footnote then identifies, as you might see in the portfolio additional estimates ASL number, an increase of 2,031 for the administration of the COVID disaster payments. We still hold most of that ASL at the moment, and that is used also to support our pandemic leave disaster payments and the flood work. So I have a baseline ASL, and government, if there are crises like has occurred, we engage with government about what staffing level might be required to support that, and that gave rise to the additional 2,031 staff. So the baseline is very much the same from the PBS 21-22, which was 26,838. We're going to a baseline of 26,150. Should there be a need for additional ASL for any further emergencies, we'd expect to engage in a conversation about that. I'd further add that the transformation work does enable some further efficiencies to be drawn into the organisation, and as you would be aware, some of our budget is set based on the probability of the workload, and with the job seeker, some of the additional ASL in the past year, the year before, had been to do with the increase in job seeker claims that were being managed, but as those return to previous COVID levels or lower, we would also expect to not need as many people to assist to manage those.
So I think Senator
that's how I
Rice
give that.
also, one thing that impacts the fluctuations in ASL and total staffing is also the digitisation, particularly over the last 2 years. As you know, a lot of the services have
people
become...
having the opportunity to speak to a person, yeah.
Absolutely, of course they will. So again, you've got
fewer people having the opportunity to speak to a person.
no, Senator Rice, that's actually not correct. If you have a look at the data,
I think it is.
Senator Rice, if you allow me and the officials to answer, that is actually not correct. So we still have very significant telephony services available, and we adapt them very quickly for the types of services required, as we did for the floods. But what we found for the most recent floods is that over 90% of people who made applications for the DRP or DRA were actually online, and they did use their online apps and services. So Australians, it's very clear that Australians are choosing, as they do for their banking and any other online services, to deal with the federal government, Centrelink, MyNDIS, Medicare, and MyGov online digitally. So as that changes, the staffing profile and in terms of the workforce itself does vary, but absolutely people can still walk into service centres and get support there. They can phone and they can have an increasingly sophisticated digital experience.
Look, I haven't got the information here, but judging from the anecdotal evidence that I get of the level of support that people get when they walk into a Centrelink is not a lot.
Now, Senator Rice, I've got to take issue with that.
And it's not,
and
not
again,
because of the
Senator
staff.
Rice,
It's not because of the staff.
anecdotal evidence is a very poor metric. I've been to many service centres over the past 12 months, and we've got a lot of data. People can, in office hours, go to physical services. We've got 200 points of service in the flood-affected areas at the moment where people can go in and talk to one of our amazing staff there. People can phone, or they can actually choose to do things online. So actually, no, Senator Rice, to denigrate the staff who
I'm
provide...
not denigrating the staff at
Senator
all.
Rice, of course you are.
I am not.
It is the staff who
not.
provide
It's the
those
lack of
services.
staff.
Centrelink, Medicare, increasingly now for My Aged Care, for veterans, they provide an amazing service, Senator Rice.
Absolutely. The staff
Well,
do an
you just
amazing
said
job.
they did not.
I did not. The staff do an amazing job. There just aren't enough of them. They are run off their feet. They are overworked. They are so distressed that they do not have the capacity to help people in the way they would want to be able to.
Senator Rice, we'll get the CEO to respond to that.
Rubbish. That is not consistent with the data that I receive every year from the Australian Public Service Census.
Could you take
and
a
I
note?
could also assist to say that the face-to-face service offer is our highest performing customer satisfaction score that we have, and we engage customers as they participate as they exert face-to-face services.
Senator Rice, if you'd actually like to go and visit perhaps one of our new service centres and actually go and meet the staff and have a look at how the service has, no, not just staff, but have a look at the participant experience as they walk in.
That's right, meet staff.
As
no, you
they
might not
walk
want to talk
in.
to them. They might actually want to tell me as a Green Senator what's really going on.
So, Senator Rice, I've got to, look, please, as the CEO has said, what you've said is just flat out wrong, and it is demonstrably wrong, and it is an insult to staff. And it is just flat out wrong, Senator Rice.
Can I put on the record, seeing you are accusing me of insulting the staff, absolutely I am not insulting the staff. Absolutely the staff are doing an amazing job. The staff are not there are not enough of them, and they do not have the capacity to do the work that they would like to be
Rice,
able to
what
do.
we might do proactively, even though you haven't asked for it, what we'll do is we will actually provide the committee the data that the CEO has actual data to demonstrate that is absolutely not the case.
I look forward to seeing it continuing the discussion. I will. I do actually want to go back to the numbers of the loss of 2,719 jobs. And your footnote here, which says that there was a one-off increase of 2,031, that's actually still 700. You're still reducing 700 more jobs than that one-off increase for the administration of the COVID-19 disaster payments.
So Senator Rice, just before the CEO picks up, can I just say your question again demonstrates a profound, I say this with the greatest of respect, profound lack of understanding of modern day Services Australia services and support. The government, as we've said, is actually focused on how we deliver the services, which is why we've gone through extensive system and digital transformation processes, why we're transforming the service centres themselves, while we are digitising the experience, which people are with their feet. So have a look at the impacts. The sort of questions you're asking are really perhaps questions you would have expected from trade unions, a century ago, or even 50 years ago. This is a modern service delivery, and the focus is not on an old-fashioned head count and how the workforce is flexible and surges to meet the demand, but the proof is in the service delivery. And as I said in my opening statement, the proof is there for all to see that during the most recent floods and the payments, the extra 1.5 million payments that were made, generally within 1 to 2 days, and still delivering the other 130 services for that baseline ASL cap, they are doing an extraordinary job adapting to the 21st century.
I'm very happy to say that I am in fact reflecting the concerns of the modern day unions and the CPSU, who absolutely are advocating for the rights and for working conditions for their workers, and who have told me, and their workers tell them, that there are not enough of them, and that they are being pushed beyond their limits.
But Senator Rice, we are not. We're not in the the 19th or 20th centuries. We are in the 21st century,
and that's what's happening
and Australian
now.
Customers, what they care about is the level of service they get in the way they want it. And with the payments, 90% of people chose to do it online through MyGov. And they got it within 1 to 2 days if they had a correct claim.
I actually want...
So, this is such old thinking.
If only it was.
Have a look at the outcome, Senator Rice,
if only
of Services Australia, and not some old-fashioned union paradigm.
Ms Skinner,
Which
Ms Skinner, I think, was going to add something to the
working
answer as
people.
well. Ms Skinner, did you have something to add that you were going to before?
I think Senator Rice, you had asked about if we take out the 2031. I think you were drawing that there was still a change in the baseline ASL of about 688. In my first remarks, I pointed to the fact there are some inbuilt efficiencies due to the investments in the transformation that would see the ASL come down a little bit. But some of the ASL would also be associated with a reduction in actual workload, which we would expect to see from the reduction in the job seeker. So the baseline budget of Services Australia gets adjusted, or the topping up or not topping up, if you like, gets adjusted based on the customer volumes. But one point I thought we could make is that we don't expect attrition will take care of most of those reductions. Will take care of the reductions, but the other important point about our workforce model has been our ability to junior roles, and they often come in to help in a surge or or sometimes labour hire context, or as a casual APS employee, and around 2,000 of those people in the last 12 to 18 months who've joined the organisation as a permanent employee. So it is a pipeline, and people often will come in, work with us in ways that suit them, and if students and things like that in particular, and then they will pass through into the organisation if they'd like to stay with and keep their experiences with us.
Can I ask you whether Services Australia is still offering face-to-face services for all payments?
We offer face-to-face services for the social security and welfare payments and Medicare services. There's been no change to the face-to-face service offer. We have seen a vast reduction in the number of people who come into face-to-face services. The average sits at around 38 to 40,000 people a day. We still have taken 52 million phone calls. We no longer block calls. There is occasions where we do have to congest because the call volume might be a little bit high, but we have also
a little bit high, and they've got plenty of staff.
Senator, we actually, because of the change in the nature, people are no longer sitting on a rotary dial phone hooked to a wall. So we will actually let some people wait for a bit longer if they wish to speak to someone, rather than, as was a past practice, of simply blocking the call and not allowing it into the system. So if people do wish to wait to speak to an operator, they will get to speak to an operator. Around 8% of any of the telephony that's come into the organisation has been what we would call congested, which means we've given the customer a message that we're busy, and particularly in moments like floods, where you are prioritising assisting people, where those phone calls are coming from those areas where they have received the most distress, we might choose to manage our operations and balance it by seeking to put a congestion message up for some other customers and to ask them to come back later, or go to a service centre, or come in online if they have that capability.
And I'm sure I've asked on notice, but in terms of your statistics for the amount of time that you do have those congestion, what the wait times are. You don't think that, and
the average speed to answer year to date is 13 minutes and 56 seconds in the social security and welfare. We've handled nearly 40 million calls. We've pushed, if you like, 3.5 million congestion messages. That's not 3.5 million people necessarily. Some people will just continue to ring, but we have handled 40 million calls.
So it's
at a speed to answer of 13 minutes and 56 seconds.
Average wait time of 13 minutes. That's actually seems to me to be quite high.
The KPI is 16 minutes.
Going on hold to your bank lately, Senator Rice?
Or Qantas.
Or Qantas? Or many other services?
Senator Rice.
Is that, is that average wait time of 13 minutes, is that an acceptable metric?
The metric is a long-standing metric. We have moving you'll see in the PBS, the performance indicators to wanting to be able to provide a percentage of customers with service across all of our lines of effort within 15 minutes.
Senator Rice, we're going to go into a break in about a minute.
Okay.
It's your final question.
I was basically wanted to get to what the Minister says is the 10% of people who do need and want to continue to have face-to-face services, and I have had plenty of people contact me who say that it's difficult. In particular, there was someone who contacted me recently who had difficulty communicating because of their disability, and they were concerned about people in general, speech impediment, anxiety and hearing loss, and saying that their email. I'm wondering if something could be highlighted about the fact Centrelink/Child Support do not have a lot of face-to-face services available these days, nor email for people with disabilities.
So
making
Centrelink
it very hard to communicate with them, whether it be blindness, speech impediment, anxiety, hearing loss, ADHD, autism, etc.
Senator, if you'd like to provide us with customers' details, we can reach out to that customer and ensure that we are finding a way to support a customer who's got a range of concerns like that. There is not a face-to-face customer child support. There has not. That's not one of the
long-standing.
Why not, Ms Skinner?
It's not, I don't know actually, Senator, in the sense that it's that the program it's a telephony-based program because it's a managed arrangement between families. So I've sat on phone calls for that. It's a very excellent service, and people can call in, and the average, the speed to answer on that line is 3 minutes.
But for people who, for whatever reason, would far prefer a face-to-face service, and it may be because of a disability, it may be because of a hearing impediment, or for other people who just find it difficult to communicate via phone. It's not offered.
But if you'd like to provide us with the customer reference number of that person, we will reach out and assist them.
But I think it was more in fact, their email was in general saying that there is a problem with people with a range of disabilities. They weren't just emailing on behalf of themselves. It was in
Senator
general.
Rice, there's a couple of issues there, and I think we can unpack them in a couple of different ways. So in relation to what Services Australia does with their service offering for people going into a customer service centre, they can either turn up during when it's open, but increasingly Services Australia is encouraging people to make appointments, and so that when they get in, they've got an appointment and they can be seen straight away in accordance with that. Now, my understanding, CEO, is that is working very well. And I mean, I've seen it at many service centres. There is now a concierge, so people come in and when they arrive, yes, I have a booking, no, I don't, and then they're looked after. And if they've got any special requirements, then in terms of accessibility, they are looked after. So, but maybe.
And would they have to wait an average of 13 minutes to be on the phone to make the appointment?
Senator, there's a booking service for the face-to-face appointments. We value and respect people's time. That's why we give them the opportunity for appointments, particularly if they've got complex needs or they're likely to need a more complex support from someone who's more specialised, like a financial support officer or a multicultural officer or language or something else like that. If they do come in, we don't have all of those services available, we can arrange them. If they came in with a combination of matters around Centrelink, Medicare and child support, we would be able to coordinate supporting all of that, including supporting a phone call through to the child support component of the service that we offer. So there are many ways to support customers. And if we can use an appointment, that's the most supportive thing for customers.
And the other thing also that is available is social workers. And Services Australia now employ the largest amount of social workers in the nation. And again, I've seen them in action and they do make a big difference. So again, people can go online, they can make appointments in various ways, they can phone, whatever is most convenient for them. And they do have a range of services available to them. And the staff, I think, are brilliant, quite frankly.
We've passed our 9 o'clock break schedule time, so we'll take a short break and we'll resume at 9:15, so we'll suspend till then.
The response came back that it was commercially sensitive until the lease actions have been finalised, which I think if we were asking for very specific locations and such like that would be the case, but just asking for a location as in South Australia or in Adelaide, like you could have chosen to sort of divide it down like that. Can you explain to me why that would be commercially sensitive, given that we're not asking for the address, we're not asking for the dollar or any of the financial details?
Senator, I'll take that on notice to consider that if it's possible to provide anything like that in a rolled up way. I believe we felt we were replying to your question in a line by line sort of way. I think the broader point is that we have no plans to change the face-to-face service footprint. What we are doing is going through quite a terrific process of refreshing the sites that we have, and in some cases we are right-sizing them
or refitting them, or moving them, to a slightly different location if we've been, if that location is up the road, or in terms of negotiating a location. So there are no plans to adjust the service delivery footprint is fit for purpose. What we're doing is renewing, refreshing it, refitting it, and in some cases right-sizing it. Separate to that, there are ongoing leases around the office space, and we review those from time to time. I'll take on notice that broader point of can we provide you anything that's more rolled up as opposed to anything that's specific. I'd prefer to take proper commercial advice on that.
Sure, but I will maybe just draw your attention to the principle reaffirmed by the Senate in resolutions in 1971, 1974, 1980, 1984 and 1971, that there are no areas of connection with the expenditure of public funds where any person has a discretion to withhold details or explanations from the Parliament or its committees unless the Parliament has expressly provided otherwise.
I think it's safe to say that certainly the CEO understands that, and the CEO hasn't said she won't answer it. But I think it's quite appropriate to take it on notice to seek further commercial advice and get back to you.
Sure, and just to be clear, we're not asking for any financial details here whatsoever. So the commercial sensitive claim would need to be justified, or we would have to see at what point the Parliament has expressly given you permission to not provide the information. And I suppose in the absence of that, it would be, you would have to be claiming a public interest immunity over the information.
And we're certainly not doing, we're all very aware of that, Senator Grogan, so we're certainly not making, and I'm not making a PII claim at this point, but the CEO has taken that on notice and will advise further.
Thank you.
Any further questions, Senator Ackland?
Can I just have one follow-up question? I just wanted to ask Ms Skinner again, or maybe I'll start with the Minister. So Senator Rice asked about the 2,719 workers that were going to be cut. I think you said that there was no cut, Senator Reynolds? You said...
I said it was a misunderstanding of how the ASL works for Services Australia. Yep. And it does surge, and I think as the CEO said on page, what was it, 171?
Note L.
Very clearly explains the circumstances. But again, the workforce does vary greatly. It is not a static workforce by the very nature of what it does.
No, I understand that. I understand about the surges and that. I was just trying to clarify. What I thought I heard was that you said, no, it's definitely not a cut, but I thought Ms Skinner said that it was a reduction. So I was just trying to get that clarification.
So the detailed conversation, if you... Senator Rice had drawn out that even if you took the baseline PBS number of 21-22, which was 26838, and you look at the PBS baseline number for this year, which is 26150, she would have pointed out that that was still a change in the number, a reduction in the number of 688. I explained that that reduction relates primarily to two things. One is the ongoing transformation, which enables the work to be done in a different way. So you would see some slight reduction in the need for particular workforce there, and the customer volume changing, particularly around the job seeker. That would mean that there's actually less work. The point I made to Senator Rice was that any of changes we have a good, appropriate attrition in the organisation, so there should be no expectation of there being job losses. And I pointed out that, in fact, many of those who choose to stay with us when they have been in our non-ongoing workforce or in our casual workforce apply and actually win permanent roles with us over time.
So effectively that the reduction in the number you're saying is more through attrition
We
So
will
there will
manage the
be,
reduction from where that
Yeah.
number is, even with the additional 2,000. We will manage that with attrition back to the number that's in the
yes,
PBS.
but in effect, the actual number will be less, won't it?
The number
Whether you
will
manage
be,
it by,
the number will be less between the 21-22 baseline
Yes.
and the 22-23 baseline. But if there is a requirement for additional work, then we always have that conversation and the number goes up.
Yes.
At-
Yeah, no, I understand
for example,
that, but I
the
guess
money for the
if you look at the raw sort of numbers, then irrespective of how that's met, whether it be attrition or redundancy or whatever, the position is that there will be 2,700 and whatever, that number less. And then when you get to those...
It's about if you really want to compare apples with apples, you need to take the baseline number from the 21-22 PBS and the 22-23 PBS. The difference there is about 688, and the difference is because there was some ASL reduction that was appropriately programmed due to transformation, and there was some change in the amount of work we're expected to have around job seeker.
Okay, thank you.
So, Senator, I just would also make the point that this is not government-initiated numbers. This is, and the variations are driven by the operational requirements for Services Australia at the time, which is why last year there was an ASL increase of over 2,000 for a very specific purpose. So it will fluctuate according to the operational requirements and advice from Services Australia.
Thanks, Chair.
Any further questions? On that note, there being no further questions at this time, the committee's consideration of the social services portfolio... Oh, sorry.
Sorry.
Nearly.
Is almost finished.
It was nearly finished. Would you like the call again, Senator
Sorry,
Urquhart?
I will.
Very briefly, we nearly got
Sorry to
there.
get everyone excited. I will go very quickly. So, I now want to turn to the robo-debt scheme. On the 17th of February this year, Ms Skinner, you noted that you would go back and look at our requested documents relating to robo-debts options. Can you update the committee on the status of this, please?
I believe that the response to that question has been tabled with some additional information.
Okay.
You asked at the time about drawing out why we had said that there was quite a diversion of resources. And Mr Birramite can go through the work that was done with the Ombudsman. There was 3 reports. It was almost a continual engagement over 5 years. So the idea of a list of everything would be meeting notes, some documents, emails, records of conversation, to try to assemble all of that. What I would point out is that the Ombudsman's report themselves, the 3 Ombudsman's report, footnote a range of documents that Services Australia provided. So I think actually we've provided an explanation of the nature with which that engagement was done with the Commonwealth Ombudsman. It was a very open and transparent engagement, and they footnote the list of documents they've used to draw on their report. Is there anything you'd
Sorry,
add?
can I just ask in relation to, you said you'd given a response. When was that tabled to the question on notice?
I thought it was tabled.
Senator, is this question 8 from the February hearing?
Yes.
Okay, well, if I have misspoken, I will check, but I understood they were...
I don't think there are any outstanding questions on notice.
We're just asking when.
I'm asking when you tabled it.
So,
because I believe there was some that came through this morning.
so...
Even so, like...
They will have gone to the tabling office, is my understanding, in terms of the
Okay, the
process.
Secretariat has advised me that it was the 29th, so...
Yeah, so 29th, so earlier in the week.
Yeah,
Yes, that's
okay.
right. That was my understanding, sort of Tuesday or something, I thought.
Okay. Can I just ask why can't we be provided with something as straightforward as the executive minute that we've previously asked for?
Because the executive minute goes to the deliberations of government, is protected by cabinet in confidence. That's my understanding.
That's correct.
Yeah. Okay. Oh, look, I'll leave it there because I'll take away I'll go and find that response, which I haven't got to hand, and I'll follow up next week. Thank you.
Pick that up Thursday.
I'm going to try again and say,
Yes,
there being no further questions at this time, the committee's consideration of the social services portfolio will conclude for today. On behalf of the committee, I thank Minister Reynolds as well as officers from the Department of Social Services and agencies who've given evidence to the committee today. Thank the Secretariat, Broadcasting and the whole team in the building, and declare the hearing adjourned. Thank you very much.
Thank you very much. Thank you.
I bet you know that.